A very warm welcome to the inaugural session of the IHW Smart Hospitals and Diagnostics Summits and Awards. The Integrated Health and Wellbeing IHW Council is a premier health-focused think tank committed to advancing a holistic view of health that goes beyond the absence of diseases. We recognize that health is shaped by various factors, including the socio-economic and environmental influences. Guided by a vision of a healthier world, we believe that a healthy population is the foundation for all the human progress and our national growth. We begin now by showing an introductory video of IHW Council. Can we play the video, please? The introductory video. Thank you.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते छिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
Thank you. Ladies and gentlemen, this prestigious event, the IHW Smart Hospitals and Diagnostics Summit and Awards, is being organized by the IHW Council and is powered by Paras Health. We are honored to have the support of our gold partners, Apollo Hospitals and Ujla Cygnus, who have been at the forefront of providing world-class healthcare solutions. Additionally, we are grateful to our knowledge partners, the Association of Healthcare Providers of India, for their valuable contributions in enhancing the quality of healthcare across the country. We also have Artists for Her, the Asian Research and Training Institute for Skill Transfer, as our Women Health and Femtech 360 partner, helping to revolutionize women's health through innovation and training. And a special thank you to Evernile, our healthcare finance partner, for their continuous support in empowering healthcare institutions with financial solutions. Our digital outreach for this event is strengthened by IHW TV, our digital partner, ensuring that the conversations and insights shared here reach a broader audience. And ladies and gentlemen, today marks a milestone as we come together on a dynamic platform that has been meticulously crafted to serve as a meeting point for the brighter minds in healthcare. The Smart Hospitals and Diagnostics Summit is an opportunity for us to explore the transformative impact on technology, on healthcare, and the vast potential of smart healthcare centers and businesses in streamlining healthcare delivery. And for some more information regarding the same, we would like to present a small video before you. Thank you very much indeed. And now, ladies and gentlemen, to go ahead with the proceedings of the summit, I have the proud privilege in inviting on stage Mr. Kamal Narayan, CEO, IHW Council. Mr. Kamal Narayan began his career as a journalist before transitioning into entrepreneurship, and he co-founded Teamwork Communication Solutions Private Limited, which has been instrumental in his journey. And under his dynamic leadership, the IHW Council focuses on creating awareness and advancing for health and well-being. So let's once again put our hands together to welcome Mr. Kamal Narayan.
Thank you. Good morning, everyone. It's my privilege to welcome all of you for this very important, timely, and relevant forum which IHW Council has created to discuss, to deliberate the future of healthcare, which we believe is already rolling out now in our country. But before I kind of talk a little bit more about it, I would like to thank for all our partners, supporters, well-wishers who helped us undertake the journey which you just saw for last 10 years, and also to help us continue doing the efforts to bring together the industry, the thought leaders, the captains of healthcare business, and all those who contribute to the health of the people and the nation. So thank you so much for Paras Healthcare for their generous support in making this program happen. Also, Ujala Cygnus, I would like to correct the pronunciation just done by our anchor. It's not Ujala Cygnus, it's Ujala Cygnus. Thank you so much. Dr. Sujan Bajaj, founder director of Ujala Cygnus is here. Thank you for their support. And also, I'm thankful for Apollo Hospitals, AHPI, Artist for Her, and Everneal. Mr. Barun Javeri is here from the Everneal. All these brands, organizations, and people are somebody, we really appreciate the kind of work, the commitment and the passion they have been putting towards improvising and strengthening the health of this country. We have seen how diligently they have been building and putting together the building blocks of healthcare in India, and have gone to the places, especially my appreciation for Paras Healthcare and also Ujala Cygnus, for taking the quality world-class healthcare to the places where it needed most. The healthcare today is transforming at a very rapid pace. We are seeing that technology is playing a role in a speed, in a kind of rapidity which we have never seen before. Today, technology is enabling the most precise diagnosis. The technology is helping in ensuring that and assisting in surgeries, whether it's robotics, whether it's AI, machine learning, and a lot of other aspects of technologies are playing a very critical role in advancing the healthcare. The healthcare which our country is privileged to have matches to the standard of the best in the world. But when we are ensuring that the technology boom and the technology bliss ensures the healthcare reach to many in our country, we also need to look at the question that how do we bridge that gap which is leaving a lot of us also from getting the support of this advancement in healthcare. How we can take it and make it accessible to everyone who need it in our country. Technology can certainly help us bridge those gaps, and I'm sure today's discussions and deliberation we will be able to see many of those innovations, many of those ideas which can help take these technologies benefits to each and everyone in our country. And with that, I expect and hope that today's deliberation will help us unlock many ideas which can help us these gaps and bridge these gaps, and also help our nation to set the standards and benchmark of quality healthcare for the whole world. And with that, we look forward to a great enlightening day. Thank you so much for being part of it, and looking forward to your continued support and in strengthening the healthcare of our country. Thank you.
Thank you very much indeed, sir, for those warm words of welcome, and also for setting the tone of the discussions for the summit today. And now, ladies and gentlemen, it is time to hear from some of most visionary leaders and who are passionate for the healthcare sector. These speakers have played a transformative role in shaping the future of healthcare and diagnosis, and we are privileged to have them here with us to share their valuable insights. We are honored to have with us today Ms. Sujaya Krishnan, who is the former Joint Secretary to the Government of India, who brings a wealth of experience from her pivotal role in the Ministry of Health and Family Welfare. During her tenure, she played a crucial part in shaping the national health policies and driving key initiatives to enhance public health systems. Her leadership and commitment to healthcare reformative left a lasting impact on India's health sector. With decades of service, she continues to inspire through her work in policy advocacy and health governance. So let's put our hands together to welcome Ms. Sujaya Krishnan for the first keynote address of the summit.
A very good morning to each of you present here. I'm very happy to be here at the inaugural edition of the Smart Hospital and Diagnostics Summit and Awards 2024 as the keynote speaker. My sincere thanks to Mr. Kamal Narayan, CEO IHC Council, for this opportunity to address this august gathering. I deem it a privilege and honor, and I'm deeply humbled. I know I will be addressing a very informed audience, so some of it will be reiteration, some of it may be simplistic statements, but still. Although the term smart hospitals appear in scientific literature around the 80s, the concept of a smart hospital emerges systematically only during the last 20 years or so. Spawned by the administrative needs and assets management, this comes from my management background, I would say, the time motion studies, etc. A smart hospital was initially regarded as an organization with the mindset and procedures in place to reduce costs and accidents related to healthcare service provision, mainly via better assets management. Automation is still distinctive of a smart hospital. Only nowadays, automation extends to multiple levels. Traditionally, a smart hospital supports automation of administrative workflows to boost productivity, reduce errors, and shortage of workforce. However, with the current advancement in artificial intelligence and robotics, automation is now emerging in core medical tasks such as diagnostic imaging, patient monitoring, fine surgical procedures, patient nursing, prevention and rehabilitation. Achieving this complex automation requires breakthroughs in engineering and artificial intelligence, data knowledge, management, and analysis. Evidence from evaluations of related technology show clear benefits of technological interventions for valid, reliable, and accurate healthcare services, including screening, diagnosis, treatment, follow-up, and rehabilitation. Full and successful deployment towards the smart hospital of the future requires continuous advancements of current technology. The emergent smart hospital of the future has the potential to revolutionize healthcare delivery, focusing on enhancing the patient experience while offloading considerable amount of work to smart components operating mostly independently inside or outside the healthcare establishment. Given the current technology and the pressing healthcare problems, WHO has identified the integration of new technologies in health as the most pressing challenges of the 20th century, says Ghebreyesus. Digital health solutions have the potential to make healthcare more equitable. Equal access to affordable and competent healthcare has the potential to improve access outcomes by providing better quality of life, easing reliance on an emergency and late-stage interventions, and reducing early deaths. Digital technologies have the potential to play a critical role in efforts to improve health equity. However, rapidly advancing technology may also excavate exclusion, introduce biases when the digital divide, and continue to leave some populations behind. Inadequate access has several consequences for patients. Equalizing healthcare access and quality not only improves the individual and population level incomes, but also has a salutary effect on the larger economy. Good health, prompt and effective treatment allow patients to live active and productive lives. Indeed, improvements in global health has contributed to a third of all economic growth in advanced economies all over the past century. In order to sustain this growth rate, digital health solutions must be designed to reach previously excluded or unrepresented groups. Innovations can accelerate equity in digital health by aligning goals and actions to lever that prioritize diversity, equity, and inclusion. Digital tools can improve equity by increasing healthcare access, addressing unmet needs, and personalizing care for patients and considering the historical context within communities they serve. Digital technology can narrow the equity gap in several ways, from streamlining difficult to navigate medical bureaucracy procedures to eliminating travel and transportation factors from healthcare access. Access is limited by two chief constraints: affordability and availability. Healthcare treatment costs and limited insurance coverage are well-known barriers to care. For many patients, such as those in the rural areas, the limited availability of providers and the costs associated with travel and time away from work are a challenge in many parts of the country. To improve diagnostic imaging, access to handheld ultrasound devices that offer an imaging solution for rural areas perhaps is a very simple example where expensive machines like CT or MRI scanners or even X-ray machines are cost prohibitive. Such portable diagnostics and medical devices can transform care by reducing costs and expanding the availability of diagnostic services beyond traditional healthcare settings. Social determinants of health, such as access to clean water, nutritious food, safe housing and transportation, affect patients' ability to maintain good health and seek care where they need it. Digital innovators have the unprecedented opportunity to think more carefully about health equity and develop new solutions to entrenched healthcare problems. They must begin by considering how inequities in access limit the number of reachable patients, and by determining which dimensions of health equity their solutions could address, and then develop and implement digital solutions that align with the equity goal. Digital innovations that can move the needle on health equity will improve the lives of patients, increase the efficacy of the healthcare system, and have a positive impact on the greater economy. For example, a recent publication reviewed data from more than 2,000 studies evaluating telemedicine implementation in 53 countries of the WHO European region. Pooled results show a clear benefit of telemedicine interventions to reduce time to respond and reduce unnecessary visits to the hospital and unnecessary referrals to specialists. Although it may be difficult to predict what future healthcare may look alike, there is little doubt that the concept of today's hospital will be revolutionized by the current developments in information technology entering the era of smart hospitals. According to the Cambridge Dictionary, Femtech, or female technology, is a term used to define software and services that use technology tailored towards women's health. That includes fertility solutions, period tracking apps, pregnancy and nursing care, women's sexual wellness, and reproductive health care. Femtech was coined in 2016 by Ida Tin, a Danish entrepreneur who founded the Clue, a period and fertility tracking app. At least $1 billion has been invested in Femtech since 2016. There are numerous Femtech companies offering a variety of products throughout the world. How useful are these innovations in Femtech really? Or is it just another way for women to pay a premium for being women? The field of women's health isn't new, and the term Femtech only became popular in this thing. Since then, the field has grown. but women are still unrepresented in the health IT market. The field of women's health has been around from millennia. The Cahun Gynecological Papyrus, which addresses conception, pregnancy, and contraception, dates back to around 1800 BC and is one of the oldest known Egyptian medical documents. However, Femtech is a new term in women's health. When Clue founder Ida Tin coined the term, she legitimized an area of technology innovation that was ignored by investors. The introduction of Femtech was a step towards more open discussions. Eventually, the investment community recognized that women's health is a subcategory of digital health worthy of significant investment, aided by a public demand for improved gender equity in technology and venture capital, says Susan Solensky, director of the HIT Lab, Women's Health Tech. More women are joining STEM fields, which is leading to more women with skill to create solutions that didn't exist before. We are seeing a direct relationship between solutions to women's health and the number of women in STEM, says Brittany Barreto, co-founder and executive director of the nonprofit Femtech Focus. In Femtech Landscape 2021 report, Femtech Focus notes that Femtech includes reproductive, sexual, pelvic floor, oncological, bone, brain, immune, and heart health. Femtech products typically fall under one of the 6 categories: medical devices, software, therapeutic drugs, consumer products, consumer service, or consumer apps. No matter, Femtech companies are disrupting ways healthcare providers are reaching patients. Over the years, Femtech has evolved beyond reproductive health to encompass a broader scope of health. It can now refer to technology related to health conditions that affect women differently or disproportionately, such as autoimmune disease, migraine, and cardiovascular diseases. When 80 to 90% of the people with the disease or disorder are women, then it's a women's health issue, says Barreto. She says disease can also present differently in men and women, which is something that needs to be acknowledged when creating diagnostic tools. It is also important to consider how gender bias can impact care delivery in areas such as pain management and mental health. There are gaps in mental health access and delivery, and we know that women are nearly twice as likely as men to be diagnosed with depression. Gender is increasingly acknowledged as a social determinant of mental health, and more investment is critical for helping us understand the root causes behind these inequities. Many Femtech companies are providing individualized care programs with a unique understanding of the factors that affect women's mental health. Femtech companies have the opportunity to screen and monitor gender-specific mental health issues and provide digital interventions, according to Susan Solensky. She says Femtech can design mental health interventions for women experiencing antepartum and postpartum depression, premenstrual dysphoric disorder, complex menopause issues, perinatal mental health, eating disorders, traumatic births or miscarriages, or intimate partner violence or gender-based violence. To implement technologies that impact women's health outcomes positively, we need accurate quality data about conditions that pertain exclusively to women, such as contraception, fertility, maternal health, gynecology, menopause, and women's oncology and general health conditions where women's differences are not comprehensively known or studied, such as Alzheimer's, cardiovascular diseases, conditions, autoimmune diseases, migraine, and osteoporosis. Solensky explains that innovation depends on representations, which means transparency in which groups receive access to interventions and clinical trials are important. There are also new research channels being built at home, tech-based and monitoring solutions for a wide range of acute and chronic women's conditions that contribute to a growing pool of more diverse patient-generated health data and support the future of individualized care. While it is important to protect patient data and accurate collection enables accurate diagnosis, better care delivery, and more comprehensive research in addition to the overall reduction of costs. The definition of Femtech is still evolving. Much more investment in research and innovation is needed to understand and address the complex digital health sector. It is by no means a niche market. Healthcare organizations looking to adopt or implement Femtech must invest in quality data with accurate gender representation, which can be an issue in clinical trials. Individual entrepreneurs are seizing the moment to reimagine the future of healthcare that is simplified, personalized, affordable, and flexible. We must remember that health is human. To change health, we must change minds. Ida Tin and other industry leaders in the Femtech world assert that their technology aim to give users more control over their health and live lives while also advancing scientific knowledge and research about women generally. This technology also helps to destigmatize women's reproductive and sexual health, whose gender-specific needs have long been underserved. The current context of Femtech limits our understanding of what women's health means, because while reproductive and sexual health are vital and important aspects of women's health, there are many other concerns of women's health that must be addressed, including issues tied to the broad swaths of biology, psychology, and medical treatments. So much for academic and research this thing, but from a personal perspective, I think when we talk about smart hospitals and when we are within the Delhi NCR, we know that we have a suite of good institutions that are there, but probably some may say that within the government sector, we have not advanced so much, although we have the aims, and the current set of aims that are coming up are better equipped, better this thing to do. This may not be the case, say, with AIMS or maybe with Safdarjung, RML in this thing. But then we have to remember that government funds are meager and it's spread thin. But at the same time, it is the government that ultimately reaches the unreached. I believe that smart hospitals will remain smart when you have a conscience, when you reach out to this thing, keeping in mind the levers both of accessibility and affordability, and in ensuring that you will not leave this thing. And from my urban development days, I can say this is maybe I'm setting the wrong tone. Most hospitals have been provided land with a proviso that a certain amount of theirs will go into providing free care or subsidized care. Hospitals must learn to subsidize care and do that out so that the unmet needs of this thing. The smart hospital will be smart only as long as I think it is smart enough to fulfill its social obligations and its humanitarian mission, that is to serve and to help reach out to ensure that we have a healthy nation, a healthy population. Thank you. And before I conclude, I wish you all, I know I'm speaking to this very August gathering, distinguished scholars. I look forward to hearing from you all. I wish you all a very successful and insightful deliberations through the day. Thank you so much.
Thank you very much indeed, ma'am, for your enlightening words. Ma'am, your vision and leadership continues to inspire us all. And may I now invite on stage once again Mr. Kamal Narayan to kindly do the honors of presenting a token of gratitude and appreciation to our distinguished keynote speaker, Ms. Sujaya Krishnan. And ladies and gentlemen, let's once again put our hands together to thank ma'am for that wonderful keynote address we had from her. What a wonderful start to our summit. Thank you. Thank you once again. Thank you once again, ma'am. Thank you, Mr. Narayan, for kindly doing the honors. Ladies and gentlemen, our next keynote speaker is a highly respected healthcare executive who has been instrumental in steering one of India's premier healthcare organizations, Dr. Santi Sarjan, the Group Chief Operating Officer of Paras Health. She has been the driving force behind transforming healthcare delivery at Paras Health, focusing on operational excellence and patient-centered care. So ladies and gentlemen, let's put our hands together once again to welcome Dr. Santi Sarjan with a big round of applause. And over to you, ma'am, for the keynote address.
Good morning, leaders, colleagues, friends. It's my distinct honor and pleasure to address you today at this IHW Smart Health and Diagnostics Summit. You know, the theme of this summit is very close to my heart, because if we are to build a Swasth, Vikasit Bharat, healthy, developed India, we must embark on technology and embrace change and evolve, to the changing needs of the society. Today, as we gather, I am reminded of growth. And I would like to take a leaf out of, ma'am, what you spoke. You spoke about smart hospitals, the thought starting from 1980s. And I will share some of my experiences, of my decade back experiences in healthcare. Change is essential if we have to grow. Perhaps growth has different definitions for each of you, professionally, personally, organizationally. But for me, growth has been a change, right? Learning, unlearning, collaborating, evolving as I moved in my healthcare. So I mentioned earlier that, my experience in healthcare starts from many decades. I wouldn't say many decades, but many years before. I started my career as a nurse, and I understood if I have to grow, I have to unlearn, learn, change, think out of the box, and collaborate. Now, this propelled me to interact with, I think, many intelligent professionals throughout my career. I was providing bedside care to the patients, and I was constantly burdened by the overwork or the routine tasks that I had to perform. You have 2, 3, highly acute patients, and you have 100 other things to do, so you essentially don't have enough time to take care of your patients. And I constantly started thinking, how can I, as a provider, offload some of these tasks to someone else or some system? Since it was early 1990s, I'm revealing my age now to all of you, we didn't have IT. We didn't know what IT was, right? And here is the solution. We brainstormed and we said, let's computerize. We had few desktops, the olden times, and a mouse, and mouse wasn't there at that time. It was Windows, DOS, whatever. My group CIO is sitting here. He will know, maybe, perhaps, what I'm saying. So we said, let's computerize. So what we did is, whatever we didn't want to do, writing on the paper, printing, even printouts where later we would take photocopies at that point in time, let's put all this into system, computer. So we started writing down. We computerized all the forms. That was the first in my career. That was the first, thought or beginning of this IT infrastructure revolution, which I'm seeing now. So we put the first form, second form. Then we understood this is not enough. I don't want to write all the lab forms and write patients' names, etc., etc. So we created that form. So that started from there. We created all the forms in the computer. Then we printed it out after documenting, after putting it together. And we did manage to offload some of the routine works. And then here, okay, let's go to the next step. what we did is we started with doctor forms, then we started laboratory, lab, separate vertical. These are all fragmented, separate windows, separate systems. And we reached a level where we had 6 systems, and I still remember some of the names, very strange names. And then we put our hospital's name in front, and they would say, this is Hospital X and Azig C. So such names we would give. So then we got little smart, but then we also got little overburdened, because we had to open 6 windows at that point in time, you know, different login, different passwords. And then we said, let's integrate now. You know, let's call the CIO. At that time, we didn't have CIO. You know, the IT engineer we called at that point in time. So let's integrate this together. I want to open one window. I want one login ID, one password. I don't want to go to several pages, several systems. So what he did is that, you know, there were different tabs. If I had to go log in and then I press on lab tab, then I get, you know, to enter the data in the lab. So then radiology, blood bank, and pharmacy was the last, because it was very cumbersome at that point in time. So we integrated. Our job was easy. Then we started thinking of clinical algorithms, you know, the stroke protocol, the polytrauma protocol. Now, we didn't know how to computerize it, you know. So what we did is we wrote it, laminated, put it in the walls of ER, you know, ICUs, and we started looking at it, and then we started, you know, providing care. I left that organization. I moved on. I took a lot of interest in IT. Went on to study IT, not what the CIOs study, but, you know, whatever the providers, you know, the health care IT. So yes, here comes integration, here comes a bit of clinical knowledge. All the workflows were automated, clinical pathways were automated, and everything was done to take care of my, you know, requirement, systems requirement. That was the main intent, to offload work. But then today, when we speak about smart hospital, things have changed. It's not for me as a provider. Yes, I am second in line, but it's patient centricity. And I wouldn't even want to say it's patient centricity, because it's a summit of well-being here. It's human centricity, right? Everything, the beginning of smart hospital, according to me, started from patient centricity. How can we improve patient care? That was the prime motive of starting Smart Health. You can correct me if I'm wrong, but I think that's the fundamental reason why we are into, you know, smart health today. Patient is at the center, provider comes second. So for patient, what is the kind of experience that you want to give, you know, when he comes, or even before he comes to our system? A 24/7 hospital on his fingertip, you know, right from entering his demographics, booking, you know, appointment, registering himself, having access to the hospital's diagnostics, his discharge summary. That's what we wanted to give to the patient. So we managed to do that. Then comes the provider. You know, I don't want the doctors to sit there and write all these notes and then, you know, click or go turn pages without having time to focus or look at the patients and understand the symptomatology, right? Neglecting the patient. So second is the provider. Provider, when I say doctor, nurses, technician, everybody. Then I have the team here, like people like me. What's the efficiency that I'm creating? The operational efficiency. So patient first, experience, doctor or the clinical team, which is the provider, then operations. Then in operations, you know, how can I allocate my resources? How can I maybe optimize some of my key parameters in healthcare? And then, of course, I don't want to say that, you know, we don't think of revenue and EBITDA. Of course, that's needed for us to thrive. So that, right? So that was the beginning. Now, you know, I would say that we spoke so much about improving patient care, improving system efficiency, but the true measure of smart hospital will be only realized when you take care of maximum number of people, when you have maximum reach. Ma'am did mention, you know, it's not just for a privileged group of people who are in the urban city, but, you know, we believe at Paris Health that health is very local. Pandemic has taught us health is a local subject unless it's a pandemic. Healthcare has to be delivered at the doorstep of each and every Indian citizen. Imagine you have 40 crore people coming into organized sector through Ayushman Bharat. You have another 7 to 8, I don't know how many crores coming into organized health sector through senior citizen, privileges and insurance. Imagine the scope of work that all of us have, in future. So bringing quality healthcare to all Indians was the motive. And at Paris Health, we believe access to healthcare is the fundamental right of every citizen in this country. Access to healthcare. Now, when we say access to quality healthcare, it should be accessible to every citizen. So we have embarked on a journey, and I'm sure you all know that we are at 5 states, 1 union territory, and 8 hospitals now. Now, our thought or mantra or the aim of expanding to these geographies is not just to provide care to the local people there by creating smart infrastructure, but to reach out to everybody in that region, length and breadth of coverage through physical presence and through digital presence. And that's the reason we embarked on this journey. Now, I can tell you that when I joined, I've changed many organizations, maybe in my last 3 decades of healthcare, maybe 10, 11, 12 organization. When I was at the Washington Hospital Center, access through road to come to the hospital was very cumbersome. Somebody would not make it to live if they were commuting through road. And at the rooftop of the hospital, we had a helipad, and I would say that every hour we would have a trauma landing there, even before the touchdown. The vision, the ambition that I had that, all of the clinical flows to be automated, right? So I saw that happening there. Even before the touchdown, the entire system will be alerted. If it's a polytrauma, the lab, the radiology, the emergency, the pharmacy, whatever you need is alerted. As you put in the first triage data, systems which needs to come to the forefront will come. You don't have to call. You don't have to call somebody, come and take an X-ray, or take my patient to, CT scan or MRI, or take the patient to OT. The OT slot will be booked. The blood will be ready. So that is the kind of IT automation, alertness that I have seen. When I was practicing it earlier, I would have to make 10 phone calls and then still fight and argue and go to pharmacy and all of this. This was taken care and this has been, done. So I came to Paris Health, and I see that happening there. I speak a little bit of IT language. My 2 cents of IT knowledge, I would go and pick the brains of CIO, Vineet Agarwal, who's sitting here, and I'm like, look, I need this clinical algorithm in the emergency. I have a patient with infection coming in, I want that protocol. I wanted the same thing because I have seen it happen elsewhere. And, I'm so happy. I can see that happening. A trauma, when it comes, a trauma code can be actually, called for and everything will be ready. So we have many protocols, which is the algorithm, which is the clinical decision support built in already. For Paris, and I will talk very passionately about what I'm seeing, it's not just Paris, but I wish this for the entire country, and I'm sure many of you are doing it. It is, this is what is technology, this is what is integration, this is what is AI, this is what is machine learning, which was future, and I'm seeing it. And I can very proudly say that, we are smart hospital today, not future, because, the machine learning, the AI that you talk, we have it today. Our system is fully integrated. We have the HIS, the EMR or EHR that you call, we have the ERP. Everything is kind of ring-fenced and bound by the Power BI, sitting anywhere. I can understand and my team can understand what's the input parameters, what's happening in the hospital, where do you really need to intervene, So because we have data which is unorganized, we have information which is organized, we have insight which is analyzed, and we have, this action taking, we can take actions real time. We don't wait, post ex post facto. We take action after a month or so. We take decisions immediately. So our system is super embedded with generative AI. If a discharge summary has to be typed, no, we don't do that. The super generative AI actually picks all the pages, which whatever is appropriate, and gets the discharge summary, ready. Because all of us in healthcare will know that, writing a discharge summary is the most difficult, mundane task. We'll keep patients for 3-4 hours for that. But we've taken care of that through generative AI. Having said that, whatever you do today is not enough. You have taken care of your system, then your patient, but what about Aam Aadmi? What about people of this country? Unless and until we come together as organizations through summit like this, collaborate with Government of India. I spoke about Ayushman, I spoke about Healthy Bharat, I spoke about senior citizens. Look, we spend 3 to 4% of our GDP in healthcare. Imagine our economy is booming. I don't know how many, I'm not an economist, but I don't know how many million, trillion it is going to be. Think of 3 to 4% of that, and I'm sure it will be 6, 7, 8% going forward. So think of the big work that we all are responsible for in future. So smart hospitals for yourself and your patients and your hospital is not the solution, not the only solution, unless and until you sit, collaborate, don't reinvent the wheel, come together, and with government partnership, take this forward. So thank you very much. On behalf of the entire Paris Health, I wish you a very, very successful, intelligent collaboration, thought leadership going forward. Jai Hind.
Thank you very much indeed, Dr. Santi, for your insightful address. Your leadership in integrating the innovation with patient care has been truly inspiring. And may I once again invite on stage Mr. Kamal Narayan to kindly do the honors of presenting a token of gratitude and appreciation to our eminent keynote speaker, Dr. Santi Sarjan. And thank you very much indeed, ma'am. Your thoughts on the future of healthcare delivery have provided us with a clear direction for the future. Thank you once again. Thank you, Mr. Narayan, for doing the honors. And now, ladies and gentlemen, I have the proud privilege in inviting our next keynote speaker, Mr. Sachin Bajaj, who is the founder and director of Ujala Cygnus Healthcare Services. He is known for his leadership. Dr. Sachin Bajaj. And ladies and gentlemen, he is very well known for his leadership in building a network of hospitals and provides world-class healthcare while focusing on patient centricity. So let's put our hands together to welcome Dr. Sachin Bajaj, founder and director at Ujala Cygnus Healthcare Services, for our next keynote address. Over to you, sir.
Thank you very much. Warm greetings to all of you, and special thanks to my friends Kamalji and Nikki for organizing this wonderful conference and having all of us here. Continuing in the tradition of people who speak about 80s and 90s while starting their talks, I'll also start from the same time. We're all dinosaurs in healthcare, and we've seen technology really transforming the facet of healthcare completely from what it was. I come up from a time in the 90s when I was training. We didn't even have computers commonplace, let alone any smartphones or any other devices on our hands all the time. We had physical books. It may seem like an impossibility right now to most of the young people sitting here. When I started out our first hospital, I remember I used to be the clinician there as well as the manager, And I used to call myself P2P, right? PN to promoter, everything I had to do myself. So I remember getting up at 2-3 a.m. at night many times a week and going to the hospital in emergencies to see normal ECGs, because the residents could not really identify. They did not have any clinical decision support systems. They did not have access to Google at that time. And they could not really read the ECGs very well. Reading an ECG is an incredibly complicated task. Seems like a very simple squiggly line, but it holds a lot of mysteries inside it. And I used to go there at night. Patient doesn't seem right, sir. He is not improving. Chest pain is not going. We've given all kinds of treatments. So I would go there, and one day I was describing my pain to one of my fellow physicians that, this is happening, and last week I had to go 3 times to read normal ECGs. And he said, oh, don't you have WhatsApp? And I said, what's WhatsApp? He said, it is an ECG transmitting software. It is a new thing that has come in, and I have discovered it, and you can transmit ECGs over it very, very easily. And that is how I got exposure my first time to technology. And technology has ways of surprising you, right? It is always surprising you many times on how quickly it can take over your lives. Seems like a very, very few years ago that I did not even know WhatsApp was, and now it is completely integrated into our lives. Has anybody of you heard the name Samuel Langley ever? Right? Not many people have heard of him. Have many people heard of Wright brothers? I think everybody has heard of them, right? So Samuel Langley was actually the first person who tried making an aeroplane, and he had the full support of the US government behind him. In 1903, when he was developing the plane, he had got a grant of almost $1 million from the US government. That is how popular he was, how established he was. And of course, he could not get the planes off the river. He tried catapulting them from the river Potomac. On October 8, I think his first flight crashed. On December 3rd, when he tried his second model, it did not even take off, let alone crashing. It sank the boat also with it. So on December 8th, the New York Times had a big headline which says it will take between 1 million to 10 million years for humans to build a flying machine. And I quote, it read something like this: it will take 1 million to 10 million years of concerted efforts of mathematicians and scientists to build a flying machine. Precisely 8 days later, on December 16, 1903, the Wright brothers took their first flight. So technology always has a way of surprising us on how quickly it can make us look like fools in front of society, how quickly it can make experts look like fools. The second thing we hear about technology always, especially in healthcare, and I'm sure I see a lot of providers here who are trying to provide apps and other technology-based solutions, products to doctors. And we do a lot of interaction with them. We welcome them into our hospitals a lot to try their products, to try their solutions. I also sit on the board at IIT Delhi, the FIT board, the Foundation for Innovation and Technology Transfer, where we mentor a lot of young scientists to deliver technology. The second thing I hear very commonly from them is, oh, doctors are not ready to accept technology. We've made such a good product, doctor is not using it, doctors are not using EMR, doctors are not using, technology. That is a common gripe I hear. And please let me assure all of you technology providers here that nothing can be further from the truth. Doctors have been using technology ever since the time the accountants were filling in registers with their accounts. We were using ultrasound, CT scans since that time. Nobody had heard of technology in any other industry. Even our stethoscope is a piece of technology. As I said, WhatsApp was something that I discovered to transmit ECGs, not other messages. So we are always happy to take on technology as long as it serves a purpose to us. If you've built something and the doctor is not using it, please do not blame the doctor. It is not the doctor's fault. We need to tweak our product well, right? If you see a girl crossing a street in the rain that is happening outside and she's getting all drenched, What do you think that girl needs? Any answers? Umbrella, yeah? That is the most common answer. I hear this question all the time. Umbrella, right? Everyone thinks of it as an umbrella. Now, what is the problem with this answer is, once we have decided that the solution is an umbrella, all we can offer that girl now is either a red umbrella, yellow umbrella, green umbrella, pink umbrella, foldable umbrella, long umbrella, button wala umbrella. That is all our solution will center around, because we have decided she needs an umbrella. Take one step back. What does she really need? She needs to cross the road without getting wet, right? She needs to be dry while crossing that road. Now, think of the solutions that can come out of this, right? Huge solutions. You can give her a car to cross that road. You can buy a Rolls Royce for her and cross the road. You can build a covered walkway entirely, saying that we'll build this path for you. You will get, cross it while not getting wet. You can also, on the other hand, offer her a tarpaulin worth 2 rupees ki sar pe rakho ma'am aur paar kar lo. So your solutions now go from 2 rupees to 5 crore rupees, right? There's a wide range of solutions you can offer. She may be too rich and discard that tarpaulin, that, oh, this is too dirty, I don't want this 2 rupee solution, But she may also say that I don't need a Rolls Royce to cross the road, it is too expensive for me. Why would you, give that to me? I don't want to pay for that. If you have a solution that you fall in love with and expect the user to use it because you feel is the right solution, is not really the way to build innovation, to put technology into widespread use. We all say कि आजकल के बच्चे बहुत smart हैं, देखो iPad चला लेते हैं, phone चला लेते हैं, they're so smart using technology. It's not the bachas who have become smart, it's the engineers who should get the credit for making those iPads and phones so user-friendly. I remember in my time when we had to just switch on the computer, I had to write like a 4-line code to just get the first thing in, right? Basic language सीखना पड़ता था, एक C-tran सीखना पड़ता था. We used to learn those languages in computer class just to make sure that we could switch on the computers. So it is the engineers who are building this. The credit should really go to them. But we doctors have to partner with engineers into building the right technology, the right solution for ourselves. We have to guide them, we have to handhold them, we have to work with them. Doctors need to be at the forefront, and not just doctors, all paramedical staff, nurses, all people who work in healthcare have to be at the forefront to make sure that our hospitals are really smart, our hospitals are really patient-centric, and our hospitals are really, really built on the appropriate and accessible and affordable technologies. People always ask me, do you really think that technology will one day replace doctors completely? I don't think that is the right answer. I don't think technology can ever replace doctors, but I am sure that doctors who use technology will definitely replace doctors who don't. Thank you very much once again for having me here. Wonderful speaking to all of you.
Thank you very much indeed, sir, for that insightful keynote address. And we certainly appreciate your dedication to ensuring that quality healthcare reaches every corner of our country. And once again, inviting Mr. Narayan to do the honors of presenting a token of gratitude to our distinguished keynote speaker, Dr. Shuchit Bajaj, founder and director. Of Ujala Cygnus Healthcare Services. And ladies and gentlemen, on that note, may I once again invite on stage all our keynote speakers, Ms. Sujaya Krishnan and Dr. Senti Sarjan. We can have a group photograph. Requesting you, sir, to kindly stay back for a minute while we have a group photograph, sir. And ladies and gentlemen, I would request everyone to kindly remain seated as we straight away move towards our first plenary session, the panel discussion session. But before that, we would like to present before you, while we are setting the stage also up for the next session, a small video on our upcoming event in Dubai on 21st of September. It is the 10th IHW Summit and the Global Health Leaders Awards. So let's have a video introducing our next event, which is being held in Dubai on 21st of September. Thank you very much indeed. Let's once again put our hands together for all our dignitaries. Thank you very much indeed for sparing your valuable time and being here. Can we play the Dubai video, please? Thank you.
At a time when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York, IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time.
Thank you very much indeed. Ladies and gentlemen, this is our next event that is coming up in Dubai on 21st of September, the 10th IHW Summit and the Global Health Leaders Awards. We are looking forward to your participation in this event. I would once again request everyone to kindly remain seated as we are setting up the stage for our upcoming session, which is a panel discussion session on future ready hospitals and diagnostics, navigating the era of health 4.0. So ladies and gentlemen, we are all set to move ahead with the proceedings of the next session, and I have the proud privilege in inviting on stage first our distinguished moderator for the panel discussion, Mr. Varun Javeri, Managing Partner, Evernile. A very warm welcome to you, sir. I also have the privilege of inviting our distinguished panelist. May I invite Dr. Naren Sehgal, Secretary, AHPI. A very warm welcome to you, sir. Inviting Mr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonasite India Limited. A very warm welcome to you, sir. Inviting Dr. Nilesh Shah, Group President and Head of Science and Innovation, Metropolis Healthcare. A very warm welcome to you. Inviting Dr. Ashish Chaudhary, Managing Director, Akash Healthcare. And ladies and gentlemen, once again inviting on stage Dr. Shuchin Bajaj, Founder and Director of Ujala Cygnus Healthcare Services. Ladies and gentlemen, esteemed dignitaries and honored guests, as we continue this exciting journey into the future of healthcare, we now move into a panel discussion which will focus on the critical topic that is shaping the healthcare landscape, the future-ready hospitals and diagnostics, navigating the era of Health 4.0. This session will delve into the future of healthcare business, revolutionizing hospital operations, diagnostic processes, and patient care. Technologies like artificial intelligence, the Internet of Things, IoT, and the telemedicine and robotics are redefining how healthcare is delivered and experienced. Our panel of experts will engage in the thought-provoking discussions exploring how these transformative technologies are helping to build a more patient-centric and future-ready healthcare ecosystem. The insights shared today will certainly provide a valuable guidance on how hospitals and diagnostic centers can leverage these advancements to drive positive change and stay ahead in the rapidly evolving era of Health 4.0. It is my honor to introduce the dignitaries for the insightful session. Ladies and gentlemen, we have on the dais with us Dr. Sunil Khetpal, Director, Association of Healthcare Providers of India, AHPI, who has been at the forefront of healthcare innovation and quality improvement across the country. We have with us Dr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonosat India Private Limited, a key leader in advancing imaging and diagnostic solutions with cutting-edge technologies. Dr. Nilesh Shah, Group President and Head of Science and Innovation, Metropolis Healthcare, who has been a driving force in revolutionizing the diagnostic services through innovation and scientific excellence. We have with us on the panel Dr. Ashish Chaudhary, Managing Director of Akash Hospital and a visionary leader who has been transformed his hospital into a model for future-ready healthcare services. And of course, we once again have on the panel with us Dr. Shuchin Bajaj, Founder and Director at Ujala Cygnus Healthcare Services. And ladies and gentlemen, to moderate this session, we have Mr. Varun Jhaveri, who is the Managing Partner at Evernile, who brings vast experience in the intersection of healthcare and technology, and he will guide this dynamic discussion and ensure we explore all the vital aspects of Health 4.0 and its impact on healthcare. And the time duration for the session, sir, is approximately 1 hour. May I now hand over to you to kindly carry forward the proceedings.
Thanks a lot for that. I hope I'm audible. Yes, I am. Morning, ladies and gentlemen. Really stoked to be here. Thank you, IHW. Thank you, Kamalji, Nikki for giving all of us this opportunity to be here. Really thrilled to have this blockbuster of a panel. It's a very exciting mix. We have providers. We have a couple of gentlemen, Dr. Bajaj, Dr. Chaudhary, who are leading very established private healthcare organizations. We have Dr. Nilesh Shah, who is the president of Metropolis, one of the leading diagnostic chain across the country. We have Mr. Sehgal here, who has been running his facility for quite some time, very renowned laparoscopic surgeon based out of northern part of the country. And then we have Dr. Nitin Gupta, who is the managing director for the Fujifilm, so one of the technology providers. So it's a very interesting sort of a mix, and the objective of the panel is to get diverse perspectives on the overall sort of the sector, what is happening, and to probably see that how the sector is going to evolve. I think before to start off the panel to learn about some of your insights, I would just like to set up a context. in the last decade that I've been working in the, healthcare, I have seen so many panels, which have been discussing very similar topics, how technology, Dr. Bajaj, mentioned about that, Dr. Santi mentioned about that, that technology in healthcare, it is not a new sort of a conversation that we are having. What is very interesting that I am seeing is that probably the conversation, the topic is something that we are having, but the timing and the transition that we are seeing right now, it is very different. And I will talk to you through some of the macro trends that I have personally witnessed, that why I think that this is perhaps that inflection point in which the technology of healthcare is really gonna go on a very upward trajectory. Some of those big macro trends happens to be the fact that the entire ecosystem, that is payer, provider, technology providers, healthcare providers, patients, regulators, association, all of them, they seem to be converging on the same page. So if I look at the technology per se, finally now we do have things that are not only theoretical. Like, 5 years back we used to say that, there would be artificial intelligence which would be coming. Now we are at a cusp where the artificial intelligence, the ML is already here, where we are using them on a day-to-day basis. Now we are talking about generative AI, we are talking about robotics, we are talking about ML. So these things have now become reality. So the technology, what Dr. Bajaj also mentioned, that the technology, the way it is advancing, it is already here. So now it is something that is available for adoption. So that is a big sort of a macro trend across the globe that is happening. The second big sort of a macro trend is with regard to the patient's awareness and adoption. And a large part of it can be attributed to how, COVID really changed the behavior. Whether it was Arogya Setu or, eSanjeevani, the telemedicine platform, which has done crores of teleconsultation. Patients have now become more warmed up to adopting technology, which makes lives easier, I guess, for, doctors, healthcare institutions to really build technology for the last mile patient. The third part, which I think is extremely important, and this is what I feel that healthcare is now having its moment, like what happened in Fintech back in 2016-17, when the Beam came out, when the UPI came out, is that the government is very proactively trying to engage its efforts and nudge the providers to go on a trajectory of digital health. The Ayushman Bharat Digital Health Mission, or the personal health ID, the health information registries, the entire ecosystem that is getting, sort of a place in the entire healthcare ecosystem, it seems that the government is also now ready to really bring about this digital health revolution. So if you look at it, the technology, the patient, the government, and at the same time, even the regulation, everything is now coming on the same page. To kick off the panel, just to give you some sort of a food for thought, just a couple of very interesting data points that I thought that how is it shaping up and how we are right now. If you look at any capital expenditure, investing in any infrastructure, physical infrastructure, bridges, dams, anything that we look at it, every 1 rupee, it gives out a benefit of around 2.5 rupee as compared to any operating expense. But if you look at healthcare investment, every 1 rupee is going to yield you a benefit of 4 to 5 rupee, and this is economic benefit. And this economic benefit is encapsulated by the providers, by the patients. So it is not only about the, about the narrative or about your operational efficiency. It makes sense in terms of unit economics also for everyone, for the patient, for the provider. And at the same time, one of the survey that happened across 2,000 providers, almost 90% of healthcare providers, they feel that adopting digital health or digitization is their one of the top-most or one of the high priority items. So with that, I'm sure there are going to be similar sort of inclinations toward that. I would love to hear some of your thoughts, how you are building, how what are some of the challenges that you have seen through. So let me kick off this particular panel. The way we would want to do this is we have an hour to do this, of which probably I've taken up 5 minutes for that. I'm sorry for that, but we will use rest of 40 minutes for moderated Q&A, and if it is okay, we can probably use the last 15 minutes for some of the open-ended Q&A, because we have got a very interesting set of audience. So we'd love to take some of the questions from you. Is that okay? Okay, fantastic. All right. So let me actually kick off by you, Dr. Nilesh. Metropolis, huge chain, you have been associated with the group for a very long time. And every time that I think about a diagnostic, there are a lot of moving pieces. You have collection, you have a hub and spoke, you have your diagnostic setups, you have, reports. So there's a lot of digital infrastructure, that has been put into place. Take us through how Metropolis as a chain, how have you embraced digitization, and take us through one or two very interesting sort of case studies that you might have come across, and what has that done for the group, how you have really become the pioneering group for really adopting those particular technologies. Would love to hear your thoughts on that.
Sure, thank you so much, IHW and Varun. I think I want to give reference to two talks, one from Dr. Sajan and another from Dr. Bajaj. It took me down memory lane. They spoke about 90s, but I'm from 80s. So mid 80s, I remember, where we had just a PC, not even PC, XT and AT. We are talking about not current languages used, but I'm talking about COBOL, Fortran and Unix and DBase and Fox Pro. I have come from that time where a lab used to be called computerized lab. Even if they have a computer, just print report. I'm coming from that time, and I see huge journey till date, and it is improving day by day. Adoption is improving. It is becoming easier to roll out within the group. It is becoming easier for adoption by doctors and patients. I'm coming to that journey. If I have to tell you what all is happening and what is expected to some extent, I think we need to divide into 4-5 things, and we have to first think of the objective. What is the objective of having a smart lab? I'm going to focus on lab, being a lab professional. 3 things we want to do. 1, improve quality. 2nd, improve efficiency. And 3rd is improve cost. These are the 3 core objectives, and which can touch various areas in your lab, which can happen through automation adoption. It can happen through process improvement, and it can happen through improvement into your quality system altogether. And I'm so glad to tell you that in 40 years of my journey, I think it has touched each and every area. And I want to mention some of them, which probably is a repeat for you, but I must tell you the depth has gone much deeper. If I talk about equipment side, we had a lot of automation equipment, but the depth, the productivity, the connectivity, and the scale, and the menu, which is now coming day by day, is much larger than what used to be. I remember the time where every test was manual. I come from that time, we had just a calorimeter to read things, but everything was manual, right from there to semi-automated analyzer to fully automated integrated analyzer, and where there is a connection through a total lab automation where multiple analyzers are connected. You just load sample at one place and it will go to respective equipment, get analyzed. There is a backup equipment also part of it, and you just get an answer. And these equipments are so smart where if there is any fallacy, any issue, it will stop and it will move to another equipment, and you won't end up giving a wrong result. In fact, it is a time where even sample integrity is checked. You don't have to worry about getting analyzed a wrong sample, a bad sample. Even sample integrity gets checked. Coming to quality system side, now the time has gone where a quality manager has to see individually QCs. Auto QC is also a factor where QCs are seen automated. Even things are moved to moving averages where trends are seen, so that nothing goes wrong even after QC has passed. I think that is what we are enjoying today, and things are improving day by day. The rules, algorithm, everything is improving so that you have much finer and good quality result and very efficient. The time is coming, the time has come where your rechecks are minimized. You don't have to unnecessarily keep rechecking because equipments are so robust, they give reproducible result. So, and you have huge data available. Whatever you have done, whether this process makes sense or not, you can change the process. Let me also come to the productivity part on people's knowledge. We used to have a senior scientific manager at every section who will make decision whether result is worth passing or not. That knowledge has already gone through AI, where all this happens automated. We have set the rule and equipment uses the rule to technically validate the result. And now when with something like CDS, where clinical decisions from medical doctors, so medical validations are also happening now, rule-based, automated. This is one piece I'm telling you. The second piece which I'm more excited about to tell you, where pathologists, microbiologists, they are very, very important for any lab, but day by day, so many support systems they are getting through AI, where even subjective decision making, where a microscope is to be very important for pathologists or microbiologists, is also getting replaced. Today, CBCE, automated reading, where image analysis happens, cytology happens. It has moved to surgical histology, automated immunofluorescence, automated reading. Now, histopathology was something which is very core to any pathologist, is also day by day up to scoring system is now getting available. It's being validated by many of the large labs, and it is going to become a reality. I won't take long time. I know we have a very good panel and I want to hear them, but very exciting time has come, and it is even more exciting going to be in future.
Sure.
Thank you so much.
Super interesting. Thanks a lot, Dr. Nilesh, for that. I would actually come to Dr. Chaudhary. After a lab, I would love to hear an opinion from a private healthcare provider. Dr. Chaudhary, I know that Akash Healthcare, not only you have been doing some fascinating work in India, but now you also started international expansion. Would love to hear your thoughts on how do you think technology has been an enabler, and the way probably that we would love to hear is that what were some of the bigger challenges that you used to be very concerned about, and then you thought that when you plugged in some sort of a technological component, it really helped you. Would love to hear on that.
So starting from 2017, when the hospital was about to go live, and looking at the overall inclination towards a digital hospital, so I was also of the opinion that a paperless environment can be a great thing for any private healthcare institution, but the reality on the ground is very different. And when we started, of course, very rightly pointed out by Dr. Bajaj that doctors would outrightly reject those technologies which are not contributing to either improving the speed of treatment, or the outcomes can be better, or the ease of executing the treatment is met by any technology. So EMR adoption was big as it fell flat on my face when everybody, including myself, was not on EMR. And it took me a while. We stepped back and we thought, okay, what are the primary goals of a hospital was just kick-started, have new doctors, the patients have just started to trickle in. So first of all, it's the matter of survival. So whatever which, the technology which is at grassroots level is required for the seamless billing process and all those basic paraphernalia was added. EMR, fortunately now, it's more than 98% adoption, every doctor is using. And why they're using the app also because they find easy, even on the go, they're able to modify the treatment, they see the critical value alert, and they're able to take a informed decision. So wherever we have been able to connect the technology with some improvement in their patient care or reducing their time being invested so that they can cater to more patients, I think that has yielded a lot of positive response from the doctors. And thereafter, you keep on adding robotics. Of course, there is a learning curve for a surgeon, but once they have gone through that curve, sky is the limit. We recently crossed 100 cases. In fact, the laparoscopy surgeon, they have raced past all other surgeons to adopt robotics because they found the times almost matching with the laparoscopy, and the results were good. There were hardly any incision being given, and patients are going without any complication. So I feel that for a private enterprise, as of now, the investment on the IT system is still low. We would expect, unless it's driven from the top, you can't really focus more on the IT because the funding is required for executing all the app-based platforms. And in fact, there has been few areas where the laboratory is one where we have been able to seamlessly integrate with our HIS system. The critical alerts go directly to the patients also, as well as the doctor's smartphone, and that brings a lot of value in timely institutional treatment. And the seamless transmission of the laboratory along with the treatment modification, along with some emergency EMR modules, that has given significant help to our ER physicians, who sometimes they, in the rush of things, may miss out on few critical investigations, and because of that module available, so that checklist based system provides them with the holistic care which any emergency patient would require. So I think technology has a role to play. The 4.0 healthcare, what has been the motivation behind this panel discussion, I think we have to look at every aspect, whether it is the telemedicine or robotics or any other technology adoption. It has to be taken with the only core thing in mind, that it has to transform the patient care, it has to improve the outcomes. Only then it is sustainable, it's going to stay for a long time.
Thank you. Very, very helpful insights, specifically from the fact that how you have done a lot of bottoms up and you have scaled using technology, and the fact that you gave enough time for the technology to become mature, and now it is on a sort of a scaling trajectory. Let me come to you, Dr. Sehgal. Not only you have been a laparoscopic surgeon, but you've also been doing a lot of training of young surgeons, as I understand. I think with technology, especially if you can get the doctors to embrace the technology at their training sort of a trajectory, it can become much easier for them. How do you see that? How do you inculcate that in a part of the training that you do for younger surgeons? What are some of the key skills that you are inculcating, and how do you see the new sort of batch of doctors? What is their sort of inclinations towards this adoption of technology? Would love to hear from you.
Thank you. See, I think this bit of use of technology really came up, became popular, and we started using it post-COVID. It is then that, the data was really used in a fantastic way, and integration with CoWIN was such a great success, I think, for this country, that we really started understanding the use of technology. For trainings, I think the way now Zoom and webinars and all those things have come up is the very first and basic things which can make your whatever material you want to show, whatever you want to train, you can use it. Second thing is the virtual now it is being introduced in the whole of the country. I think this is going to help us train more and more number of people in a very standardized way. Otherwise, the training used to be very variable. It would be dependent on one teacher, and everybody would be learning what he's teaching, the other one would be teaching something else. It may vary a little bit, but this will standardize our mode of teaching. That is, I think, what is going to come in a big way, and it is being seen.
Thank you. No, absolutely. I double down the fact that COVID was like a big sort of in terms of the behavioral change towards the technology. Thank you for that. Dr. Bajaj, let me actually take up the same sort of the thread that you started with regard to the adoption part from a healthcare provider. I know that you have expanded across the country. Congratulations for that. I think 30 facilities now, and technology has been like a big enabler for that. And there are a lot of technology providers which are here in the room. So taking forward from what you said in the keynote, a prospective technological provider wants to appeal, to a set of healthcare providers. What do you think, the technology provider should keep in mind? How do you think, that should be structured? So would love to understand that, and then, from you, Dr. Nitin.
Thank you, Varunji. So as I said earlier during my talk, and as Dr. Chaudhary also emphasized, that doctors usually are have no patience for things that do not help them to either solve for saving time or saving money or increasing better patient outcomes. These are the only things that we are concerned with usually. If there is any other thing that is brought to us which gold plates the practice or which looks and feels fancy but has difficulty in adoption, doesn't save us much money and leads to only incremental effects, not transformative effects, you'll find it very difficult to penetrate into the healthcare system, right? And as I keep reiterating, doctors are very, very technology friendly. As we've seen from the laboratory example that Sir gave, I mean, as we see from all diagnostics are now, I think, as technologically embedded as any other industry in the world. Healthcare delivery as such has not really kept up with that, has not really kept pace. So I think we need 2 or 3 things that really will help us. First, as Dr. Chaudhary said, a very seamless EMR, which does not take too much time. As Dr. Sajan also mentioned, she is using generative AIs to deliver discharge reports so that, the 3-4 hours taken to deliver a discharge report to the patient is cut down by a lot of time, and that's why I think they've adopted it very well. So somebody who can come in and assure that, there will be no errors in it, and you can actually trust those discharge reports. If somebody can come in and say that, you can use generative AI and I will make sure behind the scenes that there's nothing wrong in it, I think that will be adopted very, very quickly. Something else that can be adopted very quickly, I think, is analytics for us. Because gone are the days when the gut feel of the promoter would decide what to do and what not to do. That was how most hospitals went, right? That I feel this is the right place, I feel this is the right department, let's start it. Now that is no longer the case. If you want to run like we do, multiple hospitals across multiple states, across multiple ecosystems, and as Dr. Chaudhary is expanding even across international borders, you can't just trust your gut feel to do things, right? Because the costs of failure will be very high. I keep telling people that please do not use your gut feel as a tool, right? I mean, it's very difficult to trust it because you may trust it yourself, but it cannot be replicated. A tool is something that works in exactly the same fashion every time, is predictable, and if you hand the tool to somebody else, it should work in the same fashion. So a screwdriver is a tool, right? If you do it clockwise, the screw will turn in. If you do it anti-clockwise, the screw will turn out, and every time it will do the same thing. And if I hand over the screwdriver to you, it should do the same thing. The gut is not that, right? My gut cannot be handed over to you to make decisions. So right now, what we are at the technology stage is information is very, very wide, deep, exhaustive. You can get all kinds of information, all kinds of data can be generated on what you are doing. Some hospitals, like Dr. Santi said, have graduated on to developing insight from that information. So you do analyze all that information and develop insight into what is happening exactly, what is going wrong, where do you want to intervene. If somebody can come in and actually transform that insight into foresight, so information to insight to foresight, and actually start predicting for us, this is how much your OT will be used in the next month. This is how much your medicines will be used. This is what your supply chain has to be emphasized on. If somebody can come and tell us, we can actually staff properly, we can equip properly, we can budget for properly, and then not be surprised suddenly that, oh, what happened? Oh, we didn't even realize that Diwali was here and, the hospital is empty now because we didn't foresight in our budget next year that November 9th will be Diwali. So somebody can provide these things. I think doctors will take like fish to water them. These are small, low-lying fruits that can be easily grabbed by any provider in the room.
Super, super interesting. Thank you, Dr. Bajaj, for that. Lovely fact that how, as a healthcare institution now, you are, opening up from the transition from being, on the whole reactive analytics to going to a predictive analytics. Absolutely agree to that. Dr. Nitin, actually Mr. Nitin, I think we both are the only ones who are not the doctors. Yeah, absolutely. So You are a technology provider, and I have a couple of questions for that, right? One is based on, would love to understand, because Fujitsu has been on a very pioneering sort of a forefront in terms of, the medtech innovation, especially on ultrasound and, a whole set of equipment. So would love to understand how does the innovation culture really works. At the same time, I also want to give you an external sort of a facing question. One of the things that I see in India right now is that when I look at especially a lot of young company startups, I see a lot of, more than 100 unicorns. But when I come to healthcare, we do have unicorns, but most of them, their delivery markets might be in India, but their main sort of customer markets, they're in US. If you look at SaaS, a lot of other, medtech, we don't have those big players right now. Would love to understand what are some of the challenges, and also what are some of the interesting things that needs to be done, but the young companies, who are just starting the journey. So would love to hear your insights on that.
Sure. No, thanks Varun, and thanks first of all IHW to have me here. So I think the only other Mr. as he rightly said, where it becomes very difficult, we are from the technology provider side, and we have two actually customers. One is of course the healthcare provider side, and of course the ultimate patient. So we have to take care of both aspects in terms of healthcare provider should be satisfied, and customer experience, or in terms of patient experience, should be on the top. I'll take it from Dr. Bajaj. I think I was very impressed with his keynote, and he very categorically mentioned, and I really liked it and believe in it, that technology should be made easy. You should not complain that the user is finding it, is not using it. So that's never the case. If technology is easy, user will definitely use later, sooner. Adoption rate may be different, but yeah, I thank and agree with that. So as Varun mentioned, innovation. So Fujifilm tagline is basically, if you see, value from innovation. So we have been front runner in terms of innovation. We have very big presence in terms of diagnostic as well. So innovation, if you really see in healthcare technology, if we really have to transform this from Fintech, if you really see in India, Fintech, the way we have moved, and a lot of our delegate comes from US, and they see we are just scanning some barcode from the mobile, and money is getting transferred. Even Western countries, it is they are amazed. That's kind of transformation India has done in Fintech. If we probably try to replicate Fintech in terms of health tech, I think a lot of things are being done, platform being created that where all your health tech data will remain there, and you have to just give a access authority to the doctor, and he can pull in all your records. So those things are happening, and time is for connected medical devices. We all know, I think Health 1.4.0, which is I think the theme of this conference as well, is predominantly on connected devices. So coming back to innovation, probably if you really think deep in terms of for the companies, technology provider, how innovation I would say one of the key factor of innovation is listening to your customer. I think voice of customer is most of the company take it into account. Until voice of customer and kind of R&D research and development is synchronized, and what customer look at, then I don't think company can really innovate. And second part is again Dr. Bajaj highlighted that the simplified workflow. So again ease of use is again our another brand pillar. So these are some things which a company should adopt, and if we really want to revolutionize, I think the end delivery we should believe in terms of digital, how digitally we can reach, because again Indian healthcare have two challenges, which is affordability and accessibility. Accessibility, I think digital plays a vital role, where you can reach to tier 3, tier 4, the kind of 5G network, even if you go in remote, and the kind of network is available, which is I think added advantage to health tech, and health tech should use that, which is being used as well. And accessibility again probably is a big way, can be connected through connected devices. How do we collect data? And ECG example, it is very live, and now we have companies where you do ECG and it is telecasted through IT, and anywhere, and a specialist sitting at metro can quickly report. We all saw lungs X-ray, similar things in COVID, when all the doctors were burdened, and very quickly through this technology innovation, more and more patients were screened, and somehow the load on the clinician got reduced. So I think these are a couple of things which I think we are doing, any healthcare provider is doing. Voice of customer, somehow I think when you goes up to the design, get dissolved.
So that I think we should maintain what our clinician is looking at, what is the ultimate patient experience. These two things, I think if we take care, probably success is ours. Yeah, sure.
Thank you. Very helpful. Thanks a lot. Let me come back to you, Dr. Nilesh. You mentioned about some of the very interesting things that Metropolis has already done. I think would love to understand that, because now there are a lot of new disruptive technologies, and diagnosis is a space which is a very patient-centric sort of a space. Would love to understand what are your larger, broader technology goals for the next sort of let's say the next half of decade, 5 years. But at the same time, I also want to understand how are you building the human resources layer for that? Are you depending a lot on internal bottom to top innovation, or are you looking at working with various existing technology vendors and building the human resources layer on that? So would love to understand that.
So I'll start with whom we are working with, because that is very, very important. We are working with vendor partners, and that is necessary because this is an area you're giving a report on which decisions are going to be made. So vendor partners bring the tools which are validated locally, they are approved, and those tools you are adopting. So it is very safe bet. If you try to innovate yourself, get it validated, it will be going to be a very long road. You can make some process innovation, improvement, using your IT tool, which we keep doing it and which will continue doing it. And that also is a bigger area to work on, that will keep happening. But when it comes to a testing system or pre-analytical system or post-analytical system, I think we work with vendor partner because they have very validated systems, and we are happy to adopt that. What I intend doing in coming 5 years time, and which I'm going to divide between illness and wellness separately. On illness side and on back-end side, I want to ensure that a lot of decision making happens centrally. So there is a talent pool available, and I'm touching a human resource part also. So each area there is a talent pool in my company which is quite localized. So I have a very good genesis sitting in Bombay. I would like across India genetics decision to happen from Bombay, or I have got very good talent on quality side. So quality related decision I want it to happen from Delhi because my best talent is sitting in Delhi, and so on. So a lot of centralization and regionalization, definitely I want to do it on back end side. Improve automation and decision making to that level where I don't have to keep increasing manpower. I want to stay efficient and give better quality result and with lower cost. That is what is going to be journey. I also said about subjective areas where whether we say cytology, histology, immunofluorescence, CBC, all those areas I want to ensure that AI is adopted and we have dependence on doctors reduced, and doctors can spend their more time on other areas and better areas. I want to make a lot of rule-based decisions so that only very, very important outliers only doctor will spend time on, rest gets released. And ultimately I want to move to robotics. Today in the world, there are very few labs who are on robotics. True robotics, I am not talking about equipment-based robotics, but the overall robotics, I think that is where we want to move in future. Coming to something which touches the patient and the doctor, I want to be very, very vigilant about it. I think for me, all my life, doctor is my customer and patient does not make decision. That is how I lived all my life. But in last 10 years time, specifically COVID time, things have changed substantially. Patients are making a lot of decision. Even on illness front, they choose a lab, they make at times select or deselect a test and so on. So I want to create report format and services which are patient friendly. Even report format. I never wanted a patient to read the report, but now my mindset has changed. Yes, patient want to read the report. So I want to make a report which is somewhere patient friendly without compromising doctor's angle at all. Coming to wellness side, lots of patient friendliness I want to bring. How to select package. Today I would say I'm not happy with anybody's wellness packages. I think what we are doing. First thing, writing total health checkup or total body profile itself is a wrong norm. And I think we are not telling reality to the patient. Health checkup is not complete without doctor being involved. So many things I want to bring it at home. So if they are doing health checkup, they get 2 health checkup. I want to look at, I'm already validating some tool where I will be able to do basic physical examination remotely with the doctor sitting remotely and so on. Those are new things which I want to bring wellness. Wellness I want to upgrade and make it true wellness area and make it very patient friendly. Thank you so much.
Super helpful. Very exciting to see how how your next 5 years are going to look like. But this seems like a very interesting plan to pursue. Thank you, Dr. Sehgal. Let me come to you. I know AHPI works very closely with the government in shaping the opinion in putting forth the opinion of a lot of healthcare providers. I want to touch the perspective of this very ambitious Ayushman Bharat digital mission. How do you see its further adoption? I know the rollout has happened. Where do you think the adoption can be strengthened? What are your perspective on that?
See, let us understand at the very first, India has 1 million doctors, 2 million nurses, and 1.4 billion population. Now, I think that makes the ratio not very good. It's not the optimum ratio. Second thing, what I think we have to realize, all of us, our policy makers also, and I think they understand this. In healthcare, it is the availability, it is the accessibility, and then the affordability. These three factors are the most important factors if you want to give universal health care to this country, which is has been the aim of the government, and they have come out with data cards and the Ayushman Bharat digital mission and schemes. They, I think, worked very well initially. There was a lot of enthusiasm, and I'm sure Shushin will agree with this, because I think he understands that it is on this model that he built his multiple hospitals and he gained from this scheme. But I am sure, I mean, in between, I've heard his views, I've heard his cry that if the scheme is not implemented well, if the deliverables and the promises have not been made, have not been actually met, then problems start occurring. If there is a problem of cash flow, how will he work? I don't understand. I think that is where things need to be rectified. AHPI has been fighting for this. Some rate revisions were done, which were very, I think they were not optimum. Only some of the things were addressed, and then somewhere again it got lost because people, who were regulating all these things and the policies were lost. I have unfortunately been part of certain committees where, as stakeholders, we are called, things are discussed, probably, but nothing happens. So I think if we are sincere in a fantastic scheme, it is a fantastic scheme what has been thought of. Because handling such a large population is not an easy task, especially when the masses don't have healthcare facilities. So if it is taken up well, the AI and the machine learning and our industry 4 is transformed into health 4, and there is a proper integration and deliverables are there, I'm sure it will succeed.
Thank you for that. Let me go to Mr. Nitin. So Mr. Gupta, your company works across different geographies, right? India is one of them. What are the differences that you are seeing in terms of healthcare, both innovation and adoption across geographies? So let's say if I have to compare India with your market penetration in Japan or Europe or some of those geographies, or even Southeast Asia for that matter, what are some of those big differences that you think are present, and where do you see your particular Indian market presence coming up? How are you planning to shape that up?
Yeah, sure. Thanks. So actually, it's a good question. Like, when we compare India, and we have a vision of Viksit Bharat by 2047. So we of course are blessed to do that. And there are two ways I think, probably slightly to achieve that is, one is probably we develop more of health industry, and we all know economy is developed by the citizens. So definitely healthier citizen, healthier economy, healthier GDP, and definitely health also contribute as an industry as well in terms of contribution to GDP. Coming back to the question, I think when we see Western world, I see two major differences. One is the penetration of insurance, which we all know, the money, the cash available to the healthcare and healthcare provider, and in turn that goes to the devices company and various stakeholders in health system. So I think that is something which now being addressed with the government schemes and of course awareness in the citizens to have, but still we are quite far. So because of that, naturally the cash flow reduces and the innovation reduces. Second, again, probably if we see that is the regulatory angle, which I always say. So if you see the Western world, the regulatory is much, I would say, in terms of refined. They have regulation, it's not that they are not. But here I think it is being set up. A lot of work is being done, but yes, regulatory is being set up, and that's one of the major hurdle when you want to do more of innovation, more of technological, and the probably these things are being work upon, and government focus is there in terms of that. But I think that is one of the hurdle because of devices as a company, as a provider, both slightly struggle. So these are the two which I feel is the major, and we have a presence across the globe, and we see very different adoption of technology, which I think we as a provider address by the training and education, which is I think one of our brand pillar again. So we are into a lot of education. We do around 200 programs specifically to adoption of technology. So I think I would urge, and I think major technological healthcare providers are doing that. So again, the skill gap, and if you can do more and more training, education, so that adoption to new technology increases. So I think that is another aspect from where we can really scale Indian healthcare system in totality through the help of devices and better clinician, better devices, better patient experience. So these are my few.
Very interesting. Thank you. Thanks a lot. Dr. Ashish, so last time you mentioned with regard to a lot of focus on EMR and front-ending processes where digitization has been used. I actually want to change the exact gear and probably focus more on your core hospital operations part per se, and specifically on things like procurement, inventory management, where typically storage, where typically you will have a lot of leakages historically, which will be becoming a big sort of a cost drivers. Would love to understand how have you used technology to optimize that? What are some of the interesting things that are happening, and where do you see a lot of innovation happening on the core hospital or operation space? What is your plan on that?
So when it comes to integrating various departments, trying to find out leakages, whether it is supply chain or making sure the the delay in delivering medication and all those things are going in a structured manner. The challenge is how many external vendors, how many applications, how many softwares can you build in and integrate? That always remains a challenge. Those software, they don't speak to each other. So we started with an EMR. We knew that it's not. In fact, after going through 5 or 6 such software solutions, I realized that all EMRs are bad. Few are very bad, few are little bad. So we have to find the lesser evil and try and work around all our processes according to that. And that's the main reason why it always becomes difficult to shift from one software to the other, because for last 2 years we have been thinking to find a new partner, and every time we go back and look at a new software, whatever we are very comfortable in the previous one, it becomes a challenge. There is a new challenge with the new software. So that's why we did not have, and all the doctors are adapted to a particular way of doing the things. So rather than asking every vendor to change the way this hospital has to run through our vision and mission and the doctor's comfort, it is like we have to see where are the gaps. If there are 500 gaps which we want to bridge, then we sit back and see, can we have a workaround in the software which can still give us the same end result, but doesn't really need change request and a cost implication and all those things. So doing that, we were able to address 60% of those problems. Supply chain becomes a low-hanging fruit where the expiry medications, unused medication for 3 years. In fact, every year we have started doing audit of, so there has to be a focus from the leadership to try and keep evaluating, keep auditing, various reports. And there are, I would say every month we find that there are 5 more reports which are possible from the software, which we have never seen. So I think we are still not using the full potential of our software in place. If we start looking, deep diving into this, the challenge is how do we get those, no doctor will come back to us and say, if this happens, that will be good for me. So the IT team is motivated by the medical team to go back to clinicians and find out what are their challenges when they are, taking care of patients through the system. Supply chains, sometimes we order as simple medicine at Dolo, it's not available in OP pharmacy. We can't afford to have miss out on medicine like Dolo. So it was ordered. The the reorder level was not matched. The supply chain got broken, and we did not have that in the. And even if it was there, it was not uploaded into the system. There are many weak links in the entire chain. So we have to rebuild the the manual intervention is required. The monitoring is required by a seasoned player. But for sure, any software you choose, there are ways and means of addressing all these things. Some software which has run the test of time, they have passed on, at least they operated 5,000 beds in various hospitals, in various environments, various states. I think it's good to go. I am not saying that that's the perfect software for everyone. We'll really have to work with the technology vendor. In fact, 7 years ago, I still remember so many consent forms, so many new things. Change requests we got done in the software. In fact, we were asking the vendor to give us royalty for all those things our team contributed to the software, but a lot of changes we did ourselves. So that's for our patients, that's for easing out our operations, and identify the low-hanging fruits and try and reduce the cost and improve the experience of patients.
No, this is very interesting, right? And because what I've realized is that every hospital is doing a lot of customization in what is available in the market, depending on their particular, sort of the way their operations are designed, what type of specialties they are really catering to. So, and this is something that, probably even IHW can take up, like compilation of some of the best practices across how different hospitals are, streamlining their operation using the technology. So something, in that front can be taken up, Kamalji. Dr. Bajaj, I think what we have done in this panel is that we have heard perspective from providers, diagnostics lab, some sort of a government perspective, patient perspective largely. I think one very critical one, which also fuels a large part of the healthcare ecosystem, is that of a payer. The insurance, right? Both government as well as the private insurance companies. As a provider, I think there is always a constant, back and forth, claims management, TPAs, all those different things. What are the specifically because you are in the business of delivering affordable healthcare? So for you, this becomes, much more important, right? So how have you managed that particular front end, in terms of the payer integration? How are you using technology on that? How are you reducing your claims denial? How are you reducing the leakage? How is that looking like?
So I think it's a natural ecosystem where, as a payer, every payer will look at having more and more controls in place, more cost controls, more controls to prevent fraud. And as healthcare providers, you will always seek more and more independence, right? That I want to treat my patient as I want. This is the right protocol. You can't guide me that this medicine should not be used or this surgery should not have been done. That is a worldwide phenomenon. Particular to India, I think, is the deep mistrust between payers and providers that has seeped completely into the ecosystem. So most providers do not want to even engage with schemes like Ayushman Bharat or ESI because they have no trust whether this money is ever going to come to us or not. The providers have their own limitations on treating, some sorts of patients. So they want their own independence. The payers, on the other hand, again, have very little trust in, some small hospitals, non-accredited hospitals. And the reflex thing happens is that either the payer depanels the hospital on even the slightest of issues, or all the providers go on strike and say we will not work, like what is happening in Kashmir right now. So none of the hospitals in Kashmir are providing Ayushman Bharat services because of payment issues. I think more than technology, this needs a lot of advocacy, a lot of trust building between these two ecosystems. Technology definitely will help when we have the health claims exchange. Second, I think the penalties need to be equal on both ends. So it is right now only the providers bear the brunt of all penalties. The government has nothing to lose. If they don't pay for 6 months, it's not like they have anything to lose. Unfortunately, even after 6 months, if they start paying again, the hospitals will queue up again in front of their offices that, okay, we need the panel again. So that is something that is very unfortunate in our ecosystem, and that is leading the good players away from these schemes. Only the bad actors remain, and then they give a bad name to the entire ecosystem. In our case, as we said, we try and provide everything very transparently. So we also have in some of our hospitals, we are implementing it. I think next panel Prateek will tell more about. He's leading the digital initiatives in our organization. So we already have a fully digital hospital. We call it our first digital hospital. But with the next new software, I hope a lesser evil one, being implemented across all our hospitals, I think the level of transparency in patient outcomes, in patient protocols, in all of that will enter into a next phase. We keep talking about financial, ecosystem and how healthcare is the next, going to be the next after UPI, BHIM, then healthcare will have something. I think we really need to understand that the level of trust needed in healthcare is even more than in the financial ecosystem. So we need to build those safeguards. Also, in the financial ecosystem, digital transformation, what we've seen is face-to-face interactions have almost become zero now, right? When was the last time we went to a bank? Nobody remembers. Everything is done on your phone. Why is that not taking root in healthcare? Because I think, like the cry about government, we also fail to hear the cry of the doctors. I have yet to see one doctor who is very happy with online consultations and teleconsultations. Nobody is. We still keep pushing it. We still feel that is the way to go. But if the doctors, the main stakeholders, are not happy with it, they feel it's a waste of their time, they feel it's a intrusion upon them, they will never let it succeed. So how can we completely retweak it so that hospital visits become rare? You only go to the hospital for 10 to 15% of the things that you do right now, and most of the healthcare is shifted to your house. If that is possible, then only I think smart hospitals will be a reality. Smart hospitals means killing all the hospitals and shutting them down. That is what I feel truly smart hospital is.
Yeah, that's a very, very interesting way to conclude the remarks. Thank you for that, Dr. Bajaj. Very interesting perspective on the the whole payer integration. And absolutely, there is the way I think the healthcare works is on the fulcrum of trust, right? Similar to financial statements, financial transactions. So I think till the time we are not able to establish or even cross that particular trust barrier, I think it is difficult to go to that particular trajectory that we are all envisioning. Thank you for that. The timer in front of me does say time's up, but I did mention that we will have a couple of questions. So what we'll do is that very happy to take a couple of questions, and then we can wrap it up. From the audience, any one of you who would want to ask any question on some of the interesting things that we discussed, now is the time. I think the audience has become a bit overwhelmed listening to all the interesting big thoughts. Well, anything that you want to ask right now? Okay, yeah, sure.
We have one question.
Yes, just give a quick to all of you for like a 30-second comment.
Either bedazzled them or befuddled them, we did something to them.
I think it's a
bedazzled them.
I think most patients are very happy because it saves time. The only problem is they start becoming unhappy seeing the attitude of the doctors, because doctors talk to them online for 3 minutes, 4 minutes, and after that the doctors start getting a bit irritated and then say, nahi, isse zyada isse online nahi hoga, abhi aap aa jana mujhe dikhane. So doctors have this attitude. I don't know what is the reason. Doctors are not happy doing online consultation. So the patients really want to do it. It is in their favor. They save time, nobody wants to go to a hospital which is so crowded, find a parking space, spend half a day or maybe sometimes even full a day when you can get it done in like 10 minutes. It is like going to a bank. Why would you want to go to a bank when you can do everything on your phone? So patients really want to do it. I think we need to consider what is lacking from the doctor's point of view. If we can solve for that, digital health will really, really take off in a very big way. Don't blame the doctors again and again. As I said, it is not the doctor's fault. We need to tweak the technology so that, doctors feel that it is in their interest to do it.
One comment here. The body language of a patient, the walk, for an orthopedic patient, the walk of the patient, the pain on the face and the physical touch, it cannot be replaced online. And post-COVID, you saw sudden 90% drop in consultation. So wherever the telemedicine is successful, it is there where physical consultation is impossible. Northeast or other areas where access is not there, then it is a great technology to be adopted, and that can serve many people.
So you heard it right from the doctor's mouth, right? He is not happy with the teleconsultation because he feels some issues are unaddressed. Somebody has to come and address those issues to make it worth his while to do a teleconsult, to, when he can see the walk, the physical touch, the pain of the patient. If that is not solved for, this will not take off.
And I doubled the consultation fee for online because I wanted to discourage it.
See, there was a survey which was done by IHWW, and the only about 5% of consultations are by telemedicine. That was what 50 smart hospitals were surveyed, and that's the answer we got. Even I did a lot of teleconsultations, and now it has suddenly, slowly, it has come down to maybe once a week, which I do. I think it is not the doctors who are at fault. These systems are not, I think, ready for that. It is too premature. The way Ashish is saying, unless and up till you get every parameter of the patient with you, you get a lot of other things which you want to see, feel the patient, know about the history. That cannot be done in 3, 4, 5, 6 minutes. Unless and up till a very detailed history, some kind of a protocol is set. Some kind of SOPs are created where, and also, litigation is also a big thing in this. If a doctor makes a mistake because he has not been able to evaluate the patient properly, what will happen? So all these things, I think, keep them back. It's not easy to start doing it.
Yeah, thank you. I think as a moderator, nothing gives me more joy than sparking off, debate, which can then be, taken to the discussions once the panel is done. I think, thanks a lot. We had such a, great start to the panel.
There's a question.
Oh, there's a question. Okay. Sure. Yes.
The smart hospitals. So for example, if it's a wellness aspect, teleconsultation is brilliant, I would say. And there are second opinions, where you have, the diagnosis already, and you're giving an opinion based on the MRI or CT or whatever, then it's possible. So it is, what are you doing it for? For an acute illness, it may not be possible. But a second opinion, yes, it's possible. There are clear SOPs, clear algorithms, and typically what we ask the patient is to note down all your complaints, your symptoms, your, whatever concerns that you have. Upload that first, even before the doctor comes in, so that the patient doesn't miss anything. And you have an upfront idea of what's wrong with this patient. For example, recently I did something for somebody who was sitting in some other country, I would say. The person had a swelling and, an ENT had to be consulted. The patient was very scared, didn't know what to do, and series of pictures were sent, and it was simple allergy. And the doctor kind of prescribed, antihistamine, and the patient's images were sent a couple of times in a day, and that was taken care. So it is about the doctor's confidence, the patient's confidence, following a protocol, and getting the data upfront, and you giving an opinion. It's not fully a treatment, it's an opinion, and this is really good, and many players are doing it.
Thank you. Thanks a lot, Dr. Sandy. Oh, okay, we'll take a last comment. Yes.
Great discussion, and I think you opened a little Pandora's box. That's where you see so many hands up. I'm a cardiac surgeon, and I have plenty of life examples, but it depends on where you use and how you use this technology. It's not about replacement, it is an add-on. We have to remember telemedicine is an add-on. It's for people who cannot get or do not have an idea of where to go or whom to go. It's the primary accessibility. Okay, it's to build the trust between the patient and doctor. Just this morning I had a teleconsultation. My second teleconsultation of the same patient who's coming for surgery on Sunday to get admitted. Now he's coming directly for admission. Of course I'm going to examine the patient. Of course I'm going to touch the patient. Of course I'm going to do everything that it takes. But now you see there is a trust that's built between us. So it's about compliance of the doctor. Okay, I'm sorry, some of the doctors don't use it, but it's unfortunate. It's an add-on. It's a great add-on. Just like one of the doctors pointed out, for remote areas especially, now the patient knows where to go to. So it depends on how we utilize this technology and how accessible we make it to the patients.
Got it. Noted. No, thank you. Thank you for highlighting both the follow-up care as well as the pre-surgery care. Very important. Thank you.
I think.
You see, Kamalji, you are putting me in a spot here. I don't want to be a bad audience moderator, but then I also don't want to be a bad moderator. Okay, then the last one here.
I'm a radiologist by profession, and I think all innovations are concentrated to AI, ML, and directly to radiology a lot. So just in line with what Suchin sir pointed out, the doctor has to be comfortable in handling, and everyone, I think today they are talking about innovations more in radiology than in anything else. So I just want to point out an example that, in radiology also, we are not diagnosing images, we are diagnosing the patient as a clinician. We are a clinical radiologist. So even in imaging, I'll just give you an example of PET CT, where physiological uptake is so evident in every part of the body that without actual seeing the patient, I do not comment about the pathology. For example, in oral cancer, in FDG uptake in oral cavities, so much physiological uptake is there that I will not be able to comment about the pathology without knowing the clinical background or at least seeing a picture of the open mouth and the lesion. So I think it goes both hand in hand. There is nothing isolated which works, and it is situational which should be accepted or not accepted. I think it is up to the clinician, and it should be left up to the clinician, I think. Thank you. Yeah.
Thank you. Noted. Thanks a lot. I think this was a lovely start. Thanks a lot for all of you, for joining in this panel. I think we explored a lot of big ideas. We covered a lot of space. So thank you again for being a part of this. Thank you to IHW for letting us organize this very interesting panel, and thanks to all of you for being such a engaged and a very lovely audience. I think we have had a good start to the summit, and hope we can keep progressing in a similar way. Thank you. It was lovely being your moderator. Thank you
very much indeed. And ladies and gentlemen, let's once again put our hands together for our eminent panelists for the wonderful session we had. As I once again invite on stage Mr. Kamal Narayan to kindly do the honors of presenting a token of appreciation and gratitude to all our eminent panelists on the stage. We begin with presenting to our distinguished moderator, Mr. Varun Javeri. Thank you very much indeed, sir, for wonderfully moderating this highly engaging session. We'll have a group photograph in the end also. Thank you. Thank you very much indeed. We now present to our distinguished panelist, Dr. Nilesh Shah, who is the Group President and Head of... And we now present to Dr. Nilesh Shah, Group President and Head of Science and Innovation, Metropolis Healthcare. Thank you very much indeed. We present to Dr. Naren Sehgal, who is Secretary AHPI, the Association of Healthcare Providers of India, and extremely thankful to you, sir, for sparing your valuable time and gracing this occasion, and for all the valuable insights we had from you. We present to Mr. Nitin Gupta, Managing Director, India and South Asia, Fujifilm Sonside India Limited. Thank you very much indeed, sir. We present to Dr. Ashish Chowdhury. Thank you. And to Dr. Shushin Bajaj. Thank you. Thank you very much indeed. I would now request all our panelists to kindly step forward, come together for a group photograph. Ladies and gentlemen, requesting everyone to kindly remain seated as we are straight away moving into the next session, which is our panel discussion 2. This session is on the labs of tomorrow, innovations shaping the future of smart diagnostics. Kindly give us a moment. Kindly give us a moment while we arrange the top table for the next session, requesting everyone to kindly remain seated. Once again requesting for all mobile phones to be kept on to silent mode.
When world leaders will converge for Summit of the Future Action Days. At UN headquarters in New York, IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking
Ladies and
innovations.
gentlemen, we are now ready to go ahead with the proceedings of our next session. And I have the proud privilege in inviting on stage our distinguished moderator for the session, Mr. Vicky Nanda. He's CEO, Niramal. Let's put our hands together, ladies and gentlemen, to welcome on stage our distinguished moderator. Also have the proud privilege of inviting our eminent panelist, I invite Mr. Anand K, Chief Executive Officer, Agilis Diagnostics. Warm welcome to you, sir. Inviting Dr. Reena Nakra, Principal Director, Dr. Lal Path Labs. Very warm welcome to you, ma'am. Inviting Mr. Sanjeev Vasishtha, he is MD and CEO, Pathkind Diagnostics. A very warm welcome. Inviting Dr. Harpreet Kaur, Senior Consultant, Akash Healthcare. A very warm welcome to you, ma'am. And Dr. Abhijit Patil, who is Vice President, Pathology, Krishna Diagnostics. So ladies and gentlemen, a very warm welcome to panel discussion session 2 on Labs of Tomorrow, Innovations Shaping the Future of Smart Technologies. In this session, we will be discussing and exploring the cutting-edge innovation that are driving the transformation of diagnostic laboratories. And we have the privilege of having with us an esteemed panel of speakers. We have with us Mr. Anand K, who is the Chief Executive Officer of Agilis Diagnostics, who is a key player in the transformation of diagnostic services through technology and innovation. We have with us Dr. Reena Nakra, Principal Director, Dr. Lal Path Labs, who has been instrumental in bringing cutting-edge diagnostic services to the forefront of healthcare. And we have with us Mr. Sanjeev Vasishtha, Managing Director and CEO, Pathkind Diagnostics, a leader whose efforts in revolutionizing pathology have made diagnostics more accessible and efficient. We also have with us Dr. Harpreet Kaur, Senior Consultant, Akash Healthcare, who brings deep expertise in medical imaging and diagnostics and their impact on treatment, planning and care. And we have with us Dr. Abhijit Patil, Vice President, Radiology, Krishna Diagnostics. And ladies and gentlemen, the session will be moderated and chaired by Mr. Vicky Handa, Chief Operating Officer at Niramal, whose vast experience in the diagnostics and healthcare technology sector makes him the perfect person to head this insightful discussion. So with those words of introduction, I now hand over Niramai. I'm very sorry, ladies and gentlemen. Mr. Vicky Handa is the Chief Operating Officer at Niramai, and I now hand over the stage to him to kindly carry forward the proceedings of the session. Ladies and gentlemen, I would request all our eminent panelists and the session moderator to kindly conclude this session in 40 minutes, as we are already running behind schedule. So once again, welcoming each one of you, handing over the stage to our moderator. Over to you, sir.
All right, thank you so much. As we know, we have paucity of time, so we'll straight jump into the discussion. But very engaged from the first panel discussion that technology is the enabler, and that's the way to go, because it will definitely transform the future diagnostics. And it's very important to know, as the title says for the today's discussion, Lab of Tomorrow, right? So I would like to, straight jump into the discussions and try to keep it under 30 minutes and keep a final 10 minutes for the audience, because the total time is 40. So, so I would like to take, initial opening remarks from each of the panelists, just kind of a vision, what they think about, and I will come to Mr. Anand first to understand, in terms of help audience visualize the lab of tomorrow, what it will look like.
Thank you, thank you. So I think this is a very interesting panel that we have here, and we are also aware of the fact that we're sitting between all of us and lunch. So I'll not take much time on this, but when in the earlier session also we talked about the diagnostics of future, and in terms of smart hospitals and smart diagnostics. Here we talk specifically about the future of lab. So lab, as we all know, has been a very important aspect of healthcare and a key player in the care continuum. But what we have seen during COVID is that lab became one of the key elements and the first responder. So, but how do we actually transform this, and where do we see the future and how things change? So one of the key things that I feel is that from being somebody who's going to be very transactional, lab has always been transactional all these days. So we have seen that, you know, a doctor writes out a test, lab gives a report. So what, and there are hundreds of tests, and how do you make sense of those tests also? Nobody really knows. So it's for the clinician's responsibility to put those things together and understand whether that makes sense. So there's very limited contact between what happens at the lab and what happens at the clinical level. So I think this approach is what is going to change in future. There are trends which are happening even now post-COVID, which we are seeing, where we see that the relationship is not just transactional, it's becoming more integrative, and lab becomes one of the key aspects of the care continuum. So when we talk about how does it happen, so we have all the new technologies in place which help us to do that. You have the AI and MLs of the world. You have the personalized medicine, which is driven by precision diagnostics, where you have the multiomics, the genomics, proteomics, and metabolomics, and all the stuff. And we also have what we say, what we call, how do we approach this from the patient's point of view? So the whole digitization and digitalization of healthcare, where the patient gets access to various formats by which they are able to access reports, access services, and then also look at those reports. So we talk about smart reports, we talk about multiple things. That's how I think I see the future.
Sure. Thank you so much for that opening remarks. I will come to Dr. Reena now. And ma'am, help us understand, you know, what will be the newer horizon, you know, the lab can see over the coming period, because as Mr. Anand said, these futuristic technologies, AI, ML is coming. So how does a patient see, you know, a horizon of the lab? If you can just give it and cover it in your initial opening remarks. I will suggest 2 minutes, should be okay if we can hurry up. I'm so sorry, given the time.
Yeah, absolutely. So I think the last session has already given us a good segue into the discussion now. And the lab, like, you know, Anand was saying, especially during COVID, it came out that the role of diagnostics is not only in just screening, surveillance, monitoring, even treatment decisions. So it actually forms the cornerstone of patient health and even health outcomes. So it being that, that is also one of the reasons we are seeing a lot of technology innovation disrupting diagnostics. And diagnostics also does lend itself easily to, you know, a lot of AI and ML, given the image pattern recognition that is employed during diagnostics. But I would say diagnostics has been one of the, you know, the fastest adopters of technology. We see diagnostics playing even a very, like Mr. Anand was saying, in the care continuum of the patient, it's going to continuously play a very significant role. And the practice of what I call the P4 medicine, which is like, you know, predictive, preventive, personalized, and participatory. And when we say participatory, it becomes more and more the patient participating in their own health journey. And this can be enabled through new technologies like wearable tech, integrating that, you know, like who would have thought that you would have pulse oximeters in your homes? And that happened during those 2 years of the pandemic. Not only that, we now have them on our phones. So that's the power of technology bringing, you know, the empowerment to the patient and their hands. And that wearable tech integrated with the biomarkers from the lab, the images, all of that can then actually, you know, complement and make sturdy the system of teleconsultation, which was alluded to in the earlier session. And it would give the confidence to the doctors or the physicians at the other end to say, yes, we can now, you know, be confident about taking teleconsultations, right. Because they would have the overall view. And more so, I think hospitals would then be able to just take care of acute care, and more out of boundaries of the hospital, the home care can get enabled, access, affordability, all of that, and obviously, you know, the driving force of access to patient and I think diagnostics would be center stage.
Sure. Thank you, Dr. Reena. I think these 4 pillars which you talked about, specifically precision, participate in, and also the personalized, more in the hands of the patient, is very relevant. Coming to Mr. Sanjeev, given your background and also understanding, help us understand, in terms of what impact or a magnitude, in terms of the lab of tomorrow will look like.
So again, it's, I won't dwell on machine learning, IoT, AI. It's beaten to death, actually. It's become so cliched. I mean, whatever I'll say will be sounding, I'm going like a, very, very repetitive thing. So all I can tell you is, as I look at the future in terms of diagnostics, I feel that every individual will be carrying a lab onto himself or herself. I'll not be, so I was talking to somebody and he told me that a person is already born amidst us who would be living for about 150 years. And that's the kind of lab we want to create, where, I don't want the labs to go out of business, certainly, but certainly I think it'll be the things, the way we are functioning, the way we are seeing are going to change multifold. We have seen people working on chips which can be embedded onto the human beings. They can record all the parameters. The wristbands are a classical example for that. The technology as such is converging with medicine. Medicine, which was so far until about a decade back, which was solely in the domain of the doctors, is now kind of shifting towards the technologists as well as the techies of the world, really. So I feel that, if we are trying to solve the problem of making a universal health coverage a reality, it is very important for us to ensure that people remain well. They don't fall sick at first instance. And if they fall sick, they do not really essentially have to get into the ICUs to the extent possible. So I'll leave it this.
Sure. Very, very interesting perspective. Thank you so much, Mr. Sanjeev. So, Dr. Harpreet, coming to you in terms of our title and opening remarks, but help us also understand from the lab perspective, what kind of automation you envisage in the lab of tomorrow. If you can include that in your opening remarks, what do you think about that?
Sure. So, starting with the previous, going back to the previous session, Dr. Nilesh had, very clearly defined what we are looking at. My father is also, was a practicing pathologist, I think in 60s and 70s. So I've actually seen him do the pipetting and, doing everything manually. And from there, now today that we are looking at total lab automation, where from the get-go, that is sample collection to the archiving or rather storing of sample, everything is automated. In between that comes the middleware, comes the inventory management systems, which talk to the systems and to the doctors, give us live, the view of the quality controls, the reagent status, and the entire quality perspective of the lab can be managed sitting on one desk. And we are not only talking about at our one unit, but if we have multiple units, like sir, your labs, Lal Path Labs, you have so many units. All of these can be, monitored, controlled, sitting at one unit. And that is the kind of future in total lab automation, as well as the AI and all of, the future expansions that we see from the IT is what we see in the laboratory. There's one thing that I came across was, that laboratory is like an iceberg. Only 10% is what is visualized to the customer, who is the doctor or the patient. However, the 90% work that we do is actually all hidden. And the automation and the middleware is where we will get and are getting our solutions on those areas, which was all very tedious and very manual. But now it is all automated.
Sure.
So thanks to the technology.
Thank you, Dr. Harpreet, for that insightful points. Coming to you, Dr. Abhijit, given your background in radiology, right, I would like to touch upon how you see radiology integrated in the lab, and what are the futuristic technologies that are going to make a difference, specifically considering your interest in AI and ML?
So So today, if innovation is going to be talked about, it is going to be AI/ML. But beyond that, we should think of its applicability or its transitional nature in direct affecting the patient. How is it going to affect? So I would categorize the innovations of tomorrow as an application or an output of these innovations into three categories probably. One is infrastructure innovations, the process, new process adaptation or approaches which would be adopted, as well as the outcomes which would be helped by AI, ML and these technologies. So infrastructure, I would categorize infrastructure into innovations in chips, in detectors, in CT technology, in MR technology, in PET CTs, because now see, a new modality coming into place is going to be difficult, it's going to take time. So innovations in these infrastructures would stand at an inflection point in giving us more clarity of images, giving us better information, more resolution. The second would be an approach-based innovation, that is, as many of the panelists have also pointed out, for us to shift from reactive to preventive. So just imagine we are having, say, 100 patients who are symptomatic in the current ecosystem, and we shift our diagnostic approach to preventive to the rest of the crowd. Just imagine the load we are going to have, and I think AI/ML is going to help us in handling this a lot.
Understood.
So I think it's going to be we are at an inflection point, as everyone has been pointing out since the previous panel discussion also, and going beyond its applicability in the reporting also. So there are few challenges. It's not as easy to implement AI/ML in radiology as it is easy in pathology, because a lot of standardization has been done in pathology, and I see a lot of challenges coming down in radiology.
Right, thank you so much. We will also now go a little deep into, since we are talking about lab of tomorrow, and we are talking about these futuristic technologies, of course, there are certain challenges that we will definitely come across. Now, these challenges could be whether it is data management, because our labs are moving towards digital pathology, right? There will be data utilization, there will be data generation, and a lot of things will generate ultimately data, which is very useful to provide better outcomes, right? So it's an open conversation I want to kick in, because given the timer, I don't want to point out specific, but yes, feel free to jump in, because I feel that this handling data is very important. I was talking to Mr. Anand also, if you want to take this first and then open up to other panelists, but quickly in kind of a minute or two.
Right. Yes, thanks, Vicky. So that's a very important point. Labs don't generate just results, they generate data. And data, as we all know, see, labs influence about 70% of clinical decisions. But also we need to understand that in the healthcare interface or in any healthcare organization, 70% of the structured data that is there in this hospital information system is basically the lab data. So which means that that could be used to the advantage of how we can improve patient care. And that's where I think how we are going to look at data and big data analytics, whole data science around it, and how do we generate actionable insights based on that. Using data is not just about providing longitudinal trend reports to patients, but also compare those trend reports with the population health data that you can get out of what you talk about for the whole population in that particular region, ethnicity, geography, all those considerations as well. So I'll not take much time on
Right,
this,
sure.
so
Dr. Reena, you want to add, or anyone?
So talking of challenges, I feel that challenges are plenty. And to begin with, I'll say manpower is a major challenge in today's time. Imagine a country where we've got 300,000 labs, only 30,000 qualified MD pathologists, biochemists or microbiologists. I mean, the only way is to adopt to technology ASAP. I mean, as of yesterday basis, we have to be using the technologies. That's the biggest challenge. Second is the sustainability of any model. While, we, as I said, in my initial comment that people are using these jargons, too much. I mean, you go to a tier 3 city, also people will be talking about ML and AI and all that stuff, but it costs money. So from where the money is going to come? Imagine we are doing a test at maybe a 20th or a 30th of what is being charged in the Western world, and yet we are paying the same salaries to the, those professionals and doctors. So is it sustainable is the question. So sustainability in terms of the continuance of a lab and the kind of good work you want to do, and second about the manpower. So why we want to use technology is very clearly to provide accessibility, to make it more and more accurate, and to bring down the cost. We are already at the bottom of the pyramid in terms of cost. So where do we go from, how down we can go from here is to be seen. So a few challenges and no easy answers to these, but clearly technology will aid us to kind of reach there where we want to be.
Right, and also Dr. Reena, apart from your point of view on challenges, there are challenges with respect to data privacy also, right, and the regulations also, right? If any of the panelists would like to address those points as well, but whatever challenges you feel personally, Dr. Reena, please.
Yeah, so I think I'll first address the point of the cost challenge and also the data. So regulatory challenge around that, of course, is data privacy. And a lot of that is essential because when we are managing so much data, there's a cost to manage that, store that, ensure the security of that data. But digitization is also the first essential step for building any of those technological innovations and AI. The returns are going to be later rather than sooner. But we have seen certain areas, and especially in automation, robotics, and data analytics, we have been able to see some efficiencies, and we have leveraged that. Just a simple example, like, with data analytics, we have been able to reduce aliquoting of samples because you stop the sharing, you know exactly where the sample has to go next. And this not only improves the turnaround times or reduces the cost, but also improves, like, on the patient outcome, they do not have quantity not sufficient for the sample. They can do more tests. Similarly, digital histopathology has been able to leverage, like our pathologists. Subjectivity is also not there. The training is also leveraged. All our satellite labs, 200 of them across, pathologists can report for the pathologists who are sitting here. So that is also possible. So there are benefits, more intangible right now, but of course they would, like, sum up to become more tangible and bring out those benefits. So that is there. Regulatory environment, like we saw in, necessity is always the step change, and it kind of triggers that. We saw it during COVID. There was a lot of, the trust deficits that were alluded to earlier also went away, but we've seen them come back now after the necessity is over, but that is there. We need an environment which is more conducive to all of this and the technology adoption.
Coming to Dr. Harpreet and also Dr. Abhijit, from the challenges perspective, you manage a lab and there is a lot of automation, there is lab management systems. Now, what kind of challenges you see? Like, if you have to adopt a technology, right? What steps you will take, to bring on the technology, right? Will you test it, validate it? What are those things that you will do? Because you want to certainly overcome certain challenges, whether it will go within my ecosystem, accepted by patients, accepted by my staff, etc., etc. Just give us some visibility, to me, also to my audience, right? What do you think on this?
So, again, quoting the previous thing, we talked about the advantage of automation or technology should be on the price point, on the quality, as well as the patient experience. It has to work for the patients. It has to work not just patients, but for the customer also. That is our clinicians. So if it doesn't add value to any of these, it will not work. So starting with quality, we are in the process of adopting many such things. Mentioning not just lab, but Niramay, for example. That is one area. We are currently having a camp in our hospital using your technology. So that is one area where we are just exploring. We have to validate what is being promised by the company, by the test. So validation is a very, very important step. Once we go through the validation and we have already analyzed whether it will be useful in our setup, that is when we can roll it out and see if the patient acceptability will be there or not.
Right.
So, yeah.
Right. What do you think, Dr. Abhijit, in terms of challenges, but at the same time, given the radiology, it also presents huge opportunity, right? So I would like you to touch upon those opportunities, given the challenges that we have, and what you can bring and help our audience understand what could be those possible opportunities.
Pardon me but I was going to talk about challenges more.
No, you can you can do both. I'm just slightly mindful of the time.
Because the in thing is AI/ML, which is being adopted in radiology and pathology the most. More in pathology, why? Because pathology processes are standard. In radiology, standardization is lacking. A lot is lacking. So standardization in capturing of data regarding clinical history, regarding protocols, regarding report formats, regarding lexicons. So anyone mentioning in the report, most likely, I don't know how likely. Is it 40%? Is it 80%? Is it 90%? So this lexicon standardization of reports is also very important. So reading between the lines, it should not be reading between the lines. That AI/ML will not understand, as AI/ML does not understand gut feel. It does not understand most likely. So I think a lot of standardization needs to be done, which is a challenge in radiology, because there's a lot of human intervention in terms of data capturing for history, for protocols. For example, I tell you, there can be an MRI of the knee joint with a good report, with a detailed all information given in 3 sequences, whereas one more radiologist might want 5 sequences. So how are the charges of that study going to be rationalized? Because any additional sequence is going to come at a cost. So what is the basis of standard cost, standard report, which the AI/ML is going to learn for a predictive analytics or being used, or the data being used for AI/ML and future application? So radiology has a lot of data, but it is unstandard, unstructured data. So it is a very, very challenging thing to implement AI/ML. So a software product developed with a sample size of a North Indian population might not necessarily be applicable to a South Indian population in the same country, given the physiology, the physique, everything. So I feel, overcoming this, I think radiology has a high chance of implementing it because of the demand and supply gap. So a lot of things are happening in radiology, whereas we are unable to provide those services. So new innovations in teleradiology are coming up. I think my company is one of the forefront in teleradiology, and I'm very proud of that. That too in a PPP model where we are touching the last patient. So given the conditions, maintaining a quality and standards is a very high challenge.
Sure. So can I just add to what Abhijit was saying? See, I quite agree with him that the data is not kosher today. I think it has to be pure, it has to be usable, it has to be standardized. I think it's part of our evolution. The way we are evolving, I guess data is get more and more kosher in the times to come. And how much data is there? Documentation in India was the last thing about a couple of decades back. Nobody wanted to document anything. Fortunately now the new world is becoming more and more discerning. They understand the relevance of data protection. They want to create a database and then want to sift through the data, how kosher the data is. So that is a part of the evolution. The point around opportunity, I think a humongous opportunity. We haven't, in terms of diagnostics, I hope I'm not jumping the...
No, absolutely fine.
So I thought, we haven't even scratched the surface. Since you were talking about iceberg, we haven't even seen the tip of the iceberg. So pre-COVID, it was often said in our industry that, not even 20% people have ever given their blood or, samples for testing, not even 20%. So one way to look at it is that 80% people need diagnostics. It's only around, the question is only around the paying proclivity. So if you're able to solve that equation for which the government and the private sector historically has been working. They need to, work cohesively. That trust deficit has to go, which is now, seeped back in again after COVID, during which time everything was hunky-dory. We were brothers in arms, and all of a sudden we've seen that, that bonhomie is now kind of seeping away, or maybe, slipping away from us. So the thing is that there are huge opportunities in terms of, increasing the number of tests that we can do. There's something known as test to accession ratio. How many tests are getting done from one sample? In our country, the average is under 2. And some of the evolved companies are doing about 2.5 times of, so once from one sample in 2.5 time test. If you just juxtapose the same thing with the Western world, certain developed economies, maybe US, it is 15x. So from one sample they're doing 15 tests. In NHS it's 24 because everything is insured. Even in some of the emerging economies like Brazil, it is close to 10. So just by educating the masses, telling the virtues about the test, because life is all about, I guess, ensuring that people remain healthy. If we talk about universal health coverage, why would we like to burden the hospital system, which is already under so much of pressure? If we are able to do something on the preventive side, perhaps it will, kind of crack the code.
So
very
just one
interesting.
sec, I want to add one more.
Yeah, sure.
As there are some policy makers as well as eminent personalities in the system. So just the previous panel was talking about point of care ultrasound. I would just like to add one experience of my friend who was a plastic surgeon in UK and shifted to India. So in UK, he said he used to not go out of the OT before doing a POC, using a POC ultrasound and checking the vascularity of the graft. But in India, if he has to use that handheld device, probably he will not be first of all registered under PCP NDT. So isn't that a limitation? Aren't we depriving the population of such innovative concepts which we are talking on this stage and we are not using, and our policies are hindering us or taking away that opportunity? I think all this needs to be taken onto the center stage at one common panel. Think about the pros and cons. Think about how these innovations could be easily usable and how they could affect, how they could efficiently be used by the experts.
Absolutely. I think policymakers should definitely make a note of this point. But coming back to the opportunity perspective, and we are talking about lab of tomorrow, I think it is very important to look at wellness, from that perspective, from patient perspective. And what does lab of tomorrow has to, kind of offer to a patient from the home health perspective? If you can think from that perspective, if I may request Dr. Reena, Anand and Sanjeev, and then followed by Harpreet and Dr. Harpreet and Dr. Abhijit.
So I think one of the things is when we are saying predictive care, and a lot of awareness, advocacy has already happened. People are aware of what tests they need to do to prevent certain disorders from happening. Diabetes has been one of the good examples of home monitored care, where continuous glucose monitoring has also now come in with actually insulin delivery too. So it's like the whole circle. And with lab longitudinal data versus transactional, not only just and personalized to the person along with say their tendencies or genetics or their previous trend lines as to what do they need to do next. What are the other recommendations for tests that they can get alerts, the frequency that they need to do it in. Along with wearable tech, it would get fully integrated into what is actually, it's not just point in time of even clinical history of what they are saying, because they may not come back to you saying exactly what they have been experiencing, but you can actually capture those data points. And all of that can, kind of contribute to predictive health. Genomics becoming more and more accessible is also like one of the, big game changers for personalized medicine and even predictive health. But a lot of regulation required around that too.
Right. So coming to Sanjeev, I think
Maybe
I
I'll
know
take a
you have to
minute.
leave
Yeah, so
slightly early. I will allow you first, then Anand, then Dr. Harpreet.
So, no, I think Dr. Nakra is very right. I mean, the point is that if we can leverage genomics and biotechnology, it can play wonders. We can run, the test on the various genome profiles that we have within our country, which are perhaps could be more than 5, half a dozen odd genome profiles. And we can understand from that what kind of genes are more susceptible to certain diseases and what kind of treatment, what kind of diseases, can really touch these kind of gene profiles. But coming to the preventive part, I think it's no brainer that, as we say, age-old adage which goes like this: a stitch in time save 9. Prevention is the only way. It saves loads and loads of money, oodles of money through the exchequer also. So if a person is going really very sick in the hospital, the cost is going to multifold. And that's the reason why, in the Western world, this concept of what do you call it, as the healthcare system, ecosystem, where you have the insurance company and the people who are paying the insurance premium, it is dependent on whether they're going to the gym, and then they have a hospital, they have a a diagnostic system. I mean, one of the examples could be Kaiser Permanente, which is a very large system, about $90 billion system, where there are about 60, 70 hospitals. They try to keep the flock healthy. So on the prevention side, certainly I think that is the way to go as far as India is concerned. With the digitization happening, Ayushman Bharat happening, NHDM, I guess, we will be able to cover the masses in a very, very effective and very, very efficient manner.
Sure. Thanks, Sanjeev. I will come to Mr. Anand to talk about, since Sanjeev touched upon Ayushman Bharat, we were discussing about challenges on the data, while we are also discussing right now the lab of tomorrow and what it has to offer from the home health perspective. But there are two questions. One is from the home health perspective, and second, the data. For example, when I go to a center 1 for a test, I am being given a patient ID. I go to center 2, I get another patient ID. Now, imagine in 10 years, I go to 10 hospitals or 10 diagnostic centers, I get 10 patient IDs. Now, I need to remember that, right? So help our audience understand, how do we solve this kind of issue? What do you think government is doing? What do you think can be done? And also from the first question, lab of tomorrow, what it has to offer from the home health perspective.
Yeah, thanks, Vicky. I think on the lab of tomorrow, from the home health perspective, Dr. Reena and Sanjeev have covered a lot of ground. I just wanted to add that, when you talk about how technology will be used in future for this, because labs being the first responder, and when it comes to primary and any preventive or predictive care is basically a part of the primary care initiative. So I think that's where labs will help, and technology helps in the form of not just using rule-based AI, but also generative AI in terms of coming up with solutions where you can give a sort of a synoptic report to the patient, like smart reports and such things, which can be read directly by the patients, as well as which can be utilized by hospitals and other doctors when they look at it, and then use them for further, taking the patient forward. On your second question, on the various kinds of reports that we get from different labs, and so I think the basic question is on interoperability and how do we actually archive and retrieve data as far as lab is concerned. So the lab, even though 70% of the structured data is from the lab, but you see it comes from different sources, and there is no single way in which you can really access it. I think one of the solutions could be that, we have this Ayushman Bharat digital mission, which came up with the ABA ID, the Ayushman Bharat health account, which could be a way in which all your health data can be put in one place. So through the ABA number, you can access all the healthcare providers who are registered with ABA. Like Agilus has been one of the first labs to be fully integrated with ABDM. And where that will help in interoperability and retrieving reports from different service providers, and also creating a unique ID for the patient by which you can generate really useful longitudinal reports, trend data, and all that. So I think that's one of the key aspects which we need to look at. We have to talk about how we can implement ABDM in a bigger way, for which there are a lot of challenges that we are already seeing. So I think as we move forward, things will clear out.
Right. Thank you so much for these insights. Dr. Harpreet, if I can come to you in terms of Lab of Tomorrow, what kind of, the lab analytics you can touch, and also some amount of Lab of Tomorrow, the future can offer at home health.
Right, so in continuation with the previous point, what I said about what you wanted to ask about preventive healthcare. So genomics, genomic sequencing is a big thing. NGS is giving us a lot of solutions in terms of diagnostic, early diagnosis of cancers, as well as targeted therapies. There's another line that is coming up these days, and which is direct to patient, kind of genetic testing, which is like a screening modality, although it's not very controlled and still not authenticated, validated investigation or a diagnostic tool. But a lot of people are actually getting it done, which is kind of a blueprint of what possibly you can have and how to change it. There is various algorithms that they use to, with the biochemical analysis, and the decision is made for, your health in terms of preventive healthcare, and changes can be made. So that is one aspect of, the advancement that we see in the near future, the entire gene mapping and finding solutions there, as well as targeted therapies. So that is one area which I wanted to touch upon.
Sure. And Dr. Abhijit, given the radiology, you touched upon teleradiology, right? So what do you see the future of that, and enabling home health or enabling more such futuristic technologies, providing telecare through radiology? What do you envisage from this?
So the futuristic approach in radiology, as far as radiology is concerned, I think preventive radiology, which is part of precision medicine, like one screening modality cannot be replicated for a general population. Like for example, if an ultrasound abdomen, chest X-ray is included as a part of general checkup, that cannot be a generalized thing. So in any population, if we have data about the genetic makeup, about the predisposing factors what the person has, this data is available, then we could have a precision preventive diagnostic protocol also. For example, if there is a history of metabolic syndrome in a family, one can advise a fibroscan for that patient of the liver as a screening modality down the line, which will be able to pick up fibrosis, and appropriate preventive treatments can be taken. So this precision diagnostics is going to play a major role with AI, ML, big data, all these coming into play.
Sure. So I know the time is up, but the final point, from the Lab of Tomorrow perspective, and I will encourage our audience to connect with the panelist once we are done with the panel, because no more time left for the questions. Just a kind of a fire round, understanding, last minute, what will be your top, recommendations for the Lab of Tomorrow? Anyone can start, final recommendations, 1, 2, 3.
See, the point is we have to be open-minded. We have to embrace technology, come what may. I think we become complacent, we used to a certain way of working. I think we have to be more open-minded. Clearly, the horizon is great as far as diagnostic goes or healthcare goes. If a person has to live for 150 years, obviously he or she will need these services. So my sense is that we have to be more open-minded and clearly work collaboratively with the government. I think India is one of the countries where even today, more than 70% of the healthcare is dispensed by the private sector, despite the fact that government has about 50% of the assets or more. So clearly, it's a win-win. PPP, whether it is in the public-private form or it's private-private form, that kind of partnerships have to evolve. We have to be holding each other's hand. In isolation. So I often say that, if as the leaders, as the running companies and all, we just can't be working in isolation. We just don't have to look after our own company only. We have to be as much responsible towards the industry also. And that's where perhaps, the things would.
Right. Dr. Harpreet, final recommendations, then Dr. Reena, Anand, and Abhijit. Just bullet points would be fine because the time is...
Yeah, the one thing that I see which is not being done is reaching out towards the remote places.
Very valid point.
For example, hills and other areas. If we use technology, and we will be able to control from the center and manage and give quality diagnostic services on those remote areas. I think that would be a very big plus utilization of the technology that we have.
Sure.
And into the near future. Thanks.
Dr. Reena?
So I'll take a different take. Basically, the points for infra, and that would be like automation, robotics, and AI ML. For technologies, we are saying like, in terms of sampling, liquid biopsy, non-invasive testing, and in terms of specific technologies to diagnostics and especially pathology, it would be genomics, proteomics. So these are the key areas for lab of tomorrow.
Sure. Mr. Anand.
I think the most important thing that we have to look at is moving from illness to wellness, going from being a transactional relationship to a more integrative approach, talking not about volume but about value. So it's not about how many number of tests that you do, but about what kind of value you contribute to the patient care. I think these are the basic fundamentals on which the lab of tomorrow will be based on.
Sure.
Thank you.
Dr. Abhijit?
So I feel the lab of tomorrow, as far as radiology is concerned, it has a very high opportunity, we being in the service sector and this sector being in the forefront in our country, going from a developing to developed country. I think we have to play an important role, and for that I think we need to adopt whatever challenges are there, come discuss, overcome the challenges and adopt these technologies, embrace it, accept them and discuss about the challenges. And I think I would request the medical fraternity, the clinicians especially, that they should come in the forefront, express the challenges, discuss with the technical aspects, technical people, and try to overcome. And I see preventive radiology as one of the opportunities with all these development and the data being available to a very great extent.
Right. Thank you so much, audience. Thank you so much, my panelists. Very, very insightful and interesting conversation. The lab of tomorrow definitely looks like using a lot of technologies. Thank you so much once again. Thank you, Anand. Thank you, Dr. Reena. Thank you, Sanjeev. Thank you, Dr. Harpreet. Thank you, Dr. Abhijit.
Thank you very much indeed. And once again, ladies and gentlemen, let's put our hands together for those wonderful discussions we had on this very important topic. And I would request Mr. Kamal Narayan to do the honors of presenting a token of gratitude and appreciation to all our eminent panelists. We present to our distinguished moderator, Mr. Vicky Nanda. Thank you very much indeed, sir, for wonderfully moderating this session. We present our token of gratitude and appreciation to Mr. Anand K. Thank you, sir. We present a token of gratitude to Dr. Reena Nakra. Thank you very much indeed, ma'am, for being here with us today. We present to Mr. Sanjeev Vashishtha. Thank you very much indeed, sir. We present a token of appreciation to Dr. Harpreet Kaur. And a token of appreciation and gratitude to Dr. Abhijit Patil. Thank you very much indeed, sir, for your inputs in this session. Thank you, Mr. Narayan, for doing the honors, and may I request all our panelists, along with Mr. Kamal Narayan, to kindly step forward and come together for a group photograph. And ladies and gentlemen, we now break for lunch. The lunch break is of 1 hour, 60 minutes. That is 60 minutes. And after 1 hour at 3:15 p.m., that is 15 minutes past 3, we will go ahead with the proceedings of the next session, which is a very interesting fireside chat session. I request everyone to kindly be back in time and be seated at least 5 minutes before 3:15 for the proceedings of the next session. So ladies and gentlemen, inviting all of you to join us for lunch, and we're extremely sorry we could not take question and answers in this session due to paucity of time, but all our eminent panelists will be here with us. You may kindly interact with them over the lunch. Thank you, enjoy your lunch, and kindly be back in time.
At a time when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Future. One story at a time. At a time, when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. At a time, when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. a time when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. At a time when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. at a time. When world leaders will converge for Summit of the Future Action Days at UN headquarters in New York, IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time.
Ladies and gentlemen, good afternoon. May I have your kind attention? We would request everybody to kindly be seated inside the hall. Ladies and gentlemen, once again requesting everyone to kindly be seated inside the hall. It is time now to go ahead with the proceedings of the next session. So while we are waiting for others to join, ladies and gentlemen, we have a small announcement for each of our participants. We would request you to kindly join the conversations about the Smart Hospitals and Diagnostics Summit on social media. And we would request you to use the hashtag IHU Smart Health-Care. So ladies and gentlemen, requesting everyone to use hashtag IHW Smart Healthcare on your post and tag @IHW Council and share your thoughts and highlights from this event on the social media. So once again, ladies and gentlemen, we invite everyone to follow us and on social media and share your thoughts on Smart Hospitals and Diagnostics Summit and Awards. Kindly use hashtag IHW Smart Health-Care in your post while you post on the social media, and kindly tag @IHW Summit when you share your thoughts and suggestions about today's event on the social media. And we would now request everyone to kindly be seated. So once again, ladies and gentlemen, we have a small announcement. When you share your thoughts and highlights from today's event, that is IHW Smart Hospitals and Diagnostics Summit and Awards, kindly use the hashtag IHW Smart Health-Care to share your thoughts and highlights about today's event. And also, please do not forget to tag @IHW Council. Ladies and gentlemen, today's event had a very wonderful start with insightful keynote addresses with the inaugural session, followed by 2 panel discussions. And now we will go ahead with the fireside chat, followed by another 2 and 3 panel discussions, panel discussion 4, 5 and 6, which will be followed by the awards presentation ceremony. So ladies and gentlemen, we've just been informed that we'll go ahead with our next session at 3:20 p.m. So we have about 15 minutes before we move ahead with the proceedings of the next session. So you all can take this time to relax. Probably if we are serving tea and coffee, catch a cup of tea and coffee, post that sumptuous lunch that was served to us. so that we have all the energy and are awake for the proceedings of the next session, which are very, very exciting. I'm sure you would not need that tea and coffee to keep you all awake, because we have some very interesting topics coming up. Next coming up at 3:20 is a fireside chat on decoding smart cardiac centers, harnessing the synergy of advanced technologies for enhanced cardiac care. This is certainly going to be very, very interesting. And then we have followed this panel discussion is on evolving smart hospitals by integrating healthcare organizations and technology for advanced care solutions, which also have some very eminent panelists taking part, sharing their insights in this very important topic. This session will be followed by a panel discussion which is on from innovation to implementation, the global Femtech revolutions. So this session, again, ladies and gentlemen, we are looking forward to, is certainly going to be very, very interesting. And then finally, we have the last session, which will be on smart oncology care with precision medicine and innovative diagnostics. And post this session, ladies and gentlemen, we will have the very exciting segment of the presentation of the awards. So another 10 minutes to go before we go ahead with the proceedings of the next session. Thank you very much indeed to each one of you for being seated back in time, and kindly remain seated. And once again requesting for mobile phones to be kept on to silent mode. We will get back with the proceedings of the next session in 10 minutes from now. Thank you. So once again, ladies and gentlemen, before we get back to our next session, we request all of you to kindly share your thoughts and highlights about this event on the social media. And while you do so, kindly use the hashtag IHW Smart Health Care, and please do not forget to tag @IHW Council. Thank you.
At a time when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage. to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time. At a time, when world leaders will converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time.
Good afternoon, ladies and gentlemen. Once again requesting now for everybody to be seated. We are ready to go ahead with the proceedings of the next session. The next session is a fireside chat session. And I would now like to invite on stage our distinguished moderator for the session, Dr. Anushka Amlani, IHW Council. And ladies and gentlemen, let's put our hands together to welcome her. Dr. Anushka, who is a clinician turned public health advocate, would be leading this fireside chat session. Ladies and gentlemen, our distinguished panelist, or I should say speaker for the session, Dr. Amit Bhushan Sharma, would be joining us in a short while from now. Meanwhile, I would like to invite Dr. Niranjan Hiremat, Senior Consultant, cardiovascular and aortic surgeon and surgical lead of the Apollo Aortic Program, to kindly join us on the stage. Let's put our hands together, ladies and gentlemen, to welcome him. A very warm welcome once again. And as we continue our journey into the future of healthcare, we move ahead with the fireside chat session on decoding smart cardiac centers, harnessing the synergy of advanced technologies for enhanced cardiac care. And ladies and gentlemen, our esteemed panel will delve into how Tier 1 hospitals and diagnostics are managing the influx of patients from across the country and the challenges that face delivering the quality of cardiac care. We will also explore the advanced healthcare systems like telemedicine, diagnostics, and smart healthcare technologies, and how they can bridge the gap between urban and rural healthcare, ensuring that everyone receives the care they deserve. And I would now like to introduce our speaker on the stage with us, Dr. Niranjan Hiremat, who is a senior consultant, cardiovascular and aortic surgeon and surgical lead of the Apollo Aortic Program at Indraprastha Apollo Hospital, a highly skilled surgeon and innovator in cardiovascular treatment and surgery. And now I would like to hand over to our distinguished moderator, Dr. Anushka, to kindly carry forward the proceedings of this very interesting fireside chat. Over to you, ma'am.
Thank you, Sapna. Thank you, Sapna. Good afternoon, everyone, and welcome to today's fireside chat, where Dr. Niranjan and I, and soon Dr. Amit will be joining us. We'll be discussing about the smart cardiac centers and the incredible role that technology plays in transforming cardiac care today. Our topic is decoding smart cardiac centers and harnessing the synergy of advanced technologies for enhanced care. As we all know, cardiovascular diseases have and continue to be leading causes of death worldwide and in India. And recently, we've also seen an increase in youngsters facing cardiovascular diseases. On that note, I would like to start this session by asking Dr. Niranjan, so what's your, based on your experience, the status of cardiovascular health disease burden? How do you see that, and how do you see that smart healthcare technology is, helping to address those issues?
Thank you. First of all, thank you for the kind introduction and having me here at IHW today. You made the right point that it is the leading cause of death today in the world. In fact, it is the #1 cause of death in the world. Cardiac diseases is a huge burden, and given that we are now the most populated country in the world, and we have one of the highest incidences of diabetes and hypertension in the world as well, we are soon becoming, the diabetic capital of the world, thanks to our carbohydrate-rich diets that Indian diet entails. But of course, that's not the only reason. With the growing amount of stress in the community and growing incidences of heart attacks in the young, there are numerous factors for those things. But if I talk about how technology can be harnessed, I think post-COVID, in a way, it's been a blessing in the area of technological advancements. Like internet connectivity, smartphone availability to the general mass in the population has really grown tremendously in the last few years, especially in the post-COVID era. And there is, thanks to affordable internet services, now we have internet in every nook and corner of a country. Now, yes, in the last 1 year that I've been in India, I've started capitalizing on this. One is in the area where I put out a lot of videos, educative videos from the horse's mouth, that's the doctor, who actually gives the right health tips about heart health and so on and so forth, and make it more reachable for people and general population, instead of, having misinformation online. So that's one way where we can educate the masses thanks to modern technology and what we are doing. And we are utilizing this. Apollo itself has the 24/7 platform whom I have partnered with. And we are coming out with a series of podcasts, reels, about general myths about general health or myths about cardiac health as such. We also now are seeing a rising trend of usage of wearable devices, right? Smartwatches, rings, and now there are a lot of Indian startups who are coming up with, like for example, Boat is one of them, where it's quite affordable wearable technology. Now, all we need to do is see how we can connect this accessibility and this platform that we have to the general population or the patients, even to the patients, and complete the triangle or the circle with the doctor. So the doctor, wearable technology, patient. How we can connect together to be able to, say remotely monitor a patient who's sitting in some remote towns or tier 2, tier 3 cities. When this patient needs to take appropriate action to come and visit us, maybe he need not travel all the way just for a general checkup. And that's why I call telemedicine or smart technology as an ad hoc to patient care. It's never going to be a replacement. It's not meant to be a replacement. So I think we have the platform, and that's where we are looking at. And the future is definitely promising, and we just need more people to invest in the right direction.
Thank you, sir, and very well said. Telehealth has definitely been a boon for the generation, especially post-COVID and during COVID. So having discussed about that, I also feel that this is more towards the awareness aspect of healthcare and cardiology in specific. But what about the diagnostic tools? When we talk about, welcome, sir.
Hi, doctor.
Thank you, Dr. Amit, for joining us. We were just discussing about the advantages of telehealth in cardiology and how it has impacted us during and post-COVID era, and how, so I'll ask my next question to you. So I wanted to understand that over the years, we have seen a lot of technological advancements in healthcare and diagnostic tools as such. So what are some of the remarkable advancements that you use in your practice as well, that you would like to share with our audiences?
As Dr. Niranjan told you, sorry for being a little late, and I hope the audience is a mixed audience, right? Both yes. Medical, non-medical professionals. So I'll try to make the talk less didactic. Cardiology has always been way ahead of its times as compared to the other contemporary branches. Right from prevention to advanced interventions and surgical aspects, it has been, last 10 years have been really revolutionary. Somebody, for example, if you want to change a valve, somebody would have said that if you can change a valve without open heart surgery about 15 years ago, people would have laughed at it. But now it is a reality. You can change the valve, heart valve, without any open heart surgery, without the need of general anesthesia, without scars, without stitches. So this is just, it goes through the groin like you put a stent, same way you put a valve now. If you go to the other aspects of cardiology, the electrical aspects of cardiology, you had a pacemaker which was the size of a matchbox. Now it is the size of a vitamin C capsule. So you essentially go through the groin and you put it without any scars or stitches. When you talk about preventive cardiology, you have remote monitorings like ELRs, loop recorders, which earlier the holters used to be very bulky. Now you have a small chip which you just attach to your chest, and every minute, every second your ECG is recorded, even if you are out of the country, and still if there's any problem, the data will come on the physician's mobile. Then right from imaging modalities, nowadays you have, in addition to a conventional angiography, you have three-dimensional images like an intravascular ultrasound, an OCT, where you actually go inside the blood vessel and see what the morphology is, whether you actually need a stent, whether you can get away without putting a stent, what is it, a fat, is it a calcium, can you just put a balloon and come out? So all these images are possible. These are all things which are done routinely in the hospitals now. There is an FFR technology, which is a wire-based technology to know whether this is significant, this is not significant. ECGs are the ones which were taken by already automated images are there. For echocardiography also, now AI can predict some markers of sudden cardiac events, sudden cardiac arrest happening. So echocardiography nowadays, especially young people, which are the people who are more prone for a cardiac event. There is some, so these are things which are automatically AI induced. You do not actually need a manpower for it, but only problem with right now the data is that the data is widespread and across. It has got a good negative predictive value, but it has got a wide standard of variation. That means you may be having a lot of false positives. So it is up to the physicians and the surgeons and the cardiologists to interpret that data with a pinch of salt and take good things forward.
Thank you, Dr. Amit, and thank you for highlighting one of the challenges in technology integration with medicine. Having said that, my next question is to Dr. Niranjan. So would you like to elaborate on the hurdles that the cardiac centers in India today face, both in Tier 1 and Tier 2 cities, with the integration of technology, and how receptive is Indian healthcare system when it comes to technology?
I think, in terms of challenges, we are seeing a transition actually. I think, I believe in our country, we are at a transitional phase. We have the earlier generation of our seniors and exemplary doctors and physicians who are not very well versed with technology, so they rely on the older methods of doing things. But thanks to the influx of newer generation physicians now in India, that we like, Dr. Amit, who's already imbibed a lot of technological, nuances into his practice. I think we are in that transitional phase, and definitely there is a platform, like I mentioned earlier, that this technology can be, or rather this usage can be more widespread. We have the connectivity, we have people with the knowledge, we have the technical know-how, and the only problem is compliance. So compliance could be either from physician's side or it could be from the patient side. And it's, I think, a huge responsibility is also of the tech industry to kind of see if they can be a bridge, or the industry itself, the medical industry itself can be a bridge between the doctor and the patient, to enable them to be more compliant to these technological advancements that we have. But again, in India, it's about the cost factor. It's about accessibility, like you have everything concentrated in Tier 1 cities nowadays, maximum a little spillage into Tier 2, but nothing much in Tier 3. So I think we have to try and propagate more technological things into remote areas.
Definitely, sir. And Dr. Amit, would you like to add something to that?
I think very pertinent. I'll just give you a brief example what I faced in the morning today. Same a young guy, 49 years old, was passing out, losing consciousness. By the time he used to come to the hospital, everything was normal. So he's come from Patna right now. Patna now exactly is not like a metro city. I would say it's the capital city. So every time he used to go to the hospital, the ECG used to be normal. He used to be sent back home. So now, with the help of AI, we have a technology which is called as external loop recorder. So it's a small sticker you will attach to the chest. He'll download an app on his phone. Every minute, every second his ECG is recorded. If there's any problem, it will come on the on the physician's mobile. So his ECG was showing an abnormality at 2 o'clock in the night. At 2 o'clock in the night, he would not have gone to the hospital and got an ECG done. So out of those 7 days data, we found out that at 2 o'clock, his heart was missing a beat and he was going forwards, and then the heart rate was racing to 200 and 250, which otherwise would have been missed. So once we found that this was the data, and then when he had the short circuit, there is something called as the radio frequency ablation. We burned the short circuit with a laser, but since we had a diagnosis in hand now, and we were able to proceed with it. Good olden days, we would have asked for a Holter, symptoms are sporadic, we would have missed it, and then the patient would have a sudden event.
So having said that, how do you think we can empower our patients? Because Indian diaspora is really diverse. So how do you think we can address that?
So see, communication is the key, as Dr. Hirat mentioned. I mean, communication is the key. The cost of infrastructure is going to come down.
In terms of digital health platforms?
Absolutely. The cost of infrastructure is going to come down. There is paperless technology. Everything will be seamless. I can contact with the cardiologist who's there in Patna. He can contact with me. There'll be telemonitoring. ICUs need not be having all the time the doctors to be there. There'll be a single doctor who can be in charge of the ICUs, 2 or 3 ICUs running together and making sure that the things work. This is how we are looking at things, where we can reach tier 2, tier 3 cities rather than having all infrastructures there, and otherwise the cost of infrastructure will be quite high. So this is basically cutting down the cost of infrastructure. At the same point of time, wearable technologies are there everywhere. Even a simple watch can give you so much of information. You ask a routine runner or an athlete, he will find out 10 different things of a watch which even we were not aware of, like the type of sleep what you're having, is it a good sleep, it's a bad sleep, it's a rapid eye movement sleep, how much calories are you burning, what is the zones of exercise. Now we see a lot of, for example, another example, we see a lot of sudden deaths between athletes. So there is something called a zone 5. Zone 5 of running means 220 minus age. I'm 49 young, so 220 minus 49 is 171. So if I continuously go beyond 171, 172 is harming my heart. And this is what results in sudden cardiac arrest in the gyms. So if you're aware of that number, at the same point your watch can track it down, send you an alarm, then you know you're in zone 5 and you're not supposed to go in zone 5 for long periods of time. So you will be aware of that. Majority of the time you'll be in zone 3, zone 4. So this is the kind of data which people need to be empowered with and educated with.
Definitely so. But having said that, what is the penetration of these technologies in the rural areas? And how can we meet these regional disparities? How can we bridge that gap?
See, mobile is everywhere. Everybody, maybe from a tier 2 city, tier 3 city also is using a mobile. Even smart watches, I'm not talking about Apple watches, I'm talking about watches which are about 10,000 bucks, 15,000 bucks, cheaper watches. Even they have that kind of data. The reliability may be a little iffy, but they give you good data. And at the same point of time, the youth, especially the youth, be it anywhere, is watching YouTube, watching videos, downloading apps, everything. So I see no reason why it should not percolate.
Definitely so. And I think Dr. Niranjan would like to speak about the Apollo Aortic program, the digital initiatives.
Sure. I'll just add one point to that and then I'll come to your question. I think affordability is also the huge factor in our country. Like what I'm seeing day to day is, okay, all this is fine, but how much would it cost me? You know, that's the question asked at the end of the day. And, he wonderfully articulated the rest of it. If I talk about Apollo Aortic program and in terms of, how we have included, smart technology into my practice, and this is my day-to-day practice. Telemedicine, of course, plays a huge role. It's been around for quite many years. There are a few hospitals in India who've done tremendously well. There was a big boom during the COVID era and then the post-COVID era. As I just pointed out earlier today that, as we speak, I have quite a lot of patients every week who contact me as the first consultation. That gives them an idea what to expect, but obviously we never have a final diagnosis and a treatment ready for them. But then they come here and they know that, okay, we go there, we'll get, this is how much approximate cost would be or what I should expect. And that becomes a great ad hoc tool because I cannot potentially go there and get these patients. So this, telemedicine plays a great role in that. The other most important thing that I have been doing is multiple centers where they do not have access to advanced aortic surgery. Where, for example, I'm a hybrid surgeon, which means I do open heart surgeries along with endovascular, hybrid, and the whole spectrum of it. And what it allows me to do is give my opinion or, receive scans from them. So what I've done is I've started receiving complete files of these onto my iPad, and I have downloaded softwares where I can actually view these images in a proper planning way. I plan the whole case, and all I need to do is just go travel, execute in a day, and come back in the evening. That's exactly what I'm doing right now. And, or vice versa. I just provide an opinion, I tell this has to be done, and everything is executed there. And I think this is how I've integrated, and I have a lot of ideas and things that I want to implement in the future. In terms of technology and how we can use wearable devices to monitor our patients, just on the lines that Dr. Amit pointed out. And I think things do look promising, and we are an advanced program, and we are hoping to take it forward.
Thank you, sir. A question that I want to ask both of you is regarding the robotic-assisted surgery. As non-cardiologists, we usually find it very fascinating when we see these images, even the ones in this hall right now. What exactly goes with robotic-assisted surgeries? How many cases of cardiovascular diseases can actually these surgeries resolve? And at this moment, given the kind of burden we have, how many diseases can be actually resolved with those treatments?
See, when as such robotic surgeries for cardiology, one is, for example, doing an angioplasty. Now I'm sitting 100 kilometers away in a center, and now there is something called as navigation technology. Israel was the first country which came up with it. So what I do is, I'm sitting in my console 100 kilometers away, and the catheters are there. There is a person who's there, and then the catheter is being navigated from the remote from here. So actually, there's no cardiologist there, there's a technician there, but the remote monitoring is happening from a center which is 100 kilometers away. So in cardiology or cardiac surgery, time is muscle. Every minute counts. So we do something called as a door to balloon time. Like, for example, somebody's got a heart attack, and the moment he enters the hospital to the time you inflate a balloon to open the artery should be less than 60 minutes. So by the time he comes here, the purpose will be lost, because the muscle will be dead, because any person who revives a cardiac muscle is going to win a Nobel Prize. So there's no medicine to revive a cardiac muscle. So time is muscle. So those are things where you can actually use, but in India as such cases, robotics, especially our scenario, where manpower is not exactly at a premium and people can be trained accordingly, will not find much of a niche as compared to, let's say, places like Canada and places like places where the manpower is less. In those cases, it may be the remote surgeries may be a possibility. Yes, another question which you had asked previously, I would like to answer that or add something to it. In addition to the remote monitoring, there is a small patches which we put for heart failure. Now, coming to the cost, heart failure hospitalization is one of the highest in the most common cause of hospitalization in the US is recurrent heart failure. That means the heart is failing at the pump, the lungs are getting congested, people are getting readmitted. So it is huge cost to the infrastructure, to the patient, to the insurance companies. To avoid that, there are small stickers which are available. You just stick that sticker, take it out when you're taking a bath, just stick it back in. So it will just monitor how much of the fluid is getting accumulated inside the heart and whether this patient is going into heart failure or not. So such are the patients where you can prevent hospitalization and save the cost. That's one thing. Second, sudden cardiac events. For example, let's see us versus our parents. So we've got a blockage which is like a 30% blockage. Let's say we've got a 30% blockage and parents have got a 70% blockage. That's a thick cap blockage, gradually progressive. Ours is a thin cap blockage. Now, thanks to COVID, stress, whatever, thin cap blockage 30%, there's this thick cap 70%. After 5 years, it will become 75, 10 years, it will be 80%, gradually progressive. Our cases, weekend workout, weekend binge drinking, emotional stress, physical stress, 30%, suddenly if the plaque ruptures, results in 100%, game over. So to know the sudden cardiac arrest, there are certain modalities in OCT and IVUS which are AI based. Here we can predict that this is the guy who's going to have a sudden cardiac event. This is the guy who has got positive family history. Let's subject him for that kind of investigation. This is the guy who's had an event before. So these are the ones we can actually take it out and prevent sudden cardiac arrest from happening.
In fact, to add to that point, we have something called the Apollo Pro Health. The thing about this Pro Health is you undergo just a routine cardiac checkup, like you have packages. So once you undergo a routine cardiac checkup, the data of the results is fed into AI system. And the AI actually also predicts whether you're at high, low, medium, intermediate risk of developing a heart attack or heart failure or valve disease. So that is another area that we have already implemented at Apollo. And in terms of robotic cardiac surgery, now it's well established that most cardiac surgeries can be done robotically assisted. We do have, in all major hospitals, we have robots now. And it's just that we need specially skilled and trained surgeons who can perform these surgeries. Yes, there are, for example, aortic surgery, what I specialize in, cannot be done robotically as of now because it's far more reconstructive and extensive. But most valve replacements, CABGs, most of the common cardiac surgeries can be done very effectively and much more safely than open surgery through robotically assisted.
Thank you so much, sir. So before we wrap up this fireside chat, I would request both of you to kindly add your insights upon the kind of smart cardiac centers we have today and what is the future of smart cardiology centers.
So smart cardiac center, in my opinion, is the one which will have first all the patient's data should be entered. The data is prime because therein we'll be able to find out which is at low risk, intermediate risk, high risk. There is no point in doing an investigation for a low risk individual wasting his resources, government's resources. So you need to find out and filter which ones you need to target, which are the ones who are prone to having a cardiac problem. So data is the key, data monitoring number one. Second will be obviously telemetry, wherein we will be able to communicate with the patient and we will be able to communicate with the counterparts who are there in smaller cities. Third one is remote monitoring. Remote monitoring, for example, in terms of we as cardiologists, we funnily say we as cardiologists are either plumbers or electricians. So if it is an electrical issue, we should be able to see the data and we should be able to interpret the data. So electrical issues, people, let's say person who's outside the country also or outside another city also, there is a device, if there's any notification, it goes to the central lab, comes to your mobile. So we at Paris or we at majority of the hospitals have these systems where you have any notification coming, then immediately the patient gets a call that this is the problem, you come directly. So third is the ELR or the remote monitoring which is there. Fourth thing is basically enhancing technology and making sure that all the devices which were bulky are becoming smaller and smaller. The access routes are becoming smaller, as I mentioned, the pacemakers becoming smaller, the stents are getting dissolvable stents which are there now. Then fourth and fifth is ancillary imaging. Imaging is the key right now, be it CT scan imaging. Right now, all of us sitting in the room, they go inside a CT scan, there is no need to put a needle right now. They just go inside the CT scan, get an AI assisted CT coronary calcium score, it will predict your future of having a cardiac attack in no time. So these are like ancillary imaging is the key, prevention holds paramount. So these are 5 things which are a must in any smart cardiac center, in addition to all other modalities of advances of cardiac surgery and cardiology we talked about. But these 5 centers, things are paramount.
Thank you so much, sir. Dr. Niranjan, would you like to add something to sir just said based upon like the interdisciplinary collaboration of healthcare administrators, doctors and tech disruptors?
As I said earlier, I think the industry partners should be the bridge between doctors and patients. We should look into that avenue, how we can integrate industry health partners to help get technology or make it more reachable to people, and of course the cost factor. So can government play a better or should I say a improvised role in making it more accessible for patients, and also the compliance. I think more and more doctors should of course adapt the fact that there's good technology available. It's available. It's not like we have to design something new. So how can we harness what we have? That is something we need to look into.
Definitely so. I think that we're done. We don't have much time now, but definitely training clinicians and updating them with tech is one of the major impacts that can generate some good impact in smart care. Thank you so much. It's an honor to share the stage with both of you, and it was a great fireside chat. I would request Kamal sir to kindly...
Thank you very much indeed. Ladies and gentlemen, let's put our hands together for that insightful fireside chat that we had with two of our eminent speakers. Once again, inviting on stage Mr. Kamal Narayan, CEO, IHW Council, to kindly do the honors of presenting a token of gratitude and appreciation to both our eminent participants for this chat. We present to Dr. Amit Bhushan Sharma. Thank you very much indeed, sir, for sparing your valuable time and joining us here. We now present to Dr. Niranjan Hiremat. And may I request both our speakers, Dr. Anushka and Mr. Kamal Narayan, to kindly come together for a group photograph. With ladies and gentlemen, again, let's put our hands together for that wonderful session we had. Thank you very much indeed, Dr. Anushka, for moderating this insightful session. And ladies and gentlemen, we would request everyone to kindly remain seated, as without taking any break, we are straight away moving to the next session, which is once again a panel discussion session, and the topic is Evolving Smart Hospitals by Integrating Healthcare Operations and Technology for Advanced Care Solutions. We would request you to kindly bear with us and give us a few minutes while we arrange the top table for the next session. Thank you.
Converge for Summit of the Future Action Days at UN headquarters in New York. IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time.
Ladies and gentlemen, we are now all set to go ahead with our next panel discussion session, which is on evolving smart hospitals by integrating healthcare operations and technology for advanced care solutions. And I have the proud privilege now inviting on stage our distinguished moderator for the session, Mr. Vishal Gupta, who's country head healthcare business in Gram Micro. Let's put our hands together, ladies and gentlemen, to welcome Sir to the stage. Also inviting eminent panelists for the session is Dr. Divleen JG, India lead Google Health. A very warm welcome to you, ma'am. Inviting Mr. Ashwin Amrapur, co-founder and CEO. He's Alchemist Technologies. A very warm welcome to you, sir. We invite Mr. Pratik Ghoshal. He's the shareholder and chief of strategy, growth and digital Ujala Cygnus. A very warm welcome to you, sir. Inviting Mr. Praveen Bisht, CIO, Amrita Hospitals. A very warm welcome to you, sir. So, ladies and gentlemen, we now move towards the panel discussion titled Evolving Smart Hospitals by Integrating Healthcare Operations and Technology for Advanced Care Solutions. And this session will explore the powerful intersection of technology and compassionate care in modern and smart hospitals. The session will also showcase the innovative technologies and strategies that not only improve efficiency and accuracy, but also emphasize the human element, ensuring healthcare remains patient-centric. And I have the privilege now to say a few words about our distinguished dignitaries on the panel. We have with us Dr. Divleen JG, India lead Google Health, who is the visionary leader at the forefront of healthcare innovation, where all AI and technology are shaping the future of care. We have with us Mr. Ashwin Amrapur, co-founder and CEO, Alchemist Technologies, whose work in AI-driven solution is transforming healthcare delivery, and operational efficiency. We have with us Mr. Pratik Ghoshal, who is a shareholder and Chief of Strategy, Growth and Digital at Ujala Cygnus, who brings deep expertise in strategy and digital transformation in the healthcare sector. We also have the privilege of having with us Mr. Praveen Bisht, who is the Chief Information Officer, Amrita Hospitals, a leader in digital innovation, integrating technology seamlessly into hospital operations to improve patient care. And ladies and gentlemen, our distinguished moderator for this very exciting session is Mr. Vishal Gupta, Country Head of Healthcare Business in Gram Micro, whose vast experience in healthcare and operations and technology will guide the discussions with expertise and insight. So without wasting any more time, may I now hand over to Mr. Vishal Gupta to kindly carry forward the proceedings of the session. Over to you, sir.
Hello. Good afternoon, everyone, and thank you all for joining us today, and thank you, panelists. So, thank you for joining in this heavy rains to the audience. Let's speak. And before we start, let me have a quick introduction of myself. I'm Vishal Gupta. I'm currently headquartered in Micro. I have been in healthcare IT since last 25 years. I was a director for our installation from the back space, and have implemented many IT projects and operations in various parts of the world. And I'm delighted today to be your moderator and to have this panel discussion with our esteemed panelists. We have Praveen Bisht sir, and we have from Alchemist, we have Dr. Divleen from Google Health. So this is a kind of a very privileged panel. We have a participation from the healthcare provider side as well as from the healthcare technology side. And it is a kind of the panelists, they bring a wealth of knowledge, experience on the table, and very sure that you are going to hear lots of views on smart technologies, lots of views how they have supported their various corporates where implementation they have done in the past related to their smart health monitoring systems in their hospitals as well as the customers. So welcome once again, everyone. And before we do that, let me set the context of today's panel. So we will open the floor, post this panel with a few questions. So my request is to be ready with your questions, be part of this discussion, be a kind of a engaged audience. And before I start, let me set the context that what we are going to cover today and what is my understanding of smart hospitals in the country. So when we say smart hospitals, primarily we are talking about the three basic segments. So we want that panel to focus on these three basic segments. The primarily which we call the clinical excellence. There are so many talks references this morning on the clinical excellence. And if you ask my view in a healthcare, IT person in healthcare since last many years, clinical excellence is something which is really providing a kind of help to the clinicians, right? Be it nurses, be it doctors, or how we can provide them with tools and technologies, monitoring system, to provide a clinical decision support system to prevent, this human errors, to provide a better patient care, and how we can provide some kind of a tangible system to support their day-to-day lives. So that is my definition of clinical excellence. The second important part is the operational efficiencies, the tools and technologies, the connected systems where we can provide some sort of operational efficiencies within the healthcare corporates by reducing the cost, by generating some revenues, as well as by maximizing their their efficient loads. So these are kind of systems which we need to think of when we talk about the operational efficiencies. The resource management is one of them. The third and most important thing is the kind of a patient delight. We call it patient excellence or the patient delight factors. Now, what kind of tools, what kind of technologies, the innovation we can think of from your experience, what we have deployed. So I will ask questions around that. So that ultimately the patient and their families, when they stay in the hospitals, they feel connected, they are well taken care by the technologies, and how we manage their stay during the hospital. So that is kind of the focus for that. So let's start with you, Praveen. Since before I start with you, let me have a quick introduction. Praveen is a kind of a very seasonal leader in terms of IT, and he is managing Amrita Hospital. Amrita is one of the busiest hospitals in the country. It's a new project and having a very unique kind of challenges to manage the rush of the patients and kind of the technologies innovation they have deployed recently. So I have two set of questions for you. One is very generic and one is specific to the hospital. The first question is, how can hospitals like Amrita can streamline their workflow and improve efficiency through the use of advanced technology? And the second one is, what are the key components you have deployed at Amrita Hospital to integrate healthcare operations with smart health technologies? So few examples would be very good for the audience.
Great. Thank you, Vishal, for giving this opportunity. Just a quick background for some of the folks here. So Amrita Hospital was inaugurated a couple of years ago by Modi ji, our Honorable Prime Minister. It was August of 22, so it's been 2 years in operations now. By capacity, we are probably one of the largest, 2650 beds, so 2,650 beds. Not all of it is operational, but we are heading towards that. In the course of time, over last 2 years, we first started with the nursing college also in our campus, then medical school, and you'll be surprised, just this month we also started a BTech program, AI in medical engineering. So it's one of its kind program where we want to leverage, having a super specialty hospital with all the functions that are available, all the expertise that are available. So we are, honored to have this one of a kind program. So now going back to, the question that Vishal asked. So I'll try to kind of, mingle the two and then try to answer. In terms of how we have approached this whole problem is definitely coming up with an integrated solution is not off the shelf, right? There's no easy solution available in the market. So definitely a lot of thought goes into planning of that. And we have done our due diligence. We started the whole IT team, a couple of years even prior to the hospital getting inaugurated. So I have been with in the Faridabad facility now for 4 years actually. So 2 years prior to that, myself, my team have been thinking through, planning it, having a lot of discussions with our management, and at least we had our goal defined that yes, we need to have a seamless integrated patient experience that we want to provide to the end customer, which is the patient here. And if you do that, automatically other things line up. For example, only if you have a good operational management, you have good optimization there, will you be able to give a good patient care. If you are not able to manage your waiting time, patient is not going to be happy. So patient care, if you can focus on that, automatically other things also have to be aligned if you want to really ensure a best patient care. When I'm saying best patient care, it has to be at a right price. You cannot be charging exorbitant value to the patient. So you have to have your operations streamlined, operation optimized, and also the clinician part of it, right? The clinician have to be supported by the workflow for them to do their job best, which will again in turn result in patient satisfaction and patient delight. So I'll give you a couple of examples. One of the solutions that we have implemented is providing a very specialized chatbot for the patients waiting in our OPD area. So before the patient actually goes to the doctor consultation, he typically spends 10-15 minutes in the OPD area. So there we provide them with a chatbot where they could be interacting with it, either receiving information, so they come for a dermatology consultation, so they can be reviewing some of the important related matters. Also, we'll be prompting the patient with a set of questions. So as they respond, we'll be gathering that information also about their current condition that they are here for, which allows that information to be presented to the clinician. So when he walks into the clinician's chamber, the clinician has a fairly good idea. So instead of him noting down the information as he talks to the patient, he's actually reviewing and kind of validating and verifying with the patient. In that respect, patient feels that they are being looked upon, they have been cared for, time being spent on them. Otherwise, we do hear some complaints from clinicians saying, "Arey yaar, patient is saying कि हम ज़्यादा time computers में spend kar rahe hain, and we are not able to spend enough time with the patient." So that part, we have tried to kind of work around with by taking that information with the patient so they feel engaged even before walking into the doctor's consultation. And while they are there, that information is helping the clinician to provide a better care to the patient. So that is one example where we're kind of aligning the clinician side with the patient care. Second part, in terms of operational efficiency, we have implemented AI solution for scheduling our surgeries. So, actually, if you look at our whole landscape, so we have 64 operation theaters. Not everything is operational today, but eventually we will have them. And with surgeries happening, you can imagine the complications, the complexities that come around scheduling all of them. So for that also, we have devised an AI solution where the plan for the following day is presented to the AI tool, and which looks at all the possible in terms of the constraints, so to speak, in terms of the logic, in terms of availability of CSSD sets. It will look at availability of the blood products that are required. So all those constraints it will look into and then provide an optimal plan. And then when the plan is getting executed, obviously there will be some delays, some changes. The time that the surgery was supposed to be for could get extended. So all those things are again real-time fed back to the system, and it's able to optimize it further and present it back to the clinician. So it is a fairly closed-loop solution where we have been able to get a good efficiency from our planning system. So overall, again, results back in a better optimization of resource management, and then eventually a better customer service and customer care.
Thank you for being here. Pratik is from Jala Signals. So Pratik, the kind of hospitals we have, especially in the tier 2, tier 3 cities, the kind of model you have, where you are serving to the population of tier 2, tier 3 cities, and you have to be kind of a cost sensitive in terms of the, providing the care to these patients. So I have questions that what challenge do hospital face when trying to integrate the new technologies with the existing systems, because there are so many tools and technologies which you really transform from your legacy systems. So what kind of challenges you face frequently? And the second is, if you can provide few examples, few projects which significantly enhanced the patient care of tier 2, tier 3 cities of your network, with few examples.
Sure. Thank you so much for the question. I think if you look at from a tier 2 context and larger Bharat, if I talk about, there are a lot of small hospitals, nursing homes that are available for the mass patients. AI and ML are not relevant to them as of now. It is a step 2, step 3 in their digital journey. The step 1, which is the most fundamental aspect right now, is to have a very strong hospital management software. That is the most fundamental thing that will enable AI to actually work and do better. The challenge comes when you start making the entire hospital paperless, right? That's the entire idea, to improve the patient experience. Manpower is a challenge, and change management is even a bigger challenge. To actually ensure that our workforce understands that how their time will be saved, how processes will become more efficient. If I'm able to save a nurse's time who is spending a couple of hours on a discharge summary, and I can have an auto discharge summary generated from my system using data, that will make the patient's life much more easier and will enable the nurse to do more fruitful and productive things. The overall landscape, I think, revolves through a mix of technology and empathy, as we were discussing initially, right? Digital on its own will not convince a patient, especially in a tier 2 context where trust and transparency is very important. A patient is coming to a hospital after having visited 4 GPs who have told them multiple things, but they're not able to get the right treatment. They have already spent enough money, and they are usually daily wage earners. So a day outside of their work is a loss to them. So how do you convince that patient what is the right treatment to you? How do you get the right support? So one example that I'll give is we run something called Sehat Chopals, which are camps in regional centers, Indian hinterland villages. We have 22 hospitals today. Every day we are doing one Sehat Chopal. And a Sehat Chopal has an interesting combination of human-centric touch and a technology. We have something called a Sehat Sathi, who is the point of contact for the patient, who will act as the counselor, help address any emotional distress, financial distress. But what we are trying to do is make the job of the Sehat Sathi simpler by enabling and giving them technology. So they will have a simple CRM in place where you are in a remote village, does not need any kind of internet services. A patient will come, the data will be filled on the CRM by the Sehat Sathi. The data, obviously with the recommendation of the doctor, will be screened by a system, and based on the acuity of care, they will be put into separate buckets. And people who need urgent attention will be given a different message. People who need a regular health checkup, they will be asked to do that, and a follow-up mechanism will be in place. People who only need medicines will be sent information about pharmacists close by, and it doesn't have to be through us. We are trying to create a network where the patient feels trusted. That then flows into our hospital and so on. So that combination of technology where we are trying to screen a lot of the patient data that is available with us. We have almost patient data of 2 million patients, but how do we actually use it to get good insights for them and then have a human touch to actually show that we care for you and we are transparent in the entire patient journey that we are with you.
Thank you, Pratik. And it's good to know your views, especially to provide technology to assist the remote site workers. That is really great, because we keep on talking the use of technologies, especially in the tier 1 corporate hospitals. So how to use the same technology, especially the smartly, to provide the care to the remote hospitals. That is great insight. Now I move next. Actually, we covered the provider side, so let's start with some technology side. So Ashwin and Dr. Devleen, you have heard that what are the challenges, what is the the key things which provider side are using in terms of the technologies, tools, especially in their hospitals, and what are their expectations from the technology providers. So since you have worked with the various platforms, I mean, you spend your life in terms of the technical platforms, you worked with Liberate, you worked with Telenor, right? You have a great experience in terms of the technology platforms. So I have a questions for you. I really want to know your perspective of the technology, platforms, how they can support. That is not question. That is my own expectation. So how these tools and technologies should be supportive to the overall ecosystem of India. And my exact question is, in what ways do advanced technologies like the PHR, EMR, so many tools which we daily use to manage our health records enables more personalized and precise patient care, and what role do patient engagement and self-management tools play in advanced care solution, and how they integrate with the smart hospitals, especially when the EMR data, the clinical data or EHR data, whatever we say, is coming from the various sources, and most of the data is coming from the unstructured format. Still in India, most of the hospitals, they have not integrated. They have the clinical EMRs. Those EMRs are not structured, and majority of our health records are paper based. So what is your advice? What are the how you kind of advise to manage that situation?
Hi everyone, good afternoon. So, too many questions. Massive solutions have been thought about, massive solutions are available. But I'll start from something which is very easy to talk about, but potentially very difficult to implement. And everything, I think, today centers around the end customer. Hospitals would refer to the end customer as their patient. We as technology providers would call them users. Ultimately, customer is king. Data, whether it is health data or any other data, at this point in time, should and is largely controlled by that particular user or patient or end customer, whatever you might want to call them. Now it is up to this customer to, number one, be aware as to what kind of data exists in their device. This could be a phone, this could be your watch, this could be a smart ring, this could be any wellness or medical app that today this particular user uses. So one, the user needs to be aware of what that data is. Second, this user needs to understand the importance of connecting that data. And thirdly, the user also needs to understand the importance of consent. So in this audience, I'm sure every single one of us has medical reports or medical data in some form or the other sitting in your phone or your laptop, or even smartwatches for people who are wearing it. But I don't think anyone here has taken 45 minutes to upload that data onto a DigiLocker. And a DigiLocker is a service which today is being provided by the government of India. It's a free of cost service. Is it inconvenient? 100% yes. But will it serve a purpose as we go forward? Potentially yes. So to answer your question, I think precision medicine as we want to envision it, or as we envision it today, as well as personalized care, is something which is definitely a reality. We as Google have deployed some of our AI products across ecosystems, across actually countries. So Singapore, Indonesia, Taiwan, we've deployed our AI products across these health systems and basically tried to develop personalized care solutions for every single subgroup of the population which might be available. Is it possible in India? Yes, it is. But how long we'll take to get there, I think remains to be seen. Having said that, I think in India there are different ecosystems which exist. So you have tier 1 cities which have the organized hospitals, you have Apollo, Paras, Manipal, you name it, and they're all there. And you have tier 2 cities, as Mr. Ghoshal just spoke about. Then there's, of course, independent practitioners. We have seen that larger hospital setups, like a Manipal or an Apollo or a Narayana for that matter, are today very pro-technology. They're willing to invest in solutions that make that reach customer delight levels and ultimately lead to loyalty of patients. We've been successful in deploying them across all segments, making the entire experience paperless. We ensure that there are the right kind of nudges, the right kind of personalization that happens so that people don't miss their follow-up appointments, people don't miss out on reordering medicines and things like that. But is it something that is that we've reached, India scale levels? Definitely not. Is there a possibility? Yes, 100%. But as was already discussed, I think in order to get there, we need to have a basic level of digitization which exists across healthcare. And that basic level of digitization also needs to be potentially uniform. As you already mentioned in one, I'm sure you've seen this, one hospital will probably have 4 different versions of the EMR running. So I think from a hospital ecosystem perspective, possible, but will take time. On a personalized consumer level, I don't think we are very far away from personal health assistants. I think the next few years, personalization of health insights, precision medicine is something that will become very commonplace.
Okay, thank you, Dr. Devleen. That was a really great insight. And good to hear, the work Google Health is doing, especially in the personal health records ecosystem, and especially in touching the lives of the common citizens, to manage their day-to-day healthcare records. So I, touch base. I want to, kind of a insight from you, Praveendji, again, that especially lots of data is coming as a. Actually, that was a question for you, but now I want a provider perspective on that. That especially how to manage the unstructured, because EMR is the point of entry, that is a kind of a main pillar of your ecosystem, and most of the data is unstructured data. So what is your advice to manage that unstructured data so that we can talk about the more powerful tools of the smart health?
Okay, yeah, wonderful question, because I think that problem is faced by most of the hospitals and healthcare providers. Fortunately for us, it has not been an issue. Reason being, we had earlier experiences, or rather bad experiences with some other solutions. So over time, we have developed our own in-house solution, and we have ensured that it kind of touches every single department in the hospital. So it's a fairly integrated system. So we are not facing that challenge, but I have seen those issues being surfaced. So one of the point that I want to make, maybe an advice, is make sure whichever software you decide to get, you have prior discussion. Make sure any third-party solutions that you have planning to buy going forward, you have some understanding there as to how data can possibly be retrieved. You should have option of getting the data, because a lot of time you get these services which are over the cloud, but you don't have direct access to some of the data, even if in future you want to migrate over, or do some possible integration between your, say, EMR solution and some of the third-party solution that you might go ahead and invest in the future. So all those things have to be definitely taken into consideration. And also, if you have some agreement in terms of having a room for customization, because whatever said and done, no solution will be able to fit to your needs 100%. So definitely you will require some changes. Sometimes it is configuration, so it doesn't require extra development, but sometimes there are customizations that are very much needed as part of that. So whatever solution you go with, you have to engage with the vendor and ensure that that part is taken care of. So there should be some room of customization. Obviously it will come at a cost. Nothing is going to be free, but at least you should have that taken care of upfront, so that whenever there is a need, you can engage with them and then do the needful. And it's very, very important to have those things integrated. Otherwise, you might deploy a lot of solutions and you will get some incremental benefit, but to get a complete benefit, it has to be integrated. It has to be, we call it like two-way integration. So data has to go and then come back, and with that you can derive the maximum benefit out of it.
Thank you, Praveenji. And it is really a good point which you touched base, that the room for customization. I think that is the most important thing whenever we deploy any implementation of any HIS or any clinical application. I think that is an important factor. And I would add one more thing, which is the stakeholder involvement, because most of the time, the projects, or especially the health tech project, should not be a purely tech driven. That should be a kind of a clinical driven to get a maximum
Absolutely, output. And I think change management was also mentioned. That's very, very important. Sometimes we don't give it equal importance, but it is absolutely necessary.
Right. So now I move to Mr. Ashwin Amrapur. Ashwin, you are the co-founder and the CEO of Alchemist, and you are the technologist amongst all of us, and you have a great insight in terms of AI, ML, in terms of deep learning, and in terms of other innovative tools. So, and you heard this challenges of all of us from the provider side, from the tech side. I have a very specific questions for you. How do you foresee the evolution of smart hospitals over next 5 to 10 years? And what are the emerging technologies, that are likely to drive this evolution? And the second question is, what are the potential impacts of integrating advanced technologies on hospitals' budgets and financials? So, would you be able to share your insight?
Yeah, it's a very good question. In fact, I had been always technologist, and after graduating from Indian Institute of Science, I built some first Indian language speech recognition engine way back in 2007 for mobile phones. So I've been always tracking technology, and then also building technology, where today when we talk about going to airports, for example, you see Digiyatra, right? It's a wonderful piece of technology. Similarly, airport security checks, all the security checks of having your, any guns or anything like that, that is already there. So now coming to adoption of technology like AI, how actually it has to be, how I can foresee is that today, AI as it is actually quite maturing, especially in the conversational field. It's almost like, a human, you can see a Turing theory, right? When you talk to some person on the other side, you really don't know whether it's a human or not a human. You are almost like, you can't make out unless it is revealed. So that's the real art, that's the real intelligence, where you cannot really figure it out. So that's what is almost happening. So you'll probably not be able to figure it out. Okay, so now in terms of adoption, right? So where Dr. Dillon was telling is that first, possibly the consumers adopt much faster than the businesses. It's always happens historically, many ways actually, mainly because for example, cloud storage, right? So the first, people are opted for actually storing their, photographs and everything. So the business has many things to take care of before actually adopting technology, many processes to take care of before adopting technology, but it will eventually happen actually. So the way I see is that the kind of the advancements that are happening today, okay, technology definitely will be 5 to 10 years ahead, and by the time that adoption comes to businesses, it will actually lag behind that much, okay, and but it will transform tremendously things, okay. The way we foresee is that from the time the patient actually enters, right, from the time that he actually comes out of the hospital, the time going to be reduced tremendously. okay, it will be almost like an airport-like experience for somebody. Okay, the kind of like, very seamlessly managed thing. And that is what, the technology is going to enable in every step. The AI is a big piece of tremendous thing where you can probably get, the best of the knowledge at your pockets, right? So you already have it in your hand. The way today, even just in 1 year, 1.5 years, we see that the people are using GPT, right? It's tremendously has gone up, and everybody loves it, right? And once you actually reduce that friction of adoption, right? It actually becomes very easy to adopt multiple things, and that happens. You are looking at operational efficiency. That's the first thing that I think. And when you talk about in businesses, the three main things normally comes into picture. Like one is the emergency. When you have an emergency, you need the care, at most, right? You have always stroke golden hours, right? So you have heart. You also have a very immediate intervention required. So many like that. You have emergency cases. Then you have the laborious cases, right? So you need very difficult operations, for example, right? So those are laborious cases. And then you have voluminous cases, you will be inundated, countries like in India, it will be a reality, there are so many patients, you will be actually have to take care of things, for AIMS, for scanning, you will have a more than 1 year MR scanning, waiting time is there. So you're actually, the access to technology is not that easy, the affordable technology is not that easy, so you will be inundated. So all these three problems, the AI can become a transformational quotient to change it, okay, and that is what is going to be, they make the, especially in the healthcare. When I had worked in many other fields, I see healthcare needs it. The reason I switched fields to healthcare is the main reason is that healthcare needs it more than any other field today, okay. The access to fundamental healthcare, the quality healthcare, the best in quality healthcare it should be a fundamental right to every citizen of right. So that is what we want to. And as far as India is concerned, I believe that India is a little late adopter, be it even in mobile or internet, it has happened, but it's a long tail adopter, right? So you will see that almost it actually reaches to every nook and corner of the India with this kind of technology. Yeah.
Thank you, Ashwin. And great things, you mentioned that operational efficiencies and how AI can be used, especially to providing care, especially to reducing the, the cost, the operational cost, and enhancing the quality in healthcare. That is, I think, a great insight. And I hope the technologies will evolve, and we all, especially the technology people, the health tech companies will evolve to provide more tools and technologies. With that, I am over with my questions. We have some time, so before I thanks to the panelists, before I thanks to the audience, because in this, post-lunch, how patiently they are with us, engaged, and spending time, to listen these great insights from the esteemed panelists. So I'm open for the questions. In case any of you have any questions, I would request panelists to answer those questions. Anyone, any questions, please? Related to the smart health tools and technologies, challenges, anything you want to know. We have the provider side as well as the tech side.
Integration of two softwares, why is it so costly? Isn't that a bottleneck for implementation of technology in healthcare industry? Because one single software will never provide you a solution. There will be multiple softwares. It's inevitable. So integration of those, the cost involved, I think it's a bottleneck for what we are calling as an EHR, having all the data and using the data. So any solution, especially in a country like India, which is cost sensitive. So could we have any solution for that, or I'm not sure.
Shall I attempt? I can give some pointers, may not have all the answers for you. Definitely it is a challenge for multiple reasons. One being the data that we decide to use not necessarily is standard based. right? So with that said, even a simple disease, if you don't follow ICD diagnosis, you could be calling to different people, will be calling differently. So now if you have to pull that data, you cannot, because it's not standardized. That is one part of it. To prevent that, there are some standards that are available, not only on disease side, on drugs, the generics, all that. There are some standardization, including some of the lab investigations, right? So there is a line code that could be used. There are a lot of nomenclatures that can be standardized, including nursing care. There is a NANDA standards for nursing care also. But even if you do those, even if you follow the standards, if you decide to integrate two different systems, they both have to now follow the same standard, as well as follow some protocol. For example, HL7 FHIR is one of the standards for communicating data from one system to the other. Unless and until both are following that standard, even if you have the data in the right format, it will not be able to communicate with each other. So there are different levels of integration. One is at the database level, second is more transactional level, where this FHIR interface comes very, very handy. So yes, there are challenges, but there are ways around it. But proper planning and thinking through is very essential. And you cannot do that post implementation. It has to be prior to getting into those discussions.
Regarding this, can't there be any standards which the developers should follow for seamless integration? Or
let me answer this. So earlier, actually I was about to say this. Earlier in India, especially even the other parts of the world, there was very limited standards, limited protocols, limited understanding in terms of the digital health integrations. But recently, especially if I talk about India, the two things which Praveenji just mentioned, the FHIR and HL7, these are the two key protocols which the government is basically advising the people. And there is the complete framework, the Ayushman Bharat Digital Mission, with the support of CDAC Pune, they have published. And if you see, that is available on the net. And that is a FHIR profiles available for all kind of integration works between, there are 7 use cases, we call it 7 instruments where the integration has to happen. And a detailed structure of all inbound and outbound structure level, JSON message level, FHIR, the framework is published. So I think it is now easy. And I think that is one of the kind of initiative that would reduce the the cost of integrations as well.
Yeah, I think maybe I can add on that. I think regulation plays a very important role in standardization. If you see the US healthcare system in 2007 or 8, the EMR adoption or coverage was 7 to 8%. Within 10 years, it reached around 85%. And it was mostly driven by a lot of regulatory change. The Affordable Healthcare Act came in. A lot of push was there from the government, which we are seeing right now as well, as was pointed out, right? APDM is leading the creation of the digital infrastructure for all hospitals and providers to be on the same platform like UHID is doing, like UPI was in the field of payments. A similar system is being developed on the NABH side as well. Earlier, there was a standard NABH accreditation that a hospital would go for, which is an entry level or a full accreditation. Now, that is also changing with the push towards digital. Now, there are 2 more standards that have come in recently. There's a digital NABH standard. There is a standard for EMR and HIS as well. For ensuring that there is more standardization, there is more possibility of integration with different systems, because every player will try to save its code. It will try to save its own data. They all become wary when suddenly they're asked to share their APIs, share their data. They will have some questions in mind. What if they take the code away and I'm not relevant anymore, right? So I think it all boils down to a little bit of regulation coming into the picture, which is coming, I think, over the past year or so. And there is a strong push there.
Thank you, Pratik. Any other question from the audience? Okay, so I think I take a pause here, and I would like to extend my gratitude to all the panelists as well as the audience for listening us out. And I hope that was a kind of a a meaningful session, and I hope that audience would be able to carry a few key takeaways and would be able to implement those takeaways in their hospitals as well as the IT sectors. Thank you all.
Thank you very much indeed, sir. And ladies and gentlemen, let's put our hands together to thank our dignitaries for this wonderful session that we had. And may I once again invite Dr. Kamal Narayan, CEO IHW Council, to kindly come up on the stage to do the honors of presenting a token of gratitude and appreciation to all our eminent speakers. We begin with presenting to our distinguished moderator, Mr. Vishal Gupta. So if you could kindly come in the center, we get better pictures from there. Thank you. And so ladies and gentlemen, once again, round of applause for Mr. Gupta for that wonderful session. We present to Mr. Dr. Divleen JG. Thank you very much indeed, ma'am, for all those valuable inputs we had from you. We now present a token of appreciation to Mr. Ashwin Amrapur. Thank you very much indeed, sir. We present a token of appreciation and gratitude to Mr. Pratik Ghoshal. And to Mr. Praveen Bisht. And now we are presenting to Mr. Praveen Bisht. Thank you very much indeed, sir. And may I request all our distinguished panelists to kindly come together in the front for a group photograph with Mr. Kamal Narayan. Thank you very much indeed. And ladies and gentlemen, I would once again request everyone to kindly remain seated as we are straight away moving into the next session, which is once again a fireside chat session. We would request you to kindly bear with us, give us a few minutes while we arrange the top table for the next session. Ladies and gentlemen, we are all set to move ahead with our second fireside chat session, which is on From Innovation to Implementation, the Global Femtech Revolution. And may I invite our distinguished moderator for the session on the stage, Dr. Hema Divakar, who's member of the FIGO Executive Board, co-chairman and CEO Artist for Her. Let's put our hands together, ladies and gentlemen, to welcome our distinguished moderator. Also have the proud privilege of inviting eminent speakers for this session. I would like to invite Mr. Shantanu Pathak. He's founder, Doto Health. A very warm welcome to you, sir. Inviting Dr. Parag Bhamare. He's country lead material and newborn health, FIGO. So, ladies and gentlemen, as we move forward towards our next exciting journey, we arrive at our next Fireside Chat session focused on a rapidly emerging sector that is transforming healthcare globally, from innovation to implementation, the global Femtech revolution. The Femtech industry is revolutionizing women's healthcare with groundbreaking technologies and innovation in reproduction health, maternal care, menopausal management, and mental wellness. In this session, we will explore how tech is addressing women's unique health needs and the challenges of making these cutting-edge technologies accessible on the global scale. And we are honored to have with us today as distinguished panel of dignitaries who are each making a significant stride in the Femtech industry is Mr. Shantanu Pathak, founder of Doto Health, whose innovative work is helping shape the future of the women's health through technological-driven solutions. And we also have the proud privilege of having with us Dr. Parag Bhamare, who's country lead for maternal and newborn health at FIGO, an expert in maternal and newborn care with deep knowledge of the challenges tackling the women's health, especially in the rural areas. And ladies and gentlemen, we are honored to have with us Dr. Hema Divakar, who will lead us through the Fireside Chat discussions on the global Femtech revolutions and the future of women's health. Dr. Hema Divakar is a renowned obstetrician and gynecologist with over 3 decades of experience in women's health care. She is currently a member of the FIGO International Federation of Gynecology and Obstetrics Executive Board, where she plays a pivotal role in shaping a global strategies for improving maternal and reproductive health for women. And Dr. Divakar is also the co-chairman and CEO Artist for Her, the Asian Research and Training Institute for Skill Transfer, an organization dedicated to enhancing healthcare outcomes for women in Asia through education, research, and skill development. Through Artists for Her, Dr. Divakar is working towards empowering healthcare professionals with the skill needed to empower women's health needs. And ladies and gentlemen, during this session, after the Fireside Chat, Dr. Hema Divakar will also share about her book and launch the cover of the book. So let's once again put our hands together as we open this Fireside Chat, and I hand over to Dr. Hema Divakar to kindly lead the discussions with our 2 eminent speakers. Over to you, ma'am.
Thank you very much. Namaskar. And at the outset, this is called Fireside Chat. So Kamal, Nikki, Anushka, and the organizing team. Where is the fire? Okay. The 3 of us here have now to do the job on setting this house on fire. So here we go with some insightful, exciting discussions where we believe that, contrary to the expectations, in low middle income countries like India, the future is now, because we have already done the leapfrogging on the technology, and the health tech, as we all know, is limping forward, so to say, compared to the technological, not only the innovations, but also the friendly uptake by the people at large, the Femtech being a subsect of the health tech. When we brainstormed within a group of women, doctors and the experts. Many of them, until the recent past, hadn't even heard of the word Femtech. It simply means technology in the space of women's healthcare, as simple as that. And what is so special in having some lead technologies in women's health? Why? Because there are some issues that only women face. For example, menstruation. The first very app that came into the market was Clue, and that obviously is the issue for girls and women, so it makes it very unique, very niche, very special. Similarly, the pregnancy. When a husband and wife are arguing, husband said, I can do almost anything that you do, and the wife also said, I can also do almost anything that you can do, but then the clever wife asked, can you carry the pregnancy? So that is again a unique space for the gift of motherhood that God has given. So pregnancy related innovations leading to the implementation. So I have these two fine gentlemen here whose gray cells are active for more than 24/7, all the 365 days, constantly churning in their mind how much more and how much better they can do. On behalf of my better half, Dr. Diwakar, and myself, who run an allied organization to our Center of Women's Health Excellence, that is the ARTIST, as you can see, Asian Research and Training for Skill Transfer. We do believe that the digital space allows us to really translate all those cliched words, reaching the last mile, leaving nobody behind, all inclusive, equity, quality, everything can be driven through the space of technology where we create history beyond the geographies. One outstanding example is if this was not a face-to-face meeting, if it was purely technology driven, then the other panelists who were supposed to be here with me, who are stuck in the traffic in various parts of the city, would have joined the discussions. I have been getting messages on my mobile that we are stuck for 3 hours in the traffic, we are in the same spot since 1.5 hours and we couldn't reach here. Well, if you can imagine a woman in labor being in trouble, is stuck in the traffic and cannot reach where she has to. Whoever is available there has to do the needful, and we've had examples of how the specialist is instructing through a video call as to how she has to deliver the baby. This happened very recently in the state of Tamil Nadu, and we have documented it as a testimonial. So to cut the long story short, yes, technology is indeed a catalyst, and we will hear from Dr. Shantanu and Parag, who have dived deep into this space, already reaching some innovations to the world at large. And when we say research, we mean implementation research. The ideas can be there, but to get it off the ground, to get into an action mode, you have to really see what works in our country. And the contexts and situations can be different. So if we create a role model in our country, yes, it can spread to South Asia, Africa for sure, and the West is also taking some lessons from the countries like ours, and we are so proud of what we have showcased to the world. So my first question to Shantanu Pathak. Shantanu, tell us some little bit background of how you got into this space of Femtech. What was running through your mind? Because many people who have got into the Femtech space, it's something to do with their mother, sister, wife, and they've said, why can't I innovate something in this space which can be really, really helpful, not only for my wife, but for many mothers to be. So what was your thought process when you bought out a very beautiful device that we use? It's called Baby Beat. Okay, Tom Cruise, I believe he bought a scan machine home because he wanted to see his baby every day, that's what he was doing with his wife. That's, that's the craze for the technology. So Shantanu is somewhere near there. he just wanted to hear his baby's heartbeat every day, I guess. So tell us that story, Shantanu.
Well, I did use the fetal monitor personally at home. Me and my wife performed the test. We went to Dr. Gupta's hospital, your good friend, once I realized that contractions have started. So, of course, I used it for my personal use. So that's the belief I have on the technology also. Briefly, I come from a very small town in Vidarbha region. You've heard a lot of issues. Then I got to know that, yeah, it's an aspirational district also. So the issues related to health and access to care is the first motivation for me, because my family members, and when some of the people who used to visit our office at IIT, they would ask, like, are you from the family of doctors? That's why are you in this space? I said, no, I'm from the family of patients. So that's why I'm in this space, and my motivation to come here is to actually understand those problems more effectively. The reason to enter into women's health has more engineering background, where I was tempted with the fact that if I work with a mother over the 9 months or address the issues of high risk, I'm impacting her life as well as the next generation. So what we call in Hindi, ek tir mein do nishan. So that was more, objective thinking that, oh, this is perfect. Like if you work with the mother, it's impacting the whole family, mother herself, as well as the next generation. So that was the motivation to enter into women's health. And as I started working, I started realizing there are so much work to be done. And one example I've been giving recently is normalization of labor pain. We assume labor hai, yeah, pain to hota hi hai. Why we assume that pain to hota hi hai? So, I mean, these are some basic questions that mother goes through 6, 10, 12 hours of labor pain, and it's unbelievable to see the amount of pain she goes through. So there are so many problem statements, so many areas to work on. So that's what tempted me to really work. And interestingly, when you see that if you work on something and it is getting delivered, that satisfaction is further inspiration.
Before I go to Parag, I just want to ask you, when it was very exciting for you because you thought that was the felt need. There is a gap there and you need to plug it. You have the brains, you have the technology, you'll do it. Tell me how easily it was acceptable to the healthcare providers, because they are in that space. They need to deliver the care using the novel equipment that you have produced. Were there any barriers? Was it a challenging experience? Or everybody said, oh, this is great, let me have it and get going with the use of it. How was the response?
So, as you know, in healthcare, anything which is completely new takes a little bit time to understand, because as it's health and health of baby mainly, people are cautious that will it create any incidents which will go wrong and will create challenge for doctor and mother both. So particularly when we developed this solution for healthcare facilities, it was easily accepted. We didn't face any challenge when it was used in the facility. But our challenge started when we promoted it to be used by mother herself at home. But invention, as per the necessity, you identify how it works, and COVID hit, and either doctor was in isolation or mother was in isolation. Now, there was no option but to monitor her, and particularly considering the COVID incidents, the challenge or the distress of the fetus was well known. So, doctors did want to evaluate the fetal health remotely, and initially it started in the ward itself, where mother was performing the test in the ward and doctor was saying on the mobile phone. And then some of the corporate hospitals, and mainly what we started with you as a first study in Bangalore during COVID, you could give this device to mothers. So we needed some champions, honestly, until and unless some of the doctors believed, yeah, this is working, and actually this is turning out to be life-saving incidences, particularly during COVID. I think that situation during the COVID gave a lot of confidence to doctors that yes, remote monitoring and self-monitoring is possible. Then we did study with you, we published a paper, then we another study we did with Fernandez Hospital. So I would say we have done that India's first study on self-fetal monitoring. So it needed that evidence, it needed situation to accept, but I think that's where we need to learn from the past, how we can adopt to the new thing. So for us, now it has become a joyful experience for mother who is listening to the heart sound at home, she's performing the test, she's getting an assurance at any time of the night that she's able to perform the test and see, oh, okay, my baby is good. Particularly among high-risk mothers, particularly among mothers who have conceived with IVF. I think technology assists, but same time it is giving them assurance and joy, which is, I think, super helpful, and particularly when doctors believe in it, for patients it's a super confidence.
Right, because this is the present era where the joys of motherhood is now anxieties of mother and the family. That is how, you know, the whole spectrum has changed, because there is an overwhelming Dr. Google knowledge, and they think everything is happening to them which may not be right, and they need a repeated reassurance. So what exactly Shantanu brought about was a small simple device. It's less than the size of a cricket ball. It's called the Baby Beat. Okay? This is wireless and anybody can use it with ease. Right across all the socio-economic educational standards, we have found that patients are more delighted to use it, and the tech-savvy culture within the country is really great, because they just adapt it very, very quickly once they know that they need it. So what we do at our hospital is to use this Baby Beat to rent it out to the high-risk patient in the last 4 to 6 weeks of their pregnancy, where we would have otherwise needed them to come twice a week to the hospital. You know, with the constraints of the persons accompanying them, the time, the cost, the traffic, etc., and the tension of twice a week they're coming, but what if something goes wrong in between? You know, so that is also another anxiety provoking. So if they have this machine, we tell them at regular frequencies, you keep it on your tummy, send us the tracing by Bluetooth, we just give her a thumbs up saying all is well, then the issue is sorted. Sometimes in the middle of the night she wakes up with anxiety thinking her baby is not moving very well. She uses it again, as simple as that, sends the strip back to us and she gets her reassurance. So it is point of care, self-use by the patient, and really needed for repeated monitoring as per clinical protocols, avoiding all the constraints of the hassles of travel. Not only this, it can be used by the patients, means it can be used by any semi-skilled provider. Okay? Which means that in small towns, in small districts, in smaller hospitals, in primary healthcare centers, where they need not have big machines to do this test, it is a no-brainer with the Baby Beat. So this is one of the first few very value-added innovations that we have implemented in practice, and it's only waiting to be scaled up right across the country, not only in the private sector but also in the public sector, because it's such a small, easy to use device by anybody that is the need. It is the baby's heartbeat which we routinely monitor. It is not a hi-fi kind of a test, it's not an unnecessary add-on, it is a part of the routine protocol, but it is made easy by devices like these. So that is, congratulations to you for bringing that to our doorstep to help many, many mothers in the country.
Thank you, ma'am, and thank you for championing it, because such changes are not easy to bring in the medical fraternity. So thanks for that. And as you mentioned, we are one of the 3 companies in the world who have done it scientifically, systematically. So the future is bright for home care because of such use cases, and particularly with fetal and liver monitoring. So thank you.
Thank you. So we shift to the other distinguished guest here, Dr. Parag Bhamre, who is from an organization called JPIGO, which is the public health unit of Johns Hopkins, which itself has a unit for innovations. They do a lot of work with, and the philosophy is, let's try this. At the most, it may fail. It's okay. We move on to something else that may work. So with that kind of a mindset, many, many innovations have emerged from that sector as well. And task shifting. I always say that God made mothers because he cannot be everywhere. Similarly, 30 million deliveries in the country, 40,000 gynecologists, and we can't be everywhere. So the task needs to be shifted for sure. And this task shifting is enabled by technology, and the team led by Parag and the organization JPIGO has really reached the last mile with many innovations validated in the public sector as well. How we need to make course corrections, how we need to change the way we look at things. There are some examples that I would wish that Parag would share with us with the experience that he has had with the use of technology for women's health. Parag.
Sure, ma'am. Thank you so much. Good afternoon, everyone. It's an honor and privilege to be with Dr. Hema ma'am and also with Shantanu. I have had previous, opportunities to work with both of them, and it's again an honor to be at the IHW's this forum. So, like Dr. Hema mentioned, I am representing JPIGO. It's a Johns Hopkins University organization. We work with different state governments and central government, and also with professional associations like FOXI and IAP and Family Practitioners Association of India. Our intention and our work, if Shantanu and team and other similar innovators are working on product, our job, I believe, is the process innovation. What we really try and attempt and do is to, get those products, put it in the process, see whether they are fitting in the process, whether our users or potential users are finding it meaningful, useful, whether all of those additional products are adding value to the overall health system, and then recommend and promote and advocate for wider adoption and scale of those products. So if product innovation is important, I believe process innovation is equally important. And we try our best to catalyze those, product integrations or those process innovations all across the geography. I was hearing the earlier panels, and there were quite a few panelists who mentioned about how do we take such innovative technologies down to the field, right to the front ends. And like Madam also said, I'd like to share a couple of examples. But before I go to the exact actual innovation related examples, I'd like to just narrate a story of any woman in a rural health setup, So what happens when a woman gets pregnant in any rural setup, and what is the exact problem that these technologies can solve is something that I like to take your attention to. Because unless we understand the problem, we will not be able to put or suggest right solution. So whenever a couple gets married in a rural village, the woman is considered as an eligible couple, or the couple is considered as an eligible to have a baby, right? And I'm focusing on maternal child health because we know that maternity is something that is going to happen in every household. So whenever that eligible couple happens, and if woman misses her period, she visits the nearest health center. And for 70% of women in our country, it is Village Health and Nutrition Day, which is organized by an auxiliary nurse midwife assigned for that particular village. Now it is up to the competency and commodity availability with that A&M, auxiliary nurse midwife, which is, probably is 50 years, 55 years or 40 years or maybe as young as 22 years, there are range of it. So we don't know which this woman will really get guidance from. Now this woman assesses her history, examination, decides and conducts some investigation as per the available commodities that are there with that auxiliary nurse midwife. Again, you think about the range, 22 years to 55 years, and northwest, north, south, east, west of the country. Now, if that A&M assesses and finds that woman at high risk, the first choice she has, send her to the nearest health center or a hospital for further investigations. Unfortunately, not many women are capable to even undergo ultrasound. You know, I know there are big hospitals and corporate chains who are here as the organizers, but I want to mention for 70% of our women, even one ultrasound is a rare thing. But if she is lucky enough, she visits that ultrasound center, gets her things assessed, and if she finds some problem, she will have to again go back to that facility to undergo regular monitoring and further, guidance and whatever investigations or treatment that the doctor suggests. In most of the cases, or 50% of such mothers, during their journey of 9 months, go to their mother's house. Now her entire management team has changed. जिसको कहते हैं पियर जाना या जिसको कहते हैं मायके जाना, है ना, एटलीस्ट प्राइमरी मदर्स तो हमेशा जाएंगे क्योंकि उनके पहली डिलीवरी हमेशा घर की तरफ होती है. Now whatever the first monitoring that first set of health worker did is not available to the subsequent set of health workers, because it is always a jhola or a thela that woman carries. Now when the delivery comes, she is sent to a nearest primary health center. Again, all the medical records are probably not available to the primary health center. The doctor at the primary health center doesn't know whether she had a high-risk condition during initial investigations. Then unfortunately what happens, and I'm telling about the extreme cases because as a healthcare providers, we have to be ready for extreme cases. The doctor sends her to nearest, let's say maybe a private doctor because the medical college or a district hospital is 70 kilometers, 80 kilometers, 100 kilometers away, and then probably the entire batting of the patient happens. And in most and unfortunately in quite a few cases, these complicated deliveries finally land in either a biggest private setup or a medical college or a district hospital. Now you may imagine, and I'm just creating a scenario in front of you, and if you believe that this is just an imaginary scenario, then I'm going to tell you that latest National Family Health Survey or latest SRS can give you accurate numbers for each of these fragments in the care pathway that woman faces. It is still a stark reality that this is happening in, if not all 28, but at least 10 of our 28 states. And Madam can add, Shantanu can add, because they work across the country. The situation is not, needs a lot of assistance. Now we call all of this as a fragmented care pathway. And like Madam said, अगर हमें घूंघट के साथ साथ मोबाइल अगर महिला के हाथ में दिख रहा है ना, that is a very good sign that leapfrogging is possible. We don't have to always solve basic problems, and I believe tech solutions can solve that. If you ensure that the end-to-end tracking of maternity event is happening, at least the doctor at primary healthcare center will get to know कि पहली बार जब investigation हुए थे, पहली बार जब hemoglobin लिया गया था, तब उसको anemia था या उसको क्या था, या उसको sickle cell था. Even sickle cell and all these things are very common in rural tribal pockets, right? Which complicates the care. So the point that I invested some time on it because I really believe that process innovations के लिए basic problem समझना बहुत ज़रूरी है. The fragmented care continuum is a bigger problem in our country. If we can streamline the entire continuum, then the wonders happen. And now I'll talk just 2 solutions, ma'am, and maybe then we'll be happy to answer further questions from your end. Now, banking on this fragmented care or to solve this fragmented care, we basically attempted 2 innovations. First, जो पहली बार कोई महिला A&M के पास पहुंचती है और जब उसकी basic investigation होती है, can we ensure that all the commodities are available with the auxiliary nurse midwife? So we discussed with eminent specialists and found out that there are 22 to 25 diagnostics or items. If we put those items in a bag and give that back to the nurse midwife, everywhere, wherever she is going, in every village, she will at least carry that bag and ensure that right commodities are available. So the innovation that we tried was ensuring availability of commodities to those nurses for necessary during their antenatal care visits or days. Now, one more beauty that was added to it was some of the critical vital measurement devices were made Bluetooth enabled. Now, simple Bluetooth enabled really helped us, because अगर आज भी आप में से जो लोग nurses या बहुत सारे अलग-अलग hospital records को देखते होंगे, most of the time the BP record that you see is 120/80, 120/80 or 130/90 or 120/80. If you see birth weight of a baby, it could be 2.5, 3 and 3.5. If you see weight of the mother, it could be 45, 50, 55. There is a natural human tendency to report data around normal values. I'm not questioning integrity of any of our health workers, but there is a natural human tendency. जैसे आज भी अगर मैं किसी का BP अगर चेक करता हूँ और 122/78 देखता हूँ, my natural tendency is to make it 120/80. Natural tendency. This aggravates the problem in rural setups, and then you are not really identifying right high risk. You are not identifying right, candidate who needs more attention. And I'm saying this out of example because we deployed such Bluetooth-enabled devices. And when I say devices, very simple ones: blood pressure, weighing machine, baby weighing machine, glucometer, and hemoglobinometer. The results are amazing. The results are so amazing that it is not only reducing the reporting around normal values, it is increasing the detection of high-risk pregnancy. I'll just give you one example. By addition of Bluetooth-enabled BP machine, the reported numbers around high-risk mothers because of increased diastolic pressure in government data increased from 1% to 3%. Now I'm only talking about diastolic blood pressure because we know systolic has different reasons to increase. The hemoglobin for severe anemia, the reporting increased from 3% to 7% just because of addition of a Bluetooth device, Bluetooth connectivity. And now I am again coming back to what Madam mentioned, right? This is about basic vital parameters. If I add devices like you just spoke, probably we will be able to capture high-risk mothers or women at risk pretty early and provide necessary care. Now, if the quality of the data gets better, we all know, and I think previous panelists spoke about it, if data is good, there are huge opportunities to use that data for better action, and that action could also have one of the modalities could be artificial intelligence. And right now we are trying to work with government of Madhya Pradesh, government of Maharashtra, and few other state governments which are proactive to use this accurate data for decision making using power of machine learning or artificial intelligence. Just one point on this and then I'll stop. If data is not right, the algorithm will not be right. You know, there is a famous saying called as GIGO, right? Garbage in, garbage out. So I believe that Bluetooth enabled devices or right devices at the frontliners could ensure that there is no garbage when we think about artificial intelligence, right? So I'll pause there, ma'am, but I hope I could answer a couple of points.
I just want you to specifically tell about the hemoglobinometer you said. These are all called point of care. That means wherever you go, there you prick and immediately the report is available. In the Esther years, how was it being done? Because now you're saying the severity of anemia, this is just for, enlightening the audience. So just see here, it's a subjective thing. Somebody says, utna theek lag raha hai. Somebody will say, nahi, this is like moderately anemic. Somebody will say, no, you are missing a severe anemia. It's very subjective. Compared to just do a finger prick, then and there you get the reports and then you report it so that the further action can be taken appropriately. These point of care devices, as we call, even, just about 20 years ago, before the government accepted this point of care devices, brought it to every, nook and corner of the country, we used to say, nahi, hemoglobin aapko karwana hai. Now the lab is like, even in a big private setting within the city, big medical college hospital, the checkup is done here, the lab is 1 mile away, she goes, she gives a sample, by the time the report comes back, the outpatient is shut and there's nobody to see that report and act upon it. These are like ground realities. So the point of care devices, every single minute new devices are emerging. So what is your take on the advantages or the flip side of these point of care?
Yeah, so ma'am, if I just talk about hemoglobinometer, we all know that earlier it was colorimetry, right? Jo, like pehle to clinical tha, then it came the colorimetry that you put a blot of blood on a paper strip and then compare with the adjacent colors that are already given. And it was, again dependent on the site, the light and, all those environmental factors. The later on came, which we all used in our medical colleges, ma'am, was the Sahali's hemoglobinometer, in which again there is lot of there is again, it's a colorimetry, but it's again comparison with some sort of a standard that is already there. Today, we are fortunate to have these devices. There is still standardization that is, happening with respect to these devices, but the currently available ones are point of care. When we introduced it in few of our states, obviously there was a resistance. Like at many places, nurses were not at all confident, maybe competent, and also started questioning the technology. Like Shantanu said, like whenever new tech comes, there are always, doubts in mind. And they start thinking, the earlier one was better, this is showing something else. They start using the earlier one as a standard and control for the performance of the latest one. All of those things, ma'am, we also faced. In fact, when we even given these bags, the utilization of bags was around 45-50% in early months. There were complaints, there were, we had to, solve those problems right on the field. Today, the adoption and the usage is around 88 to 92%. So it is reasonably well accepted. Nowadays, there are again solutions which says non-invasive globinometer. You don't even have to have a prick. You can even get it directly without invasion. So, yeah.
Yeah, so slowly and steadily we are getting better and better. Even we've done the rural and urban connect. So there are many of our community volunteers who are called the Swasthya Sakhis, who don't need to have much knowledge, but they just need to have the know-how of how to use the digitally enabled devices. Okay? So they will go at block level, home to home to home, and anybody, any girl, any women, they will be able to do the hemoglobin testing. If the non-invasive comes, how they were going in COVID times doing the pulse oximeter home to home. So it's the same way that you just have to clip and they get the hemoglobin levels, because even the young girls are anemic, because once they start menstruating, heavy menstrual bleeding and anemia go hand in hand, and both the problems need to be plugged. We need to prepare her for the next phase of her life, and then the vicious cycle goes on if we don't break this. So in the government of Karnataka, we have established a Rural Urban Connect, where they go and they get this data. There is a simple algorithm decision making tree. If they ask one question and they enter this value, they know what question to ask next. It just flows automatically, so it's easy to train them on that. And once there is a red alert, they will immediately send to the nearby hospital. If it's an amber, it's a traffic signal type. If it's an amber, then they will video connect with us. If it's green, they will assure the patient that everything is okay, they'll go home. So these are some simple, doable, feasible, pragmatic things that we've already, experimented with. And the 5-point program for every woman after 30 years is check her blood pressure, check her the sugars, check her hemoglobin, check her breast for breast cancer, and the self-testing for cervical cancer. With these 5 points, a lot can be achieved. This will really change not only the ecosystem, but the phase of the wellness category, preventive care and wellness. This is a big step, which is again tech-enabled, data capture, see the trends, analyze them, and invest in the right pocket. Now that my last round, this is what has already happened, and as I said, we've already in the future better than many other countries, because even video consultations, which our patients do, many of my patients from UK, Mexico, USA, anywhere, they said, doctor, luxury is not available in our country. So they connect with us, in fact, to get the clarity on many of their medical situations, and definitely people within our own country, in their own languages. There are many options available to them, which we are very proud of. Now, Shantanu, you mentioned about pregnancy, but there's equally the other side of the coin, the infertility group, who are highly traumatized in their mind, because it is a social stigma, so to say. Your mind, I know, is working on some solutions for that, so get the secret out.
So we all know that we are a very different country when it comes to pregnancy, right? It's not necessarily a choice for a mother or for a woman, and it is expected that she needs to have baby. Now, with all that trauma from family, from physical issues, those are happening in the body, what we also call hormonal balance or hormonal issues, when they are particularly going through treatment. One of our thought was that particularly when they are going through this IVF treatment or seeking or planning to seek IVF care, how do we help them understand the baseline? Because practically speaking, it is difficult for hospital or IVF centers to explain them that you may or may not be able to conceive. That's a very difficult position to talk about. Second, if they are going through a treatment or planning for a treatment, how do you understand the emotional stress they are going through. Now, it's the vicious cycle because your hormone or hormonal treatment is affecting your mood or sleep cycle or overall emotional response, and because of that, again, hormonal reflections are changing. So it's a vicious cycle. How do we understand it effectively? And how do we understand it for every individual? Because typically what is done, yoga kar lo, sleep well, eat well, अच्छे से nutrition करो, are the common things those have been told to every women. But that's not how it works. Every individual, their bearing capacity for the pain or the social or the family or financial issues, they are affected differently. So we did one simple thing, we related it to the hormonal aspects, and what we realized that if we understand their heart rate variability, if we understand their sleep score, we will be able to link it with the stress and design a care program for women who are going through IVF treatment or even planning for conception and having difficulty in conception. So with this simple wearable or a smartwatch, we were able to understand their daily emotional status, and that helped us to define a more curated and personalized program. And depending upon their stress scores, which is like objective method to say that, okay, this individual is having problem or the trend is not good, you will be able to give them a care or a counseling when needed. We will not wait for a counseling when we visit the hospital. We will not wait for a counseling for that mother when, psychologists detect it. So it is like a preventive method that will improve the experience for that woman when she is going through a difficult time of treatment as well as challenge of conceiving. So it's a tech plus counseling approach which is helping them to improve the experience during the difficult journey.
Yeah, so this is in the pipeline.
Yeah, we have already done an observational study around it, and it's quite established in a way because there are pieces of technology which are already evaluated on stress and technology. Counseling is also known. It's now combined and the program in a way is ready.
Yeah. So much talked about the emotional upheavals and stress. Parag and his team are working on perinatal mental well-being. Perinatal meaning the mothers-to-be and the new mothers. That is the phase where there's a lot happening there. So there's a tie-up with Jepaigo and NIMHANS, which is the Neuro Institute in Bangalore, and also our professional organization. And they're actually physically going and capacity building of the doctors and the frontline healthcare providers who have no clue as to what is happening, because this is not like their subject as such. So do you think that the anonymous space, like a Dost, Dost type, which was also an app where anybody can ring up for their counseling, and this is also a huge step which is tech enabled. So what has been your experience in the landscape of this problem in our country? Because less is spoken about that, and there's a huge category of still wanting a male offspring, and they're so anxious in their pregnancy, ki abhi kya hoga? And then once they get the female child, again there is a whole lot of depression and everything else that comes. It is again a reality. Less said, the better. Even with any kind of laws coming in, there is, again, it's a vicious circle indeed. So what is the landscaping? What is your experience in building the capacity? How do the healthcare providers perceive it? Do they take it seriously that they need to learn? They need to be sensitive? They need to just resolve this problem, or it's okay? And can you build this capacity, the skill transfer that we are doing in many other aspects through the tech, so that it can scale quickly? Okay, it can many, because we need numbers here of counselors, but there are far few between. And finally, the girl or the woman herself can place a call to somebody who is certified, who is experienced, can counsel, because she's built the capacity through the organizations that now we are speaking about, and directly the comfort or the first line therapy reaches the girl or the women who makes the call. So around this space of mental wellness and well-being, we have the last 5 minutes left. Yes.
Yes, ma'am. I'll be brief. So First of all, many of us, when we started our public health programming, there were only direct causes of maternal mortality and indirect causes of maternal mortality, right? Very less attention to morbidities which are actually determining adherence to care, which results into eventual mortality. When we got into learning about this space, ma'am, one very startling finding came up, and there are publications on this, that 1 out of 5 mothers in India, if I say only of India, 1 out of 5 mothers face some or the other form of, mental health issue, which we called as perinatal mental health issue. Now again, why mothers? Because naturally, if you see and if you remember the hormonal cycle that woman goes through, right after the birth, most of the hormones that are at peak just before birth just dramatically drop down. And we all know the, impact of hormone in our bodies, right? If I just ask, sir, you to get up, what will happen, you believe, in his body? If I ask someone, sir, please, can you please get up? Sir, will you please get up? Now, if I ask the other sir to just check his pulse, what will happen? It will increase a bit, right? At least your heart rate, variability aap keh rahe the. We can actually see that. Why it happens? Because of the hormone, right? And same is happening in that woman's body also. Because she is, and that's what, ma'am, we realized when we went on through the literature also, that such variations in few women, and not few, in fact 1 out of 5 is so high that they really feel the perinatal mental health issues. We have started some work with NIMHANS and Professional Association in Madhya Pradesh, specifically in Jabalpur district, because it is a district with rural, tribal, urban mix. And what we realized, and we probably, now we have completed for more than 1,000 patients, the positivity with mental health issue is 6% amongst the women of those rural, tribal plus urban district in whatever patients we have screened so far. Again, screening tools are, not so evolved, not so well developed, and the competencies and confidence of our health worker is also not at par, but still the positivity is 6%. Now, if I compare this 6% positivity to any other medical disorder, it is almost equivalent to gestational diabetes mellitus, for which we have tests, for which we have some modalities or sub-objective scoring. So Shantanu and team, we're really looking forward to have some objective assessment modalities, some tech-enabled modalities to really identify if woman is facing such issues. Because not everyone is going to speak, not everyone is going to come up, and not every health worker will be able to elicit response on this. To the other point, ma'am, on whether there are any tele services available to it, so I'll really like to mention this. Government of India has taken very, very progressive steps on this. And there is a Telemanas helpline. Anyone sitting in this room or sitting in any rural part of the country can literally call that number and share and vent out, or even consult the specialist or the service provider. May not be a specialist, but a service provider who is at least aware about mental health issues on the other side. And this Telemanas is something, ma'am, that we are supporting different governments right now to make it better, to make it more integrated, to make it more user-friendly. And I believe that is also could be a way forward, because not everyone can afford specialist services, and system probably will not be able to provide specialist services to each one who is suffering from mental health. But such tele solutions is something that is probably the way forward, and a lot more needs to be done in this space though. Yeah.
Okay, one last wrap up to both of you who are from Generation Next, that the next generation is too much into tech. All the time everybody is sitting next to each other but looking at their own mobiles, not talking to each other, not really, And even with the doctors, they say touch and feel is important. Doctors are not talking. Everything is happening through the machines. Machine, human, and some of our congresses hybrid. We, of course, believe in a mix of both. So where do you think the future is taking us, and what is the pros and cons of tech-enabled Femtech?
So my mother uses more WhatsApp and Facebook than me. So the generation shift because of tech, what I saw over the last 5 years is amazing, because they understood how to use the tools which they were not using. For our generation, or even the more younger generation, I think it's a trap also. We are using it in a very different way. A lot of time people are just scrolling. possibly not knowing what to do next, hence spending time on that. But speaking from the health future aspect, from the tech, because I come from tech and health both background, I see it as super exciting times. One, for a reason that science or things which we were not seeing or was limited to few experts, tech is helping to democratize it. To just give you an example, in labor monitoring, we saw the value that it can bring, because one doctor who's specialist could only understand, but the nurses or the junior doctors would have missed. So I would put that as one word. What tech in future is more democratizing and taking that knowledge which was limited and making sure that even at the last mile we have the same knowledge base to monitor, observe or treat a patient.
I agree, because this is all about quality, and quality can be enabled through the tech in a seamless manner, and equity, because it can reach everybody. As how it is said, there are no different mobile towers or a mobile internet connectivity for the rich and the poor. Everybody uses the same thing. In a similar manner, the television channels, they're the same for the rich and poor. But for the health, the difference between each other, access, affordability, awareness, this, that, and so many complex factors come in the way, and the care is not equitable and not quality driven. We want to somehow get our head around this tech-enabled quality healthcare, reaching every girl, every woman, every time. And then the generation next, in our hospital also we used to have a little corner where all toys for the children and the fish tank and all, because when the mother comes pregnant the second time, the little one is making too much noise. They need to be engaged with something. Now all that is gone. Nobody wants to go there. The first child has a mobile in the hand, doing something. They're happy with themselves with that mobile, and it's a whole different world. Even if they are about 1.5, 2 years old, and can just hold the mobile and they're on it. We are seeing the change. It's such a stark difference. So where will the future take us, Parag? Where will you take us?
No, ma'am, I really believe if we think of health and tech, or Femtech for that matter, I believe if we weigh benefits and loss at this point in time, I believe benefits are more, at least in terms of access, quality and continuum. Because I think the next thing that we all should be focusing on is continuum. If access is there, quality is, but how do we ensure that all of this is linked? More so when we are thinking of women's health, because it is a life cycle. So I believe tech actually will help us to do it better.
That's true. So I think, not everything is good about everything. In all matters in life. So also in the tech-enabled thing, we really need to, at the core of our heart, keep the humanity and the affectionate relationship between each other. But there is so much more that we never thought we could ever reach. We are reaching the unreached by the tech. So with this, we wrap up this brilliant panel, promising you that it is the rise of Femtech. There is more to come. And if Anushka could let me know if the
yes, ma'am,
event of the book cover release, in fact, because we have a long way to go, and it's been a very, very exciting experience for me to interview some of the global leaders in Femtech to understand their journeys and the real women who have benefited from the Femtech usage, which have changed their entire life course in their own future. So with that vision, we want to present to the world the rise of Femtech, which will be featuring many, many distinguished world leaders and leaders from our own country, which we will proudly showcase with the scripts in the book which is forthcoming. So, Anushka?
Certainly, ma'am. We will be launching the book later in the day, and the cover of the book actually, which is being presented by Dr. Hema Divakar, The Rise of the Femtech. So here is the cover on the screen, ladies and gentlemen. Let's put our hands together for that. We have the cover on the screen, ma'am.
Yeah, but you know, I've just told Anushka that we can't wait anymore. We want to launch because the best people are here because the moment I saw Sujaya Krishnan, I said, oh, she's here, she has to launch my book. So before...
So ladies and gentlemen, I would now like to invite on stage for the cover launch of the book, Ms. Sujaya Krishnan. She is the former Joint Secretary, Ministry of Health and Family Welfare. Also requesting Mr. Kamal Narayan, CEO IHW Council, to come up on the stage for the release, the launch of the cover of the book, The Rise of Femtech.
Kamal, Nikki and Divakar, please, with the book cover. Divakar, get that book cover. It's there? Ah, okay. So, you know, usually they'll wrap up and then tear it. And so we said, no, it is open and transparent. It's right here, waiting to be released very, very soon with some more anecdotes being captured.
A huge round of applause, ladies and gentlemen, for the launch of the book cover, The Rise of Femtech, which is being authored by Dr. Hema Divakar. Congratulations to you, ma'am.
And Anushka, come along. What Anushka whispered in my ears was, during the award ceremony we'll release, madam, there'll be a lot more people. You know, the most important people who matter to me are here on the stage. So that, and all of you who have been the early birds, so to say, for the evening event. So we really, really appreciate that you bless us with the best of things to reach the girls, women of this great country, because we believe that women's health is nation's wealth. Thank you very, very much.
Thank you very much indeed, ma'am. And before we close the proceedings, once again requesting Mr. Kamal Narayan to do the honors of presenting a token of gratitude and appreciation, first to our distinguished moderator, Dr. Hema Divakar. Thank you very much indeed, ma'am, for wonderfully taking us through that fireside chat. Thank you once again, ma'am. We now present a token of appreciation and gratitude to Mr. Shantanu Pathak. Thank you very much indeed for all those valuable inputs, sir. And now presenting to Dr. Parag Bhamare. Thank you very much indeed, Mr. Kamal Narayan, and requesting for another group photograph of this panel. Thank you. Ladies and gentlemen, we request everyone to kindly remain seated as we straight away move on to the next panel discussion session, which is on smart oncology care with precision medicine and innovative diagnostics. Requesting everyone to kindly remain seated. Just give us a few minutes while we arrange the top table for the next session. So this is one of our concluding panel discussion sessions of this summit, the IHW Smart Hospitals and Diagnostics Summit. And to follow the awards presentation ceremony, which all of us are very excitedly looking forward to. And now, ladies and gentlemen, to go ahead with the proceedings of this session, I have the privilege in inviting on stage our distinguished moderator for the session, Dr. Indu Bansal Agarwal, who is Group Director and HOD Education Oncology, Paras Hospital. Ladies and gentlemen, let's put our hands together to welcome her. Warm welcome, ma'am. Also have the privilege of inviting eminent panelists onto the stage. I have the privilege in inviting Commander Navneet Bali, CEO Clear Medi Healthcare. A very warm welcome to you, sir. Inviting Dr. Manoj Mittal, Chairman, ICHMT, International Chamber of Healthcare and Medical Tourism, Foundation, Vedant Care Healthcare LLP. A very warm welcome to you, sir. And also inviting Ms. Pooja Chatruth. She's CIO Information Technology, OnQuest Laboratories Limited. A very warm welcome to you, ma'am. So ladies and gentlemen, we now move ahead with the proceedings of this panel discussion session, which is a session that focuses on one of the most critical and transformative areas in healthcare, the smart oncology care with precision medicine and innovative diagnosis. The panel will explore the cutting-edge intersection of personalized medicine and advanced diagnostic tools in the field of oncology. And may I now invite, or in fact introduce our distinguished panelist on the stage, Commander Navneet Bali. Before transiting to the healthcare sector, he served in the Indian Navy, and his leadership and strategic skills have been instrumental in his roles at Narayana Health, serving him the significant recognition. A very warm welcome to you, sir. And Dr. Manoj Mittal, Chairman ICHMT, is International Chamber of Healthcare and Medical Tourism, Foundation Vedant Care Healthcare LLP, whose contributions to healthcare innovation are shaping the future of medical tourism and oncology treatment. And Ms. Pooja Chatruth, CIO Information Technology, OnQuest Laboratory Limited, is a key leader in leveraging advanced diagnostics to improve the cancer detective and care. And ladies and gentlemen, to moderate this enlightening discussion, we are honored to have with us Dr. Indu Bansal Agarwal, the Group Director and HOD Radiation Oncology, Paras Hospital, whose extensive experience in oncology care and precision treatment and will guide us through this conversation. So may I hand over to you, ma'am, to kindly carry us forward the discussions of this session. Over to you.
Check.
Greetings everyone, and I'm Dr. Indu Bansal, practicing radiation oncology for last 28 years, and I represent Paras Health here, which started in 2006 and now has expanded to 2,035 beds, and by 2027 it is expected to grow their bed strength to 2,900 beds closely. Presently they have 8 hospitals, out of which 5 are offering oncology services, and we have 3 more centers in pipeline, including 1 center which will come up in Gurgaon itself, a 300-bedded setup in another 2 to 3 years. So good evening everyone. At the outset, let me express my gratitude to IHW Council for having me here to moderate this session on smart oncology and precision care and innovative diagnostics. Now that we all know that as per the recent WHO Cancer Agency data, around 35 million new cancer cases are expected to happen in 2050, which is going to be a 70% increase from the estimated 20 million cases in 2022. So that is why it is definitely very, very important for us to understand about oncology and talk about it. So now that medicine is meeting machines, and the technology is being leveraged to increase healthcare accessibility, scalability, and cost effectiveness, I feel really privileged to have a very august panel, and we will be talking about smart oncology, role of precision medicines, how is medtech helping precision oncology, and we will touch about medical tourism as well. So with these words, let's hear to the august panel. First of all, I would speak with Commander Bali sir, and I had the privilege to learn a lot from him when I was in Narayana Health. So it's really a great pleasure for me to share the stage with him. So I have seen that with the motto, everyone, everywhere, I mean, I think this is equally, everyone, everywhere, equally, the Clear Medi, that has been the logo. And I have seen a tremendous growth of Clear Medi, specifically in Tier 2 and Tier 3 cities in recent years, and specifically after you joined, there has been a great leap in the growth of Clear Medi. So I would first like you to speak a bit about that, and then I would proceed further.
Thank you very much, and it's an honor to be here. And as much the weather is gloomy outside, topic about cancer also is nothing very cheerful, but I think we'll make it a little bit more interesting in the sense that to have a discussion on this very, very critical topic. About Clear Medi, I think just to tell you shortly, the first linear accelerator in Haryana in Hisar many, many years back was put by Clear Medi when there was not a single linear accelerator in that state, and then the journey began, and we today are present in most of the smaller cities. As we speak, we treat around 800 patients to 1,000 patients on couch every day on linear accelerators. And as Dr. Indu rightly said, this is a disease which is now on epidemic proportions. I mean, a lot has happened, but I think we are really, really a long way to go before we have a handle on the situation right now. As preventive oncology moves further, people have access to cancer care through Ayushman Bharat. I'm talking about people staying in these smaller villages and towns. You will see more and more people coming for treatment where earlier they would just die in their homes in villages and towns. So that's the transformation that we are seeing. And yes, everyone, everywhere equally, because we think that we need to move out of metro cities, bigger cities like Delhi, Calcutta, Chennai, Bangalore, etc., and go and see what is happening in the smaller towns and villages, and how can we do something about people there. And that's why this whole journey.
Sir, I would like, that was really insightful, but I would like to know that I've seen a lot of focus of Clear Medi on oncology services. So is there any specific reason for that? Why not cardiology? Or, I mean, I think the most work is being happening in oncology. A lot of linear accelerators being put in, and a lot of MRIs and medical, I mean, technology is being leveraged a lot in your setups. So why did you focus mainly on oncology and not anything else?
You know, even before I joined Narayana Health, I was in a company called International Oncology. I was a group CEO there, and now with Clear Medi. We realized that if we really, really want to do something transformative in Indian healthcare going forward, cardiology and orthopedics have had their years long back, and you know, this was the time to focus on oncology, because as you rightly said, this is where the entire trouble is. And although there have been huge amount of technological advancements in oncology, but as I said earlier also, we are little far away to really, really put a handle on the situation. So going from almost one linear accelerator and now having almost 10 across the country, we have just commissioned 4 more centers, and every one of them is going to be, you know, focusing on oncology. In fact, you know, the cutting edge technologies, treatment plans like CAR T-cell therapy, which are right now available at exorbitant costs across the country. We are trying to see something that the costs are brought down almost less than 1/4 of the costs there are. So oncology interest stems from the basic fact that if this motto that we coined, everyone, everywhere equally, and we had to really stand by it and just not keep it as a logo for newspapers and advertisements, then we needed to do something in oncology. And also not only just in you know, cities where the average revenue per occupied bed was very high, but we needed to move into Tier 2, Tier 3 cities. So we are coming up with centers in Bhiwani, we are coming up with centers in Gwalior, we are coming up with centers with the small towns and cities where we think actually people really require. And just for information, we have a small cancer center in a place called Goraj. This is about 1 hour from Baroda. And we have 3 linear accelerators. We treat about 300 patients on couch, which is almost the limit of these 3 machines. We have the only cancer center in Nanded, which treats almost 150 patients on couch every day. Again, a limit for the machine. Our center in Hisar treats 100 patients on couch, a limit for the machine. So you can imagine the number of patients which are there in these smaller towns and cities, and all machines are operating almost at our limit. And that's why when you ask the focus on oncology, I think in healthcare, if we want to do something, we need to move to oncology. We need to move to these smaller towns and cities. Thank you.
I think that's a very valuable point put across. So I was reading, and that this is that currently the bed strength in India is 1.3 beds per 1,000 population. But actually what is needed is three beds per 1,000 population. And so there is a gap of 2.4 beds per 1,000 population. So I think that's why Paras Group or Clear Medi Group or any other hospital which are expanding their beds, specifically in Tier 2 and Tier 3 cities, they are bringing a lot of change in healthcare. And we have been talking about medtech since morning, and they were really very good insights. So I also want to know that now that you are coming up with new setups in all these places, do you think that medtech is going to be a major player in your centers? Or like we know that AI programs a computer to act, learn, relearn, unlearn, and a large amount of data. So will you be incorporating any augmented reality or maybe immersive learning, digital tutors, machine learning, or any of those tools in your setups?
To democratize healthcare, it's very important that you take these technologies to people in towns and villages. Otherwise, there's no point talking about it sitting in NCR. And fortunately, technology has to be incorporated. But you can understand, in a small village where you have 100 patients on couch who just want to get treated on a linear accelerator, and and the doctors and the technicians are stretched beyond limits, it's very, very difficult at that time to think about cutting-edge technology. But of course, it has to be incorporated. So, our hospital in Goraj, I'm talking about Kailash again, we took a trip down to a very, very important center in US to learn about how to bring down the cost of CAR T-cell therapy. And you'll be astounded to hear that this is a small center which I think 90% of people sitting in the room do not know about, and where the CAR T-cell therapy, which is one of the most advanced treatment plans for, especially about for your hemat, some of the cases where the curative rate is almost 80% for 1 year, and then the relapse happens in almost 60% of cases. The event-free survival rate is almost 7 to 8 months for the patients who are almost doomed to die. And this will happen in a small center of ours, which is the most advanced treatment plan right now. So yes, yes and no to both your questions. Yes, because we are trying our best to bring technology to even our smaller centers. No, in some parts, because I think we just are putting our head above the water and trying to treat as many patients as we can in these smaller towns and cities.
So I think that's again very relevant, and we need to provide more healthcare to underserved population. So I think there are 3 major emerging trends which I realize. One is digitization, personalization, and prevention. I think these are the 3 buzzwords. And there are 3 main health trends which are coming up. Like one is consumerization of healthcare, second is accessibility of healthcare, and third is integration of big data. So these 3 things will drive the healthcare in future. Now coming on to Mr. Manoj. So it's really a privilege for me to speak with you. So we know that the healthcare industry is growing at a very fast rate, and it's growing to be 110 trillion by 2027 with compound annual growth rate of 30.7%. And similarly, the medical tourism is also growing at a rate of 30.7, roughly around the same percentage. And nowadays in most of the metropolitan cities, specifically for oncology or for transplants, we see a good number of patients traveling to India for medical tourism. So what do you think is the reason that why so many people are now traveling to India, specifically for medical tourism? And what should anybody who is traveling to India, what should they think when they travel or decide about traveling to India? Because there are so many centers which are offering medical tourism. But then why should they come to, say, Paras Hospital, or they should go to Apollo Center or any other hospital?
Good evening, everyone.
Good evening, everyone. I'm chairman of International Chamber and Medical Tourism. So this chamber has been formulated mainly to help the healthcare fraternity and bringing more and more patients attracted towards India. Since in India we have world-class facilities and we have highly experienced and skilled doctors, and we have cutting-edge technologies, and we have shorter period waiting time. In fact, no waiting time, as compared to in international locations like US, we have about 6 to 7 months of waiting time. So this is why more and more patients are attracted towards India, and the main factor is affordability. As compared to US, 80 to 90% less cost. So oncology and some other specialization, mainly the patients are attracted towards India, and we are proud that Indian healthcare system is doing a very great job, and this is not in fact a business. This is basically helping the humanity. The cancer is something like if we go in the past, there were no treatments available. In fact, the people used to say, oh, cancer, there is no treatment, I'll be gone one day. So now we are proud to say that we have cutting edge technologies, precision medicines and diagnostics available, which can tailor the treatments based upon the genetics. And we have, as I mentioned, that we have everything in place, which is why the patients from all international locations are attracted and they come to India.
So, as per your estimate, how many patients would be traveling to India every year for medical tourism?
See, Dr. Indu, about 15 to 20,000 patients travel to India for the oncology treatment itself. In addition, we are doing telepathy, and about 6 to 7 lakh patients used to travel to India for the medical treatments for the different specialties, and this thing is actually growing. The G20 summit has actually given a boost to this medical tourism industry, whereby the government of India has helped and show-caused, invited about 570 delegates from different countries, and they visited, and we have taken them to the Indian healthcare system, showed them the different locations, what cutting-edge technologies, what the best facilities, highly experienced doctors we have, and that is why this industry is growing.
And I think you would agree with me that when the patients are traveling for medical tourism and they're traveling to all the centers, it's not just the medical industry which is growing, but it's the hospitality industry and so many other industries. They're also getting a boost. So, like I was reading somewhere that there are currently 70,000 hospitals in India, around 70,000 hospitals, and out of them, in majority of the metropolitan cities, international patients are traveling. So, Commander Bali, I would like to ask from you, how do you promote medical tourism in your setups, and do you think that this trend will continue or this trend will die down soon? Because now most of the patients in Western countries, like earlier we used to have a lot of patients from African countries, but now they're also developing their own setups. So like earlier a lot of patients would come from small cities like Kanpur, Bhiwani to Gurgaon for treatments, but now they're sticking to their own setups. Do you think this industry will grow or this industry will gradually die down?
International patients coming to India are not going to come down. In fact, this trend will continue for 2-3 reasons. One, our doctors. I think we have the finest talent in the world. Second is the cost. Our costs are exorbitantly low and you just can't compare with any of these countries. The third is that we are now focusing on also improving our infrastructure, bringing the services up to the mark, Because compared to Turkey, Thailand, and many of these places which have started looking at these patients, our hospitals still lack, many of them lack the service the qualities which the international patients want actually. But just because we have the finest doctors, just because our costs are low, it's easier to travel. Air travel is becoming more and more convenient to India. I think every one of these factors, I think they'll continue to push us towards good international destination for medical value travel. In addition, for last 4 or 5 years, we are seeing a tremendous amount of policy advocacy and push from the government side, where they feel that international patients bring to you important forex, and also there are huge amount of benefits given when you purchase equipment like linear accelerators, which cost a huge amount of money. LINAC costs around 20 to 30 crores. And you get that EPCG benefit, so when you treat more international patients, you are given some amount of rebate. So there is everything that we are doing. One is the policy, the government trying to get into it, making it easier for the international patients to travel, the air travel becoming better in India. Doctors have always been the finest. Technology is excellent. We've got everything that the world gives in India, and the costs are exorbitantly low. And this will continue for a very, very long time. And in fact, I feel as we become more and more service oriented, we give better services to patients, our hospitals become finer, and I think you will see this trend continue. In fact, what I would see is that in addition to the normal traditional way of treating patients, I think many hospitals will also go towards lifestyle changes in the patients, which amalgamate yoga, Ayurveda, along with the normal treatment, and putting them in cities which have got better air quality. I mean, Mysore is developing slowly, that international patients have started coming in. It was a long forgotten city where nothing happened. But I think all of these factors are quite favorable, and this trend is going to continue in the future.
So that's quite encouraging, and I think the initiatives like Heal in India or Fit Yoga and these programs, eSanjeevani portal, all these are definitely going to improve our healthcare even further. So we have been talking about smart oncology, precision medicine, digital health, telehealth. There are some confusing terms. So I would like to know from you, Dr. Pooja, what actually is smart oncology? What actually is meant by precision care? And could you please throw some light on what is the difference between telehealth and digital health?
Sure. Thank you, Dr. Indu, and myself, Pooja Chatrat. I am the CIO for OnQuest Laboratory, and it feels good when you're representing technology, because everybody is talking so much about technology, so it's really feeling nice that technology is helping healthcare and people have started trusting technology more. So that was my first point. Now, when we talk about smart diagnostics, or just to start with digital health versus telehealth, that was the point that came in. So the first difference I would say is telehealth is a subset of digital health. So that is we all need to understand, because digital health, it involves use of all the technologies to provide the access to the healthcare, whereas telehealth is just providing the remote or the virtual using the this technology, which is telecommunication, and like our internets, and we are providing the support. So that's the biggest difference, and that's why the scope is also, telehealth scope is, I would say, less, very less as compared to the entire digital health. So that's the thing. Now, advantages that surely we have for telehealth now are that we are able to connect to tier 2, tier 3 cities with our internet, and we are able to provide healthcare advices to the people who were not able to actually get the advice on the right time. So it's less costlier and easy to reach. But if we grow the vision, and if we just grow our rainbow, so it will come to our digital health, wherein it involves not only your telecommunication, but it involves your mobile applications, it involves your electronic health records, it involves capturing of data and analytics of that data, and then your wearable devices. So everything revolving around the technology which can be used to provide the best of healthcare advices to the patients. that would involve the digital health. And surely there are a lot of advantages while using the digital health, because it's very fast analysis as well as the personal analysis that can be shared with. As it was just mentioned, like it can help in your personalized diet plans, it can help in your personalized fitness plans also. But yes, surely there is one major disadvantage also, or we can say there is one major concern also that technology people have to take care is the data transfer and the security. Because cyber security being a major concern these days, that becomes very important. And while we take care of that, maintaining the all norms and regulations, that becomes something critical for the technology people, and that's the role wherein it comes is while designing the solution and keeping privacy and other consents in mind while designing the entire solution. So that would be my take for this.
So I think there are around 750 million smartphone users, and telemedicine is facilitating online consultations, and this is also growing. The digital health initiative is growing at a compound rate of 18%, so which is quite significant. So Commander Bali sir, like Internet of Medical Things, we just talked about wearable technology, sensors, the seamless connectivity, and like earlier, earlier the wearable technology was simple scans. They just tell you about the heart rate or something, but now it's evolving into better and better techniques like complex scans where an ECG can be done and it can predict the risk of heart failure and all those things. So I think a lot of focus is shifting towards preventive oncology. So what is your take on that? Preventive and wellness, like that is, I think these are the buzzwords these days.
Yeah. Everyone seems to be talking about preventive oncology. Everyone seems to be talking about executive health checkups. You know, I'll just throw this question to you. Let us say a test was developed which just took your blood sample right now in this hall, and the test could tell you that would you develop cancer in 5 years' time? Would you take that test? 99.9% people will say that we're not interested in taking that test because we are not interested in finding out whether I'm going to develop cancer 5 years from now. So there's a huge amount of psychological barrier. I will first address that. It's called the fear of finding out, where I do not want to know or do not want to do a test which will tell me whether I'm going to develop a disease in the future, and especially a disease like cancer. And this is, I'm not as sexist, but this is more so amongst the men than in women. You'll find many, many women coming out to do, initial breast screening for preventive oncology, but usually men do not, because psychologically men feel that, let us say something gets detected, what happens to their importance or relevance in the society. Having said that, so this is something which actually we never ever talk about, the fear of finding out. We just talk about it. But now look at the other side of the story. There has been a tremendous amount of improvement in techniques and in modalities available now in science, which can tell you whether something is going to happen in the future, whether it is 6 months down the line, 1 year or 5 years down the line. And for example, the test I was talking about, today you have a test, it's a simple blood test. They detect a protein in your blood. It's a German patented technology. It's in India right now. The test costs around 10,000 rupees or somewhere there, and which will tell you in maybe 15 minutes time what's your probability of developing a cancer according to a score in next, let's say 5, 8 or whatever, because it detects the initial protein molecules which the test detects. And similarly, there are tests now coming up. I'm sure many of us either don't know about it or we don't want to know about it, because first of all it's costlier, but then of course 10,000 rupees is nothing compared to, let us say I found out I had cancer and I could go in for treatment immediately, so I could do well. So I think this whole paradigm of preventive oncology has to be shifted, and something has to be done so that it addresses our psychological fears about getting to know whether we have something which will develop. And that can be done by tremendous amount of education sessions, telling people that truly speaking, if cancer were to be detected in stage 1 or 2, or maybe even before that, because this test actually determines a pre-cancerous stage. It is not even, that you have it in you right now. It's just determining that there are indications that some of your cells or something is happening in your body which is going to result in a cancer for some. So there's a tremendous amount of advantage in it. As we are all aware, and we talk about it, and I think all of us know, that 60 to 70% of patients who come to the onco centers come in 3rd or 4th stages. I don't know, Dr. Indu will know it better. And at that point of time, when the cancer metastasizes or it spreads to the body in other organs, it becomes extremely difficult to treat it, because surgery becomes almost impossible. Surgical oncologists will not go for surgery if the cancer is metastasized, because there is no point going in. Then you go for radiation oncology, or you go for medical oncology or chemo, etc., etc. But as we are aware, surgery is the first line of treatment. Let us say the cancer is detected very early in many of the modalities. So it is very important to spread this knowledge, this very important subject to talk about in schools, in colleges, because this can be spread only at, when this starts happening at a very young age. People like us who have crossed are in a wrong side of 50s, it's not very important for us to bring that cultural shift in our minds that we want to do it on large scale. Second important thing is about anything to do with prevention. Now, the largest prevention in healthcare or executive health checkup or health checkup plan is run in the defense forces, where every year you have an annual medical checkup. It is compulsory. Whether you like it or you don't like it, you have to go for it. And you'll be amazed to see that below the age of 40, the tests are very simple. Just your CBC, it's your urine culture, specific gravity and the normal properties. It's a blood sugar, post-prandial and fasting blood sugar. It's, maybe 1 or 2 more tests. That's all about it. Up to 40 years of age. The moment you cross 40, you have an ECG is added, you have an, USG abdomen and things like that. And it has served the armed forces which are at your borders and the fittest people, in the country very well, and they undergo it every year. So again, I come back to the policy decisions. Some of them government can help, some of them the population itself can help. That let us say we do this simple basic medical checkups every year, and many of us don't do it at all. We just don't do it because again, why should we do it? We are fit and fine. And so preventive oncology, preventive health checkups are a keystone to India's movement towards a healthier country. Because please remember, at 140 crores and moving up, treatment and going to hospital is not the solution to Indians at all. We cannot go on that path at all. We have to move towards reducing the burden of healthcare to the taxpayer or to the society in any which way. When you are taking an insurance, if you become sick, you are actually, getting treated on behest of a healthier person. When you get yourself treated in Ayushman Bharat, it's the taxpayers' money which is getting used to treat you, on Ayushman Bharat. This journey is going to take a long time, but I think time has come. And why are we sitting in this conference if we don't take a simple message home that anything to do with prevention, we'll have to move towards it, so that if India has to become a healthier country, it cannot be by buying huge linear accelerators or having massive oncology programs or going to the hospitals at all. It has to happen by becoming a healthier country. And that's why this preventive health checkups in oncology, where technologies are now available. And you talked about AI, now you have techniques where through simple X-ray or a simpler, abdomen's USG, you can detect many things which earlier were just impossible to detect. Okay, so I think that's the answer.
I think that's a very important point raised, that fear of finding out. So if we talk about oncology, nobody in the audience would believe that 70% of cancers are preventable. Yes, you heard it right. 70% of cancers are preventable and majority of them are correctable and curable. The only thing we fear is that if it comes out positive, then what? Even if it will come out positive and you are see, most of the cancers, they take around 7 to 8 years to develop. A cervical cancer, from the time of HPV infection to the time it manifests in a female, it's around 10 years. Similarly, a colon cancer. So if we are going for a simple cancer screening, then there would be too many advantages. One is it would be detected at a very early stage when it would be curable. The number of treatments that a patient would need would be lesser. The cost of treatment would be definitely be lesser, and the person would have a normal life. So I think I really want to thank you for raising this very, very important point, and I think that's very, very important. Now, it's moving ahead from the point that you just made. I want to ask Mr. Manoj, like nowadays in my clinic, earlier when I started my oncology, say around 25, 27 years back, then the majority of patients would be above 50 years of age who would have lung cancer or colon cancer or pancreatic cancer. But now I'm seeing many people between 20 to 30 years of age. Yesterday itself I saw a patient 29 years of age with pancreatic cancer, 30-year-old with a urinary bladder cancer. So a lot of shift is happening in Indian patients. And specifically the breast cancer patients that we see these days are much, much younger. I'm seeing 20-year-olds more often, which I would never see before. So do you think that same trend you are seeing in international patients as well? Are you getting patients with a lower age bracket now who are getting treated, or it's still above 50s or 60s?
There are mixed kind of patients, Dr. Indu. We have majority of the patients coming in are basically 40 and above. And the basic reason at international level is the diagnostics. There are no such tests available, or there is no public awareness. In fact, when we go international, if we talk about CIS countries or Africa, Bangladesh and all, countries where maximum people travel to India for the treatments, there are no diagnostics and there are no checkups available. And the basic knowledge about, the certain diseases is not there. And the healthcare system is not developed. That is why they are traveling to other countries for the treatment. And if at all the treatment is available there, it is very costly as compared. So, as my colleague Commander Saab has mentioned, there are tests available here, which people are not aware of, And answering to your question, yes, we have mixed kind of people. We have seen actually people traveling at the age of 28, 29 years, and they have been detected with the cancer. They were having some symptoms, but no testing has been done. And when we have done the thorough testing, we have seen that they are at a stage 3. Or they are even at the last stage. So we have, certain patients, traveled here from Iraq, which were at the last stage, and they have lose their hope. And rightly says, at that moment, we don't have actually any treatment available for them. We have actually, treated some patients with Ayurveda or some wellness centers, and there is a huge success from there. But there has to be a public awareness, the training camps, and the system has to actually adopt a policy that at a certain age, if they crosses above 40 or they are between 30 to 40, they should go for these kind of testings. Recently we have come up with certain tested like after COVID. We are actually, telling everybody, to go with some heart disease tests and all. Medanta has launched some package, but the people are actually, taking it easy actually still. So the training, the awareness is very much required, and usually the people come to the healthcare approaching the doctors at the last stage, 3rd stage or 4th stage, and you might be, coming up with those patients every day.
So I think the important point that is being discussed with my esteemed panelists is that the focus, of course, smart diagnostics and innovation, they are the way to go. But I think we have to work on the whole trajectory of cancer, right? From cancer prevention, cancer awareness, to bereavement. I mean, I think that is the whole trajectory which we have to work on. I have personally conducted around maybe 300 to 400 cancer awareness talks, right, in schools as well as in corporates, where I used to talk to students of 10th to 12th class and tell them about the hazards of tobacco consumption and alcohol consumption, because that is the time when they are starting. So and if you talk to those people, then they go back and they talk to their parents and they tell them, Papa, it's not right that you are smoking. Or mother, my mom, they'll take their mothers for mammography checkups. Or they would find out if someone is consuming too much of alcohol or things like that. So I think the preventive aspect definitely we have to look into, and precision medicine is definitely the way to go. So I heard that precision medicine is actually like a bespoke suit. It perfectly fits you. It is tailor-made to you. It means that you test the certain genes, find out, because a cancer is heterogeneous, there would be many genes which would be responsible for causing cancer in that particular patient. And no two patients of lung cancer, or for that matter, brain tumor would be same. So like specifically for certain lung cancer patients, after doing a molecular testing, we decide not to give them injectable chemotherapy, but rather we give them only oral tablets. So patients can stay on oral tablets for years and years together, and they don't have to get any needle being pricked. So that is the future of precision medicine. And sir just talked about the single test which can detect cancer. So I think a lot of studies are going on universal cancer testing. So the tests that currently are available, they just point out that a cancer may happen, but it does not tell at all what type of a cancer. Is it a colon cancer? Is the patient at risk of breast cancer? And it does not talk about the myriads of stages, but now some universal cancer testing and multi-gene cancer testings, a work is going on with the help of precision medicine, which will tell us actually what will be the future of cancer patients, and if we could directly decide the treatment of such patients. Now, you are in OnQuest lab, Dr. Pooja, and there is always a debate going on between, like, I think after, if we say that what a difference an year can make, then I think COVID is an example. It completely changed the way we treat patients these days. It virtually took out the genie out of a bottle of telemedicine. And we always used to debate that I'm not touching the patient, I'm not feeling it. But when it comes to sending a sample, I think a sample also has an emotion. I mean, sample does not have an emotion, but for the family, every report matters, that today the sample has been taken, when will the report be available? So now, because you are looking after information technology and you must be streamlining the smooth flow of patients, so how do you ensure that all the samples are handled in a very empathetic and compassionate way? I'm raising a different point today. And all the reports are released on time, and we are using the technology to deliver the reports on time with minimal errors. So what is happening at your center?
First of all, thank you. So, Dr. Indu, I'm just Pooja. Thank you for mentioning Dr. Pooja, but yes, it's just Pooja. This is, I would say, a very well-crafted question, because you actually need that kind of empathy when you are handling the samples. And I still remember being a person not from medical industry, but from the IT industry, first time when I joined healthcare industry. I have total experience of 24 years, but around 13, 14 years back, I came from IT to a non-IT organization, basically from the consultancy to a non-IT organization into healthcare. And there, during my induction first time when I saw the histo samples, actually, I'm still getting the goosebumps. So that was the kind of thing I felt like, because cancer till that time, around 12, 13 years back, I was not as a person familiar to it. So yes, surely going through that induction and getting into this industry is a different experience altogether. As in doctors, as a medical fraternity, you all are very well versed with it. But when you talk about non-IT people, to make them understand that how the systems should run and how from the user point, you have to put yourself in their shoes so that all information should be communicated to them on time. That is very important. So we surely built in OnQuest also. We have tried to build a system wherein there is a connected healthcare system. Like we have around 30 plus labs pan India. So we've tried to build a system wherein there is a connected healthcare. All the information from sample collecting till sample process that is being sent to the patient, or if it is coming, like we are more into B2B, so it is sent to the B2B clients. We have a mechanism wherein the information, if there is something, consents required, because and this consent is as on date, yes, it's very important to get consents on some of the medical reports, but going forward with digital data protection law coming into place, taking a consent would become very utmost important. So building that kind of systems wherein all such locks are there with minimum, I would say, minimum kind of intervention from the other departments and maximum utilization for external and internal customers. That was actually the way wherein we tried to build in a system. So in our system itself, whether it is LIMS or it is any of our CRM systems wherein the customer care department is providing altogether information back to our clients. So we have a complete transparency so that none of our customers faces any such kind of issues. Now going forward also, what we are coming up is, because AI is playing now a very important role. So we've started evaluating the systems wherein actually a maximum of our slides, so that we could provide results within TAT. I would say rather before TAT. That is the main concern for us. So with the help of AI systems, we are trying to build in wherein the slides, where with the positive and negative analysis that the doctors have devised for us. So basis that can be captured, and there would be less of work that has to be done, and the algorithms can be built in the system, and the actions can be taken place with a faster response. So that's the kind of technology we are trying to use with the help of vendors and other AI players which are available in India. So we've just started working on it. That's the point.
So I think you talked about TAT. And that's a very, very important thing, because whenever you send a biopsy, the report takes around 7 to 8 days. The patient and the family might be sitting at home with that painless lump for years together or for many months. But the moment you tell them that it could be cancer, then every day, every minute it matters to them. So I think, but the problem that I've seen with most of the labs is that a sample goes there and nobody knows what has happened to that sample. So the patient will keep on calling the hospital. They will say, "Haan, kal aa jayegi report. Haan, ma'am, parson aa jayegi report. Haan, ma'am, 3 din mein aa jayegi." And the patient keeps on calling the doctor because we are accessible to them, but not the lab people.
Right.
So because we have so many medtech companies here, and we are talking about AI, like Uber, you open that app and you know what is the exact status of the Uber, where is your taxi waiting. So it gives you account by account where exactly you are there. So if we could incorporate something like that a simple message could be triggered, and a simple SMS would go that your slide has been processed, it has now moved on to this counter, and this report would be available. So I think that would allay the anxiety of many patients. So I think we should work on those lines.
So actually, internally we are working, but now something what happens is, again for our case, because we are connected with B2B, more of B2B. Now we can provide that information back to our client. Now how the client is communicating back, that becomes again a problem for us. So surely, but what we are trying is, that is again a step, next step of action that we have planned for this year. We've created a portal, a B2B portal also, wherein such stages which have been identified, I'll not say all 15-20 stages which are being captured in the limbs, but still we have tried to make it like at least 6 to 7 major stages that should be captured and that should be visible on the portal, so that the client knows where exactly the sample is, and also the TAT, so that, and in case if there's a TAT delay, that is being informed beforehand instead of they following up that there's a TAT delay or the report is not being delivered. So we have created a mechanism wherein if there is a TAT delay, the department informs the CCG, and our CRM team through our internal portals, they are sending back the messages. So that's the kind of technology we have started building.
I think that's a good move, and that's a move in the right direction. Moving on to Mr. Manoj, do you think that the development of products now will be driven by business goals instead of clinical needs, the art of engineering and physical principles? What do you see the future of healthcare? Would it be mainly depending on business goals and art of engineering and physical principles?
Yes, basically the healthcare, this subject is only taught when somebody is studying medicine. Yeah, and when we see the curriculum of a school, school-going student, there is if the student is a bio student, yes, of course, they are studying, few things. If it is a non-medical student, where is the, thought process? Where is the, education? It should be, we should actually, come up with a curriculum where everybody is aware of, the subject, healthcare. This is a main. Health is wealth. If your health is good, then only, your future will develop. Yeah. And now youngsters are, even the kids are developing with the lifestyle, with the food habits and all. They come up with so many things. Even the young children develop diabetes, these days. So the education plays a very important role, and it should be in the system. Yes, there are awareness classes in the schools when the school, the school authorities, they time to time, call the outside agencies who deliver 1 hour lecture or 2 hour lecture, but that's actually not helping, and there has to be a, some system where the education, at least 1 chapter or 2 chapters should be there, in the course curriculum, which actually, gives a basic knowledge to the non-medical students also. Like in the 11th class or 12th class, or in the college where, the people are going for a BBA classes or, some other, where is the education? There is no education. And this disease basically, develops in your body from the early stage, and nobody is aware. Everybody, goes to the system, goes to the diagnostic labs or to the doctors when they have, some internal issues, when the body react, something. So the awareness has to be there that time to time everybody should go for a diagnostic. And if we talk about medical tourism, in the foreign countries, yeah, of course, biopsy. We have seen, countries, some countries, I don't want to name them, where there is no biopsy available. Actually, you talked about detecting the, cancer in the early stage. They don't know anything. They just go for, simple CBC test and all, some blood testings and all, and they get some indication, and then they travel straight away, and we have to do the testings, and they are surprised to see that, it's a 3rd stage cancer now. It's too late actually that time.
So I think health education is the word that I get from you, and I think Commander Bali talked about preventive oncology, health education. These are definitely very, very important. So we are having a session on innovative technologies. Now all the hospitals, I would not say they're working for profit, but maybe I heard it in one of the meetings that profit with a purpose. So wherever we are working, it's a profit with a purpose. So Commander Bali, how do you think that medtechs, definitely they have to work together, the doctors, they have to work together with medtechs, and it has to be a close collaboration between all. But innovation is something very important. Like if I am treating a patient, I know exactly what my patient needs. So I have to be involved in the innovative process. So do you have any process of innovation in Clear Medi group of hospitals? Like where you say that, okay, this week we are going to have an innovation week where we'll have some idea author, some idea champions, or something like that to have the culture of innovation, which is being there in Toyota or automobile industry. So I haven't seen that happen in most of the hospitals, specifically the corporate hospitals. In some government setups, there is of course a lot of research work is happening, but now because of the busy OPD schedules, we don't even have time. Even if I want to do some innovation, I don't have time. So do you think we can develop this culture of innovation, and what are your points on that?
See, innovation is a word which is very often used from our school days to everywhere, and everyone wants to innovate. There is not a single person sitting anywhere who says that you won't innovate. Innovation happens at different levels. For example, I'll just give you a small example, and you talked about Clear Medi. So I'll tell you 2-3 places where I'm just giving you 1 or 2 examples where we are thinking about. There was an Israeli guy whom I met through my LinkedIn profile, I'm on LinkedIn page, and he wanted something revolutionary being done in Israel, and he wanted to bring it to India. And you won't believe it, it'll come as a very pleasant surprise to you. That's using dogs to detect cancer. And so we are now greatly involved in him. And can you imagine a set of dogs, and now they're setting up a center in Bangalore, and which will cater for our Mysore hospitals. Let's say you have 100 masks, taken, which are sterile masks, to a small village, and just make the villagers wear masks, that's all. And you take away these masks, again seal them and bring them to this dog center, the canine center, where they have trained dogs, and they are made to smell these masks, all right? So you're not taking any blood, you're not taking any invasive thing, nothing about it. And this test, which they are now, so clinical trials are on, and ethics committee approval has been given, including your SPCA, giving your dogs cannot be harmed and things like that. And it's almost like 99.9%, a significance value for positivity, and almost 98 point some percent for negative values. And the test costs just about 100 rupees or maybe less than that. I mean, so this is an innovation happening, or a step happening towards innovation at a very, very different level, which maybe another 1 year or 2 years from now is going to develop into something which all of us will see. Now, on a day-to-day working level, I'll just give a small example. And by the way, I'm so surprised to see interest levels after 1 year, 1 hour of this discussion in oncology. It's such a serious topic, but every one of you is listening so patiently. Thank you for that. So on a day-to-day level, there's something called a tumor board, if all of you are aware of a tumor board. A tumor board is truly speaking, every cancer patient must 100% of the times be subjected to a tumor board, because a radiation oncologist, a medical oncologist, a surgical oncologist, the lab and the diagnostics, every one of them has to be on the same page. Is the patient given or will be subjected to the right kind of treatment, despite the fact there are very set onco principles in the world? Now, tumor boards in most of the hospitals are unsuccessful because either they happen weekly, some of them try to do it monthly, some of them try to do it some other way. And usually, to get every one of these doctors together is a big challenge. It just is impossible. Sometimes you won't have the medical oncologist, sometimes you won't have the lab doctor, sometimes you won't have it. So one of the things that we are trying to do, not yet there, is that it's a concurrent tumor board where you have a software or an application where all the patient data, including all the reports, are available on a platform which is available to all these doctors on a real-time basis, and you put your remarks on it concurrently. And so when you have an agreement amongst everyone, it is a green or yellow or whatever color coding you can use, or whatever, alarm or a buzzer, whatever you can use. And whenever there is a disconnect between, let us say, a radiation oncologist says that first we should have a radiation, or a surgeon says that first surgery, then a chemo, or a chemo and then a surgery, then you have a discussion on that specific patient, then you come to a conclusion which, is to the patient's favor. And this is something that we are trying to do as an innovation, as you spoke about. And many times the innovations are not something that many of us do it, because in our daily hustle and bustle of what we're doing, the OPDs, the IPDs, taking care of business and things like that, they are to the background, but still we are trying to do. Talking about for profit, no private venture can survive without profits. And I can put this on the table today in front of every one of us. Profit is not a bad word at all. If I'm not doing an 18% to 20% EBITDA in a corporate healthcare, that hospital won't survive at all, because I can't bring new machines, I can't pay to my vendors, I can't pay to my people, employees and things like that. So I'm going to be a dead organization. So for sure, I would love to have a profit. Of course, I'm an ethical way of doing things, with high integrity, making sure that I survive as an organization, and that's why profits are so very important. Thank you.
Summed it so well. So profit with a purpose is that makes it. I think we are running out of time, so I would like to close a bit with these remarks that rapid digitization, expanding innovation, health tech platforms, partnerships between startups and establishing companies, and favorable funding environments for viable businesses, business models supported by government initiatives will be the major growth drivers in digital health arena. And I would just sum up everything that we discussed in this panel, right from education starting at the school level, not just for students who have medical subjects in their school, but starting from that to health education, to prevention, to getting the patients right, delivering the reports on time, and cancer detection by Phantom or other tests which are available, then offering precision medicine services, engaging patients from outstations, opening centers in tier 2 and tier 3 cities, digitization, telemedicine, telehealth, AI, virtual simulations, and I think mobile digital health, chatbots, virtual assistants. These are all the things which will drive the healthcare in future. And I had really a very, very interesting panel, and I personally learned a lot from all of the major trailblazers here. Thank you so much to IHW for giving me this opportunity.
I really want to thank you, Dr. Indu, to stitch this together. It's such a serious topic. It's not a romantic topic at all. At the end of the day, in a very gloomy evening, and still to make it so interesting, really, really kudos to you, because it would have been very, very difficult to make it so interesting, and so really thankful to you for that.
Thank you so much, sir. It makes my day.
Thank you very much indeed. Ladies and gentlemen, let's once again put our hands together for that insightful discussion we had in this session, as I would now like to invite Ms. Nikki Gupta, CEO Teamworks Communications, to kindly do the honors of felicitating our dignitaries on the days. We would like to present a token of appreciation to our distinguished moderator for the session, Dr. Indu Bansal Agarwal. Thank you very much indeed, ma'am, for that wonderful moderation. We present a token of appreciation to Commander Navneet Bali. Thank you, sir, for all those valuable inputs we had from you in this session. We present a token of gratitude to Dr. Manoj Mittal. Thank you very much indeed, sir. And to Ms. Pooja Chatrat. Thank you, and may I request all our panelists to kindly come together for a group photograph, please. So, ladies and gentlemen, with that we have come to the end of our panel discussion. this session and also all the panel discussions of the summit. We now from here move onwards to the awards and would request everyone to kindly remain seated. While we are getting settled for the award presentation ceremony, we would like to present few videos or short films to you. Kindly sit back, relax and enjoy these short films that we are going to present now.
Where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good health care for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
at a time. When world leaders will converge for Summit of the Future Action Days at UN headquarters in New York, IHW Council and its partners present the world's first Sustainability Hour, a platform where SDG champions take the stage to share their stories that drive change. From grassroots movements to groundbreaking innovations, turning global goals into local realities. Now, it's not just talking about sustainability, but transforming it into tangible impact. Be part of this pivotal moment where global visions meet grassroots action. Together, we build a sustainable future, one story at a time.
Ladies and gentlemen, I hope you enjoyed all those videos also which showcased our upcoming event on 21st of September in Dubai. So ladies and gentlemen, while we are waiting for dignitaries to join us inside for the award presentation ceremony, we also present you a small video by Paras Health. Thank you. Thank you very much indeed. And now, ladies and gentlemen, the moment we all have been waiting for since morning is the award presentation ceremony. Namaskar and good evening and a very warm welcome to the Smart Hospitals and Diagnostics Award Ceremony. Ladies and gentlemen, we welcome you to this award presentation ceremony where we come together to celebrate excellence, innovation and leadership in the healthcare industry. Tonight, we honor those who have shown and crossed the boundaries of innovation, have set new standards in patient care, and demonstrated exceptional dedication to improving the healthcare system. So, ladies and gentlemen, before we move ahead, I would like to invite our special guest on stage, Ms. Sujaya Krishnan, former Joint Secretary, Ministry of Health and Family Welfare, Government of India. Let's put our hands together to welcome ma'am. Also, I would like to invite Ms. Kamal Narayan, CEO, IHW Council. And before we begin, I would like to take a moment to express our deepest gratitude to all our partners, our jury members and our sponsors for their contributions in making these awards successful and possible today. And as we begin the awards, ladies and gentlemen, the first category of awards. So, ladies and gentlemen, we have our jury members on the screen. You can see them. Mr. Sanjeev Malhotra, Mr. Sriram Iyer, Mr. Sunil Thakur, Mr. Arvind Vaishnav, Dr. Varun Jhaveri, Dr. Harsh Mahajan, Dr. Nilesh Shah, Ms. Meena Ganesh, Mr. Anand K, and Mr. Dilip Mangsul. Let's put our hands together for all of them once. So, ladies and gentlemen, can we just dim this light a bit? Thank you. So, we begin our first category of awards. Can we dim this light, please? It's too much on my eyes. I can't read. Thank you. The first category is clinical data management, and the silver award for this category is presented to Manorama Infra Solutions Private Limited. Let's put our hands together for them. Manorama Infra Solutions Private Limited is awarded as a clinical data management solutions provider for its innovative solutions in managing clinical data. Their advanced systems streamline data collection, analysis and reporting, supporting high-quality research and clinical outcomes through efficient and accurate data management. So let's put our hands together for them, ladies and gentlemen. The next category of award is Smart and Future-Ready Manufacturing Multi-Speciality Hospital Standalone, and the Gold Award for this category goes to Akash Healthcare. Akash Healthcare is honored as a Smart and Future-Ready Multi-Speciality Hospital Standalone for its pioneering use of technology to elevate patient care and hospital management. Their standalone facility showcased advanced smart systems and innovative solutions, providing exceptional multi-speciality services and setting a high standard for future-ready healthcare. Once again, let's put our hands together for them. And ladies and gentlemen, the next category of award is the Smart Sample Collection and Processing Solutions, and the Bronze Award in this category goes to Srishti Medical Private Limited. Srishti Medical is being recognized for its innovative contributions in the category of smart sample collection and processing solutions. The company has revolutionized the way samples are collected, processed and analyzed by introducing cutting-edge technologies and enhanced accuracy, efficiency and patient comfort. So let's put our hands together for them. So ladies and gentlemen, before we announce the next category and the award of today's evening, we would like to inform that today, as you all know, we've been having a bad weather situations as in Delhi as well as in Gurgaon. There has been torrential rains, a lot of roads are blocked and waterlogged. So some of our distinguished awardees, recipients could not be present here this evening. In fact, they so much wanted to be here but could not reach. But nevertheless, in their absentia also, we would like to acknowledge their contributions and their achievements. So with that, we move on to the next category of awards, which is the Smart Ambulance Solution Provider. And the award for this category, first for the bronze, goes to Editors Healthcare Private Limited. And the Editors Health Tech Private Limited is being recognized for its excellence in the ambulance services category, pioneering a tech-driven approach. Editors Health Tech has transformed emergency medical transport with a focus on precision, speed and patient-centric care. So let's put our hands together for them. And ladies and gentlemen, in the category of Smart Ambulance Solution Provider, the Silver Award is presented to Senzo Healthcare. Senzo Healthcare is being honored for the outstanding contributions in the category of Smart Ambulance Services with a focus on rapid response, patient safety and advanced medical care. Senzo Healthcare has set new benchmarks in emergency services. Their fleet of state-of-the-art ambulances is equipped with cutting-edge technology and staffed by highly trained medical professionals, ensuring timely and efficient care during the critical moments. A round of applause for them, ladies and gentlemen. Moving on to the next category of awards, which is AI-driven screening app solutions, and the bronze award in this category is presented to Tap Health. Tap Health is being recognized for its AI-driven screening app solutions, revolutionizing early detection and diagnosis in healthcare. The app leverages cutting-edge artificial intelligence to provide accurate real-time health screenings, enabling timely interventions and personalized care. By enhancing accessibility and precision in diagnostics, Tap Health is shaping the future of preventive healthcare. Congratulations to them. And the next category of awards is the AI Solution Provider in Radiology. And the bronze award in this category is presented to Alkenis Technologies Private Limited, which are being honored as a leading AI solution provider in radiology for its innovative approach to transforming diagnostic imaging. Their advanced AI-driven solutions enhance the accuracy and speed of radiological interpretations, empowering clinicians to make more informed decisions and improving patient outcomes. A round of applause for them, ladies and gentlemen. The next category, we have two awards, which is the Digital Initiative for Patient Education, and the Bronze Award is awarded to Dr. Agarwal's Eye Hospitals. Dr. Agarwal's Eye Hospital is being recognized for the exceptional contributions in the category of Digital Initiative for Patient Education. Through innovative digital platforms, they have transformed how eye care information is delivered, providing patients with easy access to comprehensive resources on treatments, procedures, and preventive eye care. Congratulations to Dr. Agarwal's Eyes Hospital. And ladies and gentlemen, the Silver Award in the category of Digital Initiative for Patient Education is presented to Artists for Her. Artists for Her is being honored in the category of Digital Initiative for Patient Education for their groundbreaking efforts in utilizing technology to educate and support women's health. Their digital platform offers accessible, personalized content on various aspects of women's wellness, from reproductive health to preventive care, enabling women to stay informed and take charge of their healthcare journeys. Ladies and gentlemen, let's have a huge round of applause for Artists for Her. And ladies and gentlemen, before we move ahead with the presentation of the rest of the prestigious award, I would like to request Dr. Hema Divakar, Advisor, Apex Advisory Board, IHW Council, to kindly join the dignitaries on the stage and kindly do the honors of presenting the awards along with them. Thank you, ma'am. So we move on to the next category of award, which is AR and VR solutions for healthcare education and patient care, and the Silver Award is awarded to Ingram Micro. Ingram Micro is being recognized for its pioneering work in the category of AR/VR solutions for healthcare education and patient care. By integrating augmented and virtual reality technologies, Ingram Micro is transforming medical training and patient care experiences. Their impressive solutions provide healthcare professionals with advanced simulation-based education, enhancing critical skills and decision-making. And the next set of awards, ladies and gentlemen, the next category is for Innovative Diagnostic Solutions Provider, and the Silver Award in this category is presented to Pi-Star Tech Private Limited, which is being recognized as an innovative diagnostic solutions provider for its groundbreaking contributions to the healthcare diagnostic industry. So please keep the applause going for them, ladies and gentlemen. The next category of award is Smart and Future Ready Diagnostic Brand, and the Gold Award is awarded to Agilus Diagnostics Limited. Agilus Diagnostics is being honored as a smart and future ready diagnostic brand for its visionary approach to healthcare diagnostics, leveraging advanced technologies, automation, and data-driven insights. So ladies and gentlemen, please put your hands together for Agilus Diagnostics Limited. The next category of awards is Smart Admission and Discharge Processing, and the Gold Award in this category is presented to Indraprastha Apollo Hospital, which is being awarded the gold for smart admission and discharge processing. This hospital has excelled in streamlining and digitizing the admission and discharge processes, utilizing advanced technologies to enhance efficiency and patient experience. Ladies and gentlemen, the next category of awards, we have 3 awards. The category is robotics for patient care, and the bronze award for this category is presented to Paras Health. And may I invite Dr. Abel George, the facility director, Udaipur Paras Health, to kindly come up on the stage and receive the award. Paras Health Udaipur is being recognized for its outstanding achievements in robotics for patient care. The hospital has integrated cutting-edge robotic technologies into its patient care processes, enhancing precision in surgeries and improving overall patient outcomes. The next award in this category, the Silver Award, is presented to Regency Multi-Silver Super Speciality Hospital, Kanpur, which is honored for its exceptional use of robotics for patient care. The hospital has embraced advanced robotic systems to optimize surgical procedures and patient management, ensuring greater surgical procedures and patient management, which ensures recovery speedy, reduced recovery times and enhanced safety. And ladies and gentlemen, the Gold Award for the category of robotics for patient care is presented to Indraprastha Apollo Hospital. Indraprastha Apollo Hospital is being celebrated for its excellence in robotics for patient care. The hospital has successfully implemented advanced robotic technologies to refine surgical techniques and patient treatment plans, resulting in improved outcomes and efficiency. Let's put our hands together for them, ladies and gentlemen. Moving on to the next category of award, which is Smart and Future Ready Cancer Hospital. The Silver Award in this category is presented to Paras Health, Panchkula. And may I invite Dr. Pankaj Mittal, Facility Director, Panchkula Paras Health, to kindly come up and receive the award. Paras Health Panchkula is being honored as a smart and future-ready cancer hospital for its innovative approach to cancer care. The hospital has implemented cutting-edge technologies and smart systems to enhance diagnostics, accuracy, treatment precision, and patient management. The next category, Smart and Future Ready Cancer Hospital Rural. The Silver Award is presented to Ujala Cygnus Central Hospital, Haldwani. It is being recognized as a Smart and Future Ready Cancer Hospital Rural for its pioneering efforts in bringing advanced cancer care to rural areas. The next category, ladies and gentlemen, is of patient-centric smart hospital design. We have 2 awards in this category. The Silver Award is presented to Mediarc Consulting Healthcare Engineers. They are being awarded the silver in patient-centric smart hospital design for the exceptional approach in designing healthcare facilities that prioritize patient needs. Ladies and gentlemen, the Gold Award in the category of Patient-Centric Smart Hospital Design is presented to, once again, Paras Health and Paras Health Kanpur, which is, I would now like to invite Dr. Soumitra Bhardwaj, the Regional Director, Paras Health Kanpur, to kindly come up to receive the award. This facility is being honored with the Gold in Patient-Centric Smart Hospital Design for their outstanding achievements in integrating smart design elements that focus on patient well-being. The next category, ladies and gentlemen, we have 3 awards, and the silver for telemedicine integration is presented to Ujala Cygnus Healthcare Services. It is being recognized with the silver award in telemedicine integration for its innovative approach to expanding access to healthcare through virtual platforms. Congratulations, and we have 2 gold in this category of telemedicine integration. The gold award is presented to Regency Multi Super Speciality Hospital, Kanpur, which is being honored with this gold award in telemedicine integration for its exceptional implementation of telehealth solutions. Ladies and gentlemen, please keep the applause going for all our well-deserving awardees who are coming up on the stage to receive the award. And the gold award is also presented to Indraprastha Apollo Hospital for its telemedicine integration for its exemplary use of telehealth technologies to transform patient care. The Hospital Advanced Telemedicine Platform offers seamless virtual consultations, remote monitoring, and integrated core solutions. So let's put our hands together for them, ladies and gentlemen. The next category is of Smart and Future Ready Derma Care Center. And ladies and gentlemen, in this category, the gold award is awarded to Skin Alive, which is being honored as a Smart and Future Ready Derma Care Center for its innovative use of technology in dermatology. The center leverages advanced digital tools and smart systems to provide state-of-the-art skin care. So ladies and gentlemen, with our first set of awards and categories done, we would like to convey gratitude and thanks to Dr. Hema Divakar. May I request you, ma'am, to kindly take your seat in the front. Thank you very much indeed for being here with us and for kindly giving away the awards. And now, ladies and gentlemen, the next award for Smart and Future Ready Nephrology Care Hospital, the gold, is presented to Paras Health, Darbhanga, and I would like to invite Dr. Arunesh, Raman, FD Paras Health, to kindly come up on the stage to receive the award. And now, ladies and gentlemen, the next award The next award, ladies and gentlemen, is for the category of Smart and Future Ready Multi-Speciality Hospital Chain, and the Gold Award in this category is presented to Paras Health Corporate. Paras Health Corporate, and I would like to invite Dr. Santi Sajan, Group CEO Paras Health, to kindly come up on the stage and receive the award. Paras Health Corporate is awarded for being a smart and future-ready multi-speciality hospital chain for its forward-thinking approach to integrating technology and smart systems across its hospital network. Their commitment to utilizing advanced digital solutions and data-driven insight enhances patient care. And now, ladies and gentlemen, the next category of award is for 3D printing in prostheses and implants, and the silver award for this category is presented to Akash Healthcare, which has established a state-of-the-art 3D printing facility known as Cure C3D. This cutting-edge technology is designed to support surgeons and clinicians in developing precise 3D models for complex clinical cases. The next category of awards, ladies and gentlemen, is Excellence in Pediatric Hemato-Oncology Care Innovation BMT Center. And the silver award in this category is presented to Fortis Memorial Research Institute, Gurugram, which is recognized for its innovative BMT Center. The institute has distinguished itself with its cutting-edge bone marrow transplant center, integrating advanced technologies and innovative treatments to provide superior care for pediatric patients with hematology malignancies. The next category of awards is Smart and Future Ready Neurological Hospital, and the gold for this category is awarded to Paras Health Gurgaon. I would like to invite on stage Ms. Seema Vik, Facility Director, Gurgaon Paras Health. The hospital excels in integrating advanced technologies and smart systems into neurological care, enhancing diagnostic accuracy and treatment effectiveness for neurological conditions. The next category is of Smart OPD Management, and the Gold Award in this category is awarded to Care Hospital, Banjara Hills. They are being recognized for Smart OPD Management. The hospital has implemented advanced digital systems to streamline outpatient department processes. The next category is Smart E-Future Ready Obstetric and Gynec Hospital, and we have two awards in this category. First, the Silver Award is awarded to Paras Health Ranchi, and may I invite Dr. Nitesh Kumar, Facility Director Ranchi Paras Health, to come up to receive the award. This is being awarded for being smart and future ready Obs and Gynae Hospital. The hospital's innovative use of technology and smart systems in obstetrics and gynecology care ensures advanced patient-centric services. And the Gold Award in this category is presented to Divakar Specialty Hospital, which is being honored for its exceptional integration of advanced technologies and patient-focused care in obstetrics and gynae. next category is of Smart Medical Waste Management Services. And the Bronze Award in this category is awarded to Care Hospitals Banjara Hills, which are being recognized because the hospital has implemented unique solutions for managing medical waste, ensuring safe, efficient and environmentally responsible disposable practices that enhance overall hospital sustainability and safety. The next category of award is Smart and Future Ready ER and Critical Care Hospital, and the Silver Award in this category is awarded to Paras Health Patna. And may I invite Mr. Anil Kumar, Facility Director Patna, Paras Health, to come up and receive the award. Paras Health Patna is being awarded the Silver for Smart and Future Ready ER and Critical Care Hospital for its exemplary integration of advanced technologies in emergency and critical care. Moving on to the next category, which also has 2 awards. The category is Smart and Future Ready Heart Care Hospital, and the Bronze Award in this category is presented to Paras Health Srinagar. May I invite Dr. Gautam Kumar Das, Zonal Director Srinagar Paras Health, to kindly come up on the stage. Paras Health Srinagar is currently providing cardiac care with significant advancements. The hospital's integration of smart technologies and modern systems enhances diagnostic accuracy, treatment precision, thus providing a robust foundation for future-ready heart care in the region. A huge round of applause for them, ladies and gentlemen. And the Gold Award in this category is presented to Indraprastha Apollo Hospital, Delhi. Indraprastha Apollo Hospital is honored for this award for its outstanding use of robotics and advanced technologies in cardiac care. The hospital's integration of cutting-edge robotic systems sets a gold standard, offering an exceptional precision in diagnostics and treatment. And moving on to the next category, which is Smart and Future Ready Renal Care Hospital. The Silver Award is presented to Regency Multi-Super Speciality Hospital, Lucknow. This is being awarded for its exceptional integration of advanced technologies in renal care. The hospital's innovative use of smart systems and digital solutions enhances the accuracy of diagnostics, treatment planning, and patient monitoring. For the next category, which is Smart and Future Ready Hospital Management, the gold is awarded to Paras Health Corporate. Paras Health Corporate is honored with the Gold Award for Smart and Future Ready Hospital Management for its outstanding achievements in integrating advanced technologies and smart system into hospital management. Their commitment to innovation streamlines operations, improves efficiency, and elevates the overall quality of patient care. So, ladies and gentlemen, a huge round of applause for the team of Paras Health Corporate coming up on the stage to receive the Gold Award. Once again, congratulations And ladies and gentlemen, with that, we have come to the final category of awards, which is, I think, one of the most prestigious and most special award, because this award is of the individual category, and the award is being awarded for Smart Healthcare IT Innovation Leader. And the award is presented to Mr. Vineet Agarwal, who is the Chief Information Officer, Paras Health. Ladies and gentlemen, a huge round of applause for Mr. Vineet Agarwal. Mr. Vineet Agarwal is the Chief Information Officer at Paras Health, is being honored as the Smart Healthcare IT Innovation Leader for his visionary leadership in advancing healthcare IT solutions. Under his guidance, Paras Health has successfully integrated technologies to enhance patient care, streamline operations, and improve data management. Mr. Agarwal's commitment to innovation and excellence in IT has set new benchmarks for smart healthcare, making a significant impact on the future of digital health solutions. Once again, ladies and gentlemen, a huge round of applause to Mr. Vineet Agarwal and all our awardees, as I would like to invite everyone to kindly come up on the stage for a group photograph. Can we have? And before the group photograph, ladies and gentlemen, I would request Mr. Kamal to kindly felicitate and do the honors of presenting a token of our gratitude to our very special guest, Mr. Jaya Krishnan, who is the former Joint Secretary of Ministry of Health and Family Welfare, and she's also our guest of honor for this prestigious award. Thank you very much indeed, ma'am, for gracing this occasion. Ma'am has been with us right from the inauguration till the end of this day. She began this wonderful event with her inaugural address. And now I would like to invite ma'am to kindly say a few words for the motivation. Inviting all our awardees to kindly come up on the stage for a group photograph. All the awardees to join our dignitaries for a group photograph. Kindly carry your trophies with you. Thank you. Requesting everybody to kindly carry their trophies with them. Ladies and gentlemen, that brings us to the end of Smart Hospitals and Diagnostics Awards ceremony, and heartfelt congratulations to all our awardees and nominees. Your work is transforming the healthcare industries, and we are all deeply grateful for your dedication. Ladies and gentlemen, I also take this opportunity to once again thank all our distinguished moderators, all our eminent panelists, and